Good morning. Welcome to the first hearing of Portfolio Committee number 2 for the Inquiry into Budget Estimates 2024-2025. I acknowledge the Gadigal people of the Eora Nation, the traditional custodians of the lands on which we're meeting today. I pay my respects to elders past and present and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of New South Wales. I also acknowledge and pay my respects to any Aboriginal and Torres Strait Islander people joining us today. My name's Dr. Amanda Conn and I'm Chair of the committee. I welcome Minister Jackson and accompanying officials to this hearing. Today, the committee will examine the proposed expenditure for the portfolios of, those aren't the right portfolios, mental health, youth, housing, homelessness, and the North Coast. And water.
Don't worry, we haven't forgotten water.
With apologies, my script had Minister Park's portfolios listed. I ask everyone in the room to please turn their mobile phones to silent. Parliamentary privilege applies to witnesses in relation to the evidence they give today. However, it does not apply to what witnesses say outside of the hearing. I urge witnesses to be careful about making comments to the media or to others after completing their evidence. In addition, the Legislative Council has adopted rules to provide procedural fairness for inquiry participants. I encourage committee members and witnesses to be mindful of these procedures. Welcome and thank you for making time to give evidence today. All witnesses will be sworn prior to giving evidence. Minister, I remind you that you do not need to be sworn as you have already sworn an oath to your office as a Member of Parliament. For all other witnesses, could you please state your name and position title and swear either an oath or affirmation, starting on my left, please.
Dr. Murray Wright, New South Wales Chief Psychiatrist, and I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Brendan Flynn, Executive Director of the Mental Health Branch at New South Wales Health. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Deborah Wilcox, Deputy Secretary, Health System Strategy and Patient Experience. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Rebecca Pinkstone, CEO of Homes New South Wales. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Amanda Jones, Sec Water. I solemnly and sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Michael Tibble, Secretary, Department of Communities and Justice. I swear that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth, so help me God.
Michael Wheatley, Acting Head of Housing Portfolio, Homes New South Wales. I swear that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth, so help me God.
Famie Williams, Chief Executive for the Aboriginal Housing Office. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Darren Cleary, Managing Director at Hunter Water. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Roch Giroux, Managing Director of Senior Water. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Andrew George, Chief Executive Officer of Water New South Wales. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Grant Barnes, Chief Regulatory Officer for the Natural Resources Access Regulator. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Zoe Robinson, the New South Wales Advocate for Children and Young People. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
And Chair, Ms Kate Marr, who is the Deputy Secretary of the Premier's Department, is unwell, so she won't be here for this morning's session. I'm obviously happy to answer questions about the North Coast portfolio, but I understand that she will be able to participate electronically for this afternoon's session.
The committee has received and noted her apology this morning.
Thank you.
Yeah, that's fine.
That's fine? Yeah, thank you. Yeah.
Today's hearing will be conducted from 9:15 to 5:30pm. We're joined by the Minister for the morning session from 9:15 to 1 with a 15-minute break at 11. In the afternoon, we'll hear from the departmental witnesses from 2 to 5:30 with a 15-minute break at 3:30. During these sessions, there'll be questions from the opposition and crossbench members only, and then 15 minutes allocated for government questions at 10:45, 12:45 and 5:15pm. And we're starting with questions from myself today. Last week, the government responded to the mental health inquiry that was conducted by this committee, and the government supported 24 of our 39 recommendations. In that response, you stated that health, ambulance and the police are exploring options for a future model to ensure people experiencing mental health distress in the community receive a health-led response. Where is that work up to?
Well, first of all, can I thank you for the work of the parliamentary inquiry. It was really a useful piece of work that contributed to a range of the discussions that we were already having, but I think the evidence that you were able to provide was incredibly useful. We have got a senior level officers group across New South Wales Health, representing both the mental health branch and New South Wales Ambulance, working with New South Wales Police on exactly that piece of work. And I've stated publicly here at Budget Estimates and elsewhere that I'm really committed as the Mental Health Minister alongside the Health Minister and the Police Minister to leading that response. But there's no tricks or funny language in the response that we've given. We want a health-led response. We recognise, as do the police, that the current arrangements are not in the interests of consumers, they're not in the interests of carers, they're not in the interests of first responders. It does take a little bit of time, Chair, because as we move away from police as the lead responders in, as you know from the evidence that you received, thousands and thousands and thousands of mental health responses to a health-led response. There are resource implications to that. There are training implications to that. Who is triaging the calls and making decisions about what the appropriate response is? Those are not things that can be done quickly. When if they are done quickly, I think they'd be done badly. So I do understand your concern to make sure that this happens and the urgency that you bring. I want you to know that I share that, but that I don't want to leave our police, our ambulance and our mental health clinicians with a system change that has not been properly developed. But that development is happening right now, and it's happening at a senior level, and we anticipate that we will have a new model to go to Cabinet, which we'll need to approve because it's quite a significant change by the end of this year.
And the committee greatly appreciates the commitment that you've made to this change. I suppose my follow-up question is about those potential resourcing implications. We heard that in so many instances, the police know that they're not the most appropriate response, but they may be the only emergency service available in a particular rural area or with capacity to respond in other areas. I've certainly had my own personal experience of phoning an ambulance for somebody I found on the street who needed medical attention and having a police car sent to that incident. For community mental health services that are already dramatically under-resourced and understaffed, is as part of that work any additional resourcing going to be allocated to support those health workers to take on this extra work?
I mean, there will have to be a resource consequence to the decisions that we make. That goes without saying. I mean, your point is exactly right. I cannot support a system in which the police no longer respond. We are expecting mental health clinicians or ambulance to respond, but there are no additional resources on top of those already allocated to those agencies to do that work. That is evidently not going to be in the interests of those responders or the consumers. So there will have to be resource implications for a change, which is why it's not a change that can happen quickly, because we don't want to lump a whole bunch of additional work, challenging work as well. You know, responding to mental health call-outs is not straightforward. I mean, it's absolutely work that should be done by health experts, but it's challenging work without additional resources. So yes, I accept your proposition. We can't just assume that community or government mental health services that are already stretched will be able to take that on without additional resources, and that's what we're working through.
Thank you. I look forward to following that up at our next estimates. Moving to some of the other recommendations of the inquiry. One of those recommendations was that the government consider establishing a centre of excellence for research, training, clinical supervision and support in order to deliver specific evidence-based therapies in trauma-informed care. In the government's response, you cited the trauma-informed mental health care organisational self-assessment tool from the ACI. That's absolutely a good thing for services to be aware of their capabilities. But what happens next when that capability is assessed as poor?
Yeah, I mean, I think, so there is two parts to that question really. What's happening currently? And look, I do have a lot of confidence in the ACI and the Clinical Excellence Commission and other parts of New South Wales Health who do engage with services and LHDs when there are performance issues. I've met with representatives in the leadership of both those agencies, and I know their deep commitment to resolving those kind of issues. So I do have a lot of confidence in them. Having said that, I think that the recommendation around Centre for Excellence does have a lot of merit. I mean, at the moment, as you know, we're talking about the budget that we've just delivered. There's not money for that proposition in this budget. That's not something that we have resources for right now. But I do think that the evidence that was received by the inquiry and my own experience suggests that that is a valuable idea. I mean, I think something like the Chris O'Brien Lifehouse model, which, you know, provides that kind of comprehensive cancer care service, you know, a place for research, a place for treatment, a place for all of that to come together, has really demonstrated that there's a lot of value in that model. So we do have pretty well established processes now about how we intervene when we do see performance that does not meet the high standards that we'd like. I can ask Dr. Wright and Dr. Flynn to elaborate on that, although perhaps you might want to go through that this afternoon. I do understand that. But they will be able to talk to you, Dr. Conn, about just how engaged some of those organisations are when we see performance standards that fall below what we would like to see. So they can talk to you about that this afternoon. But as I said, and we have talked about the idea of future planning on some kind of model there. The model that we have with UNSW and some of the work that we do around there, the Black Dog Institute, UNSW at Prince of Wales, has elements of that multidisciplinary centre for excellence, and I think it works quite well. What you've recommended through the inquiry is an even more comprehensive version of that. There isn't money for that in this budget, but it is an idea that has merit.
Thank you. Is it something that you'll be advocating for in the next budget?
Look, I advocate for many things through the budgetary process, probably not going to flag those at this stage. We're just kind of bedding down the implementation of this budget. We're not quite in the process of developing our proposals for the next budget. But I take on your view and the committee's view that model has a lot to recommend it, and I'll work that in with the other advocacy that we are doing. I mean, you know, Dr. Conn, it is challenging because, as I've readily recognised, there's a lot of things in the mental health system that are underfunded, and we would like to advocate for more through the budgetary process. This is one, but we have to weigh that up against our other important priorities in this space.
The committee also received a lot of evidence around federally funded programs like the Better Access Scheme, and in the government response you noted that the Better Access evaluation highlighted barriers to access for people in rural and regional areas, older people and people who are financially disadvantaged. The government response said that New South Wales will advocate to the Australian government to enable better outcomes for the people of New South Wales. What conversations have you had with your federal counterparts about this?
I've had multiple conversations with both Minister Butler and Assistant Minister McBride about these issues, including raising it alongside Ryan Park at the recent joint health and mental health ministerial council meeting. Look, we're not backwards in being forwards to the Commonwealth, whether it's in housing and in mental health. There are huge challenges on the New South Wales budget. You've heard it all before from my colleagues, but it's genuine and it's real. And we have been very clear to the Commonwealth that we feel as though the historical delineation of them funding primary health care and us funding secondary or tertiary health care in the mental health space is failing consumers, that the GP access part of that, the primary healthcare access part of that, is not adequate, is underfunded. Obviously doesn't work if you can't access a GP, either because there's not one available or because there's a cost barrier, and that the consequences of that failure are falling more on our services. And our services, whether it's emergency departments, whether it's community health services that we fund, are struggling to cope with that. So we've been very clear to the Commonwealth that primary healthcare in the mental health care space is of huge concern to us. Look, I think they hear that. That it was a productive and a good discussion at the recent ministerial council meeting. There was, there wasn't money put on the table. Of course, this is disappointing to me. I always like to walk away from those opportunities with funding for New South Wales. I'm sure the other states feel the same. The good news was there was a commitment to much more regular, specific mental health ministerial council meetings. I feel like this is a positive development. There have not been them. Mental health ministers have not been coming together for some time. So the advocacy that we are doing is very forthright. It's relatively public. I'm not just talking to them behind closed doors. I'm making public statements about how we expect them to step up and fill the glaring gaps in the provision of primary health care for mental health services.
Thank you. I'd like to come across to the service plan for people with eating disorders, which was a really excellent and welcome initiative, but of course it's due to expire next year. Will you fund this important work beyond 2025?
So we are very committed to more work in eating disorders. Yes, the continuation of the current service plan, but also potentially more work. I think that service plan is good. I've had a number of discussions with Inside Out, who are partners with us in the delivery of that, and other organisations like the Butterfly Foundation, about how we can look to do more. I think there are some gaps in the availability of care, even under that service plan. I think our clinicians have made real strides recently, but from what I hear, there's still reticence from some parts of the system to provide the kind of comprehensive care that we would expect for people with eating disorders. So I know that there's quite a lot of work to do. We're pleased to be able to open soon our new residential facility up in Charlestown. That's obviously a new thing, a first time that we're providing a public health facility of that nature for people with eating disorders. So we're obviously hopeful that's going to be a success. And that's going to fill one of those gaps that I've talked about, people who need more than just a kind of engagement perhaps with a GP or another clinician, but are not necessarily at the stage of needing to be hospitalised, and obviously we want to avoid that. So yes, in answer to your question, we will be continuing that work, but it's not even just about necessarily continuing what we're doing now. It's about exploring opportunities to do more. And I should just say, the next Mental Health Ministerial Council meeting will have a dual focus. One of those focuses is children and young people and mental illness. And I indicated at the Ministerial Council meeting that we had recently that I'd like eating disorders to be part of that. It's obviously not just an issue for children and young people, but it is a particular issue for adolescents. And they were very open to that. And I'm keen to raise the issue that was highlighted in relation to the inadequacy of funding for research in eating disorders, which I know has been raised with me, and request made to advocate for the Commonwealth to have a fairer allocation of research funding to eating disorders. And that's something that I'm keen to put on the agenda there.
Thank you. And can I just clarify, you referred to the facility being built at Charlestown. Is that the one that's being currently built with federal funding?
I don't know if that is federal funding. It is federal funding, Ms Wilcox, yes. Have we contributed money to that, or did we contribute land?
I'll have to come back to you on
Yeah.
what
Yes.
the land deal was.
Yes, that's right. It is the one. That's right.
Thank you. I'm interested in what might be happening moving forward with the eating disorder coordinating positions, which have been extremely well received. So I understand that they were funded as half-time positions in 2016. Then in 2020, they were moved to full-time. As I think you've noted, the incidence of eating disorders is on the increase, and those coordinators that I've spoken to are certainly under the pump in working across really broad regions. Will you look at actually increasing the number of those positions for eating disorder coordinators?
Yeah, we'll look at that. As I indicated in my previous answer, we haven't made any firm decisions about what the future looks like. We're continuing to roll out the service plan as it is currently constructed, but I have also received those very clear responses and that feedback that they are under the pump, that there's gaps, that we continue to struggle to meet the needs of consumers who are experiencing eating disorders. And so whilst we're very thankful for the incredible work that those coordinators have done, as I said, the partnership with Inside Out I think has been really positive. I'm not suggesting that there's not more that we could do. The impact of the residential facility I'd be interested to see. I think we've talked before about there perhaps being mixed international research about the role of those kind of facilities. Model of care, I think, is really important there. Are they actually providing the kind of game-changing intervention for consumers who use that we would hope? We're interested to see that. So there's obviously, I think, one in Queensland that has opened already. We're opening our own. Is that more of what we want to do in New South Wales? I'm still putting a question mark next to that because I want to see the one in Charlestown open and the impact that it has. But certainly the coordinators have been very well received, and so we are open to doing more.
Absolutely. And can I ask specifically about my own community of Albury-Wodonga? As I'm sure you know, because I wrote to you in July, Albury-Wodonga missed out on an eating disorder coordinator because we're a cross-border community. Will Albury-Wodonga Health be provided with an eating disorder coordinator?
Yes, I did receive your letter. Thank you, Dr. Con. And look, I'm not able to make a firm commitment today, but I did receive your letter and I can indicate that I recognise that whilst Murrumbidgee LHD received funding, Albury, as you say, sits separately. Through New South Wales Health, we've reached out to our Victorian counterparts who share, obviously, responsibility for the Albury-Wodonga community to see whether there might be a willingness to respond to that gap. We are willing to do that. We have already, off the back of your representations, spoken to the Victorians, and I can't give you a commitment today that will necessarily be successful, but I think we should be able to indicate, hopefully in the near future, that is something that we're able to provide. That's certainly our intention. Does anyone just briefly have any view on the time frame on which the Victorians might be responding to us? I think it's quite soon, we hope, isn't it?
Thanks, Minister. We are hopeful to be able to put something in place as a proposal for a coordinator for next financial year. I have spoke with Albury-Wodonga Health, I've spoke with Murrumbidgee, but we are still to formally get in touch with Vic Health. We are very interested in seeing what's possible.
Yeah.
Yep.
Thank you. In my final couple of minutes, earlier this year in the Legislative Council, we had a very constructive debate on psychedelic-assisted therapies, which of course are a very promising treatment for PTSD and for treatment-resistant depression. As you know, New South Wales has more restrictive conditions than other Australian jurisdictions, so particularly the requirement that these treatments only take place in a licensed private mental health class facility. This is a significant barrier to access when in Victoria, Queensland, Western Australia and the ACT, this can be provided as an outpatient when that's seen to be appropriate by the treating psychiatrist. During that debate, you committed to explore the refinement of the relevant regulations based on yearly reviews of how effectively the regulation is being implemented. Can you update us?
So, yes, I can. It continues to be my view that New South Wales is not providing an adequate framework for access to those emerging therapies, and I, as you know, share your view that they have a lot of potential. So I've asked New South Wales Health to ensure that our provisions are aligned with the other states, and that is work that is currently being undertaken. We should be able to deliver that alignment in coming months. That's something that is being worked on by New South Wales Health. Perhaps I can ask them to elaborate now, or you can talk to them this afternoon, but my instructions to them as the Minister have been, I want to see the provisions in New South Wales aligned with those of other jurisdictions in Australia, and they understand that that is my expectation, and that work is happening right now and should be able to be implemented in coming months, so that at the very least consumers in New South Wales are able to access these potentially life-saving therapies in the same way as consumers in other states. I don't want to hear stories about people who are New South Wales residents having to go to Victoria or Queensland to access treatment, which is expensive and time-consuming for them, not available to everyone. So that's...
Thanks for that commitment, Minister. I would be happy to hear the response from the department, noting we've only got about 40 seconds left.
Does anyone want to add to that?
Yeah, so I think that the particular regulation is in relation to a requirement currently in New South Wales that the treatment be delivered in a private health facility. The background to that is that we have really a scant data nationally and internationally on the safety profile of these treatments, and so there was a desire which was supported by the body of psychiatrists and the college, which was that we should deliver the treatment in the safest environment possible. We are now looking with our legal branch and in consultation with our college at whether there are other ways of assuring that level of safety whilst providing a degree of flexibility about the environment that the treatment is given in. It's complicated because we're balancing access against safety, and so we're trying to land that in a way which doesn't disadvantage anybody.
Thank you. We'll go to questions from the opposition.
Thank you, Chair. Good morning, Minister, and your many officials in your multiple portfolios. It's nice to see you all again.
Yes.
Minister, can you explain the process involved in you being appointed as Minister for the North Coast?
Look, that's really, I think, a question for the Premier. He called me and asked me to serve in the portfolios that I'm currently serving, and I said yes.
Sure. But you've not ever lived in that area? There's no other ministers from that area of the state, are there?
No,
so you have to do it from Sydney?
That's right. I haven't lived there. Mm-hmm. I understand from the Premier that the reason that he asked me to serve in that portfolio was that he was of the view, and it's a view that I share and has been validated from my engagement with that community, that housing is the biggest issue on the North Coast. It's not that there's not other issues, but that issue really sits front and centre of concerns that those communities have, and that it was a suitable fit to have the Minister for Housing also perform the role as Minister for the North Coast, advocating for that community in Cabinet.
Sure. Well, we might just go to some of the other issues. How many times have you met with members of the Ulmarra community following the closure of their ferry?
I haven't met with them.
Have you visited Ulmarra?
No, I haven't.
Okay. Did you advocate on their behalf to the Minister for Regional Transport and Roads?
No, I haven't done that.
Okay. What about the situation that's happening up at Mount Warning? How many meetings have you had with the local community up there?
Well, I have met with the local Byron and surrounds community many times. I haven't had specific meetings on that issue, but I've met with the local community up and around that part of the North Coast on multiple occasions.
Okay. Are you able to tell me who Michael Hampson is?
No, I'm not.
Okay. He's the CEO of Norco. Have you met with him?
No, I haven't.
Okay. Did you sign Janelle Saffin's petition to have Norco milk restored to North Coast hospitals?
No, I didn't, but I am aware of it, and Janelle has certainly raised it with me. So I'm aware of that issue, and Janelle's put it on my radar. And, you know,
will you be doing anything to advocate on behalf of the dairy farmers on the North Coast who are pretty angry about that decision?
Yeah, I accept the premise of your question, which is that they are concerned, and certainly Janelle is as well. I've spoken to Minister Park's office about it, so I have raised their concerns with the relevant minister, and that's, to be honest, what I largely see my role as the Minister for the North Coast as doing, being an advocate for that community within Cabinet. Minister Park's aware of it. Obviously, you can ask him questions tomorrow at budget estimates. look, I mean, his view is those are, challenging decisions that health has to make, balancing the resource issues that they have, ensuring that they have the funds available to do their core work, providing quality healthcare. But certainly I have raised that with his office and indicated, as you have suggested, that the community up there is quite upset at that decision.
Thanks, Minister. You were up in Coffs Harbour last week, I understand?
Yes, I was.
What was the purpose of that visit?
I was doing a couple of things in that visit. I visited and made an announcement, made an update in relation to the provision of mental health care at the Coffs Campus Hospital. They're doing amazing work with emergency department diversion and through their safeguards team for the provision of care of children and young people. I met the women's shed at the men's shed. So there's a campaign up there, a community campaign to provide a women's shed for that community, and they're interested in ways that the government can support them to do that. Obviously don't have one, so we met them at the men's shed. And I did do a local council campaign event as well.
Okay, we'll come to that. I wanted to ask, you just said there was an update to, I think, some of the mental health provisions. My understanding is the safeguards team has been operating since May 2022, and the emergency mental health and addiction assessment response team started in February 2023. So was there really anything new, or was it just a visit to see how those programs are tracking?
Well, I mean, as you can probably imagine, when we do new interventions, in particular the MHeart intervention that Mid-North Coast LHD is doing at the emergency departments, we don't know whether they're going to be successful at first blush or not. It takes some time for us to see the impact of those assessments. And so in particular with the MHeart team, although the same issues are applicable with the safeguards intervention, when those interventions were first made, there was a question mark about whether they would be successful or not. And the purpose of my visit was to do the check-in on what impact they had had. And I'm pleased to report to you, they have had a really successful impact. And so it was about promoting those successful interventions, both to the communities up in the Mid-North Coast to make sure they knew the great work that their LHD was doing, leading service provision in mental health. Also to make sure that other LHDs perhaps were aware that these kind of interventions would be successful for them. I think there was quite a lot of local interest in those provisions. There was local media there. They certainly were unaware prior to my visit about these particular new and innovative interventions. And
Thanks, Minister. With respect, it's not that new. It's been going for a little while. But you talked about MHeart. Is that actually funded through mental health, or is that through Department of Health more broadly? Who pays for that program?
I think it is funded jointly by the LHD and perhaps vulnerable persons funding, which may come through the ministry, not specifically through the mental health branch. Is that right? Or is that through the mental health branch?
That's through the mental health branch.
It is through the mental health branch.
Thank you.
Thank you, Brendan.
So you said this was about letting the community know, the positive impacts of a mental health program. Was the local member invited to the media conference?
I don't. Well, he wasn't there, so I suspect he wasn't.
Right. But the local Labor councillor was, wasn't he?
No, he wasn't invited to the media conference.
He was there, wasn't he?
He came along to observe. He did not participate in the local media. He actually just came along really as an interested observer. Right. Councillor Judge, who is a councillor on Coffs Harbour Council, has a family history of mental illness in his family and was just particularly interested in that intervention, so he came along.
But how did he know that it was happening?
Well, because as I said, I did do a local council campaign event
so,
when I was in
Minister,
town.
I'm going to put it to you that you went up there to actually launch a Labor councillor's campaign, because from what you're saying, there wasn't anything particularly new in the announcement that you did at the hospital, and he just happened to be there, even though the local member wasn't invited. Can you see how that doesn't really pass the pub test?
No, not really. I think it's quite common. I make regular visits to the North Coast.
But you don't go to Ulmarra and you haven't met with anyone at Norco, but you go up to re-announce in Coffs Harbour a program that's been running for more than 2 years, and the local Labor councillor happens to be there a week before the election. It doesn't look very good, does it?
No, as I said, I I make no apologies for my regular visits to the North Coast and Mid-North Coast. But you started this line of questioning by suggesting perhaps it might seem odd to people that there is a minister for the North Coast who doesn't live in the North Coast. I actually can accept that at first blush might seem odd. As I said, I tried to explain the context in relation to the issues of housing. In order to manage rightful community expectations that as the Minister for the North Coast I am present, I make regular visits.
But you
to the
didn't
North
invite the
Coast.
local member, but you invited the local Labor councillor and did a launch for a week out from polling day. Who paid for the trip? Was it through your parliamentary expenses?
On other occasions, when I have been on the North Coast, I have done events with Mr. Singh.
Were any other local councillors invited to, or at the hospital, or part of the launches that you did, or just the Labor councillor?
No.
Okay. So who paid for it? Was it paid for through
I'll have to
parliamentary
take on
entitlements?
notice whether it was paid for through parliamentary entitlements or other. I'll have to take that on
What
notice.
would be the other way? Did you personally pay for it?
I'll have to take on notice how it was paid for. But as I said, not only did I visit the hospital, I also visited the men's shed and met with the women's shed there, make regular visits to the North Coast and the Mid-North Coast.
Okay, you said earlier that housing is a huge part of, obviously, your role as Minister for the North Coast, but Labor Council in Coffs has been pretty negative in terms of some of your housing policies, haven't they? So how did that conversation go?
It's a fair question. I disagree with them.
Right, so you went to launch their campaign, you want them back in, but they actually don't support your government's housing policy, even though that's the most important issue for you as Minister for the North Coast.
I think it's quite a normal and healthy part of the democratic process that different levels of government have different views on some issues. I have no problems with that. I have no concerns about that. As I said, I actually think it's part of a functional and robust democracy that they might have a view on something that I have a different view on.
Right. Well, we'll be interested to see what happens up there. I want to take you now to the Regional Youth Task Force. Is there currently still an office for regional youth?
Yes, there is.
And where are they located now with the changes to the Department of Regional?
They're still within DPRID, or Regional Primary Industries and Regional Development. They're still within that department. We are moving towards the finalisation of our new Office for Youth structure. We have had thousands and thousands of incredibly positive engagements with young people online, at workshops, face-to-face, at festivals over the last few months. It's actually been incredible how engaged young people have been. We will be bringing all of that together at a youth summit, which is going to be held on the 18th of November, where we will be formalising what young people want to see from the New South Wales Government's representation of them.
Are you going to have a standalone regional youth council or regional specific program or not?
TBC.
Right.
We're going
to. I've asked about this now for the last, I think, 2 estimates, and it's been TBC with respect for quite some time, and young people in the bush are fairly vocal about the lack of having that with respect under your government that was there. We had a dedicated Minister for Regional Youth, we had that Regional Youth Task Force that's gone. They want to know if it's coming back or what they'll be able to do to have a voice. So what can I tell them?
Go online to have your say and find the survey that we are running, which actually thousands and thousands of young people, many of whom in regional New South Wales have done, to have their say about what structure they want to see. And I accept the point that you're making, that part of that conversation has absolutely been regional young people saying we face particular challenges and we want to be heard, as have young women, as have young people from Western Sydney, as have young LGBTIQA plus people. Young people are really concerned about the fact that they look around our parliament and they don't see themselves represented and they don't see their voices heard, and we are responding to that.
Yeah, but with respect, you've just said TBC in terms of what that will look like.
That's
so
because
will I tell them that maybe next year they'll know what they can do in a more formal way than a survey?
You can tell them that on the 18th of November we will be bringing together a very large cross-section, and if there are particular young people that you'd like to see there, it's not a political event. I welcome the opportunity to have young people's voices heard there. The reason it's TBC is because, as I've said before, I am not a young person. I still claim to be, you know, have some grasp as a millennial on, you know, the issues of youth, sort of skibbity riz, as my young children would say. I am not.
You and
a
me
young,
both, Minister.
I am not.
I think we're in the same
I am
cohort.
not a young person. And so I don't want to make decisions with a bunch of other old people, no offence officials, about the kind of structure that young people want to see from government. That's why we've done the survey, that's why we're doing the summit. And I actually am accepting your proposition, Ms Mitchell, that regional young people have an expectation that their voices are heard distinctly. I'm not denying that, but so do young people from Western Sydney and culturally and linguistically diverse backgrounds and First Nations young people, and we're trying to bring that together in a way that makes all young people feel heard by government.
Okay, well, we might come back to this in the next estimates, and there might be some more detail that we can talk about. Minister, you'd be aware that the current Commonwealth tender to recover, I think it's 70 gigalitres per year of water in the Southern Basin closes on Wednesday. Last time when we had estimates in February, I was asking you about structural adjustments, and you said you hadn't gotten to that yet because you didn't want to preempt the Commonwealth. But in June, Minister Plibersek announced a $300 million Sustainable Communities program to be delivered by the state. So do you accept that the work on structural adjustment that we were referring to was ultimately turned into something that is your government's responsibility?
Yes.
Okay. Did you not know that at the time, or?
No, I mean, I was aware at the time. I understood, although I'll have to check the Hansard, that we did talk about the existence of those structural adjustment packages from the Commonwealth, but that at that time, earlier this year, our primary focus was to, and it actually continues to be, explain to the Commonwealth how damaging sort of thoughtless, mindless buybacks are, and our focus.
And you had your alternatives to buybacks planned.
We still have that.
Yeah. So, and I want to ask too, you've also commissioned, I think it's the AFA report, which has a number of recommendations. Can you tell me if there's any work being done specifically on the Recs 5, 6 and 7, which really go to issues around structural adjustment measures?
Look, I can perhaps ask Ms Jones to speak specifically to the work.
I might ask her this afternoon,
Sure.
but I just, you know, wanted to know your views as Minister on those three particular.
Well, I would say that the work on the delivery of the structural adjustment programs is being led by Minister Moriarty. And that is because, as the Minister for Regional New South Wales, she is best placed to ensure that the funds that are available, which, as I've said on a number of occasions, including publicly, are going to be challenging to manage the negative impact of buybacks on our communities. But nonetheless, the funds that have been made available are delivered to communities in the best possible way. As the Minister for Water, I'm responsible for and focused on water infrastructure and water management. I'm not best placed to know how regional communities would like their economies diversified and different investment packages that might be best suited to them. I think partnership with local government is incredibly important to that, I should say, but Minister Moriarty is actually responsible for delivering the funding under that program.
Okay, so any sort of decisions around water purchasing, structural adjustment programs, buybacks, are you saying that that falls under Minister Moriarty more than yourself, or is she more responsible for the community? It's just not very clear. So
Yes.
how will you, like, with respect, you are also the Minister for
Sure.
Water, and you're the one who sits at the table in Commonwealth meetings and negotiations and the like, and obviously the impact is felt in the regions, but I'm just trying to understand what your role will be in that as Minister for Water.
So in terms of the decisions around water purchase, buybacks, they're decisions for the Commonwealth. I mean, I'm not making those decisions.
Yeah, but you engage.
This absolutely. So this is how it works. I say publicly, privately at ministerial council meetings, don't do that. That's a mistake. We don't want that in New South Wales. We've got this whole other plan. We're working on it. It's actually making progress. The Commonwealth makes its own decisions. I mean, I have to say I have been somewhat pleased that they have prioritised water infrastructure and non-infrastructure alternatives to buybacks. Nonetheless, I engage with them on that conversation. Ultimately, and I've said this before, I can't take responsibility for decisions that are within their purview and their remit. If people have got concerns about them, run for the Senate and take it up at Senate estimates. Once those decisions are made by the Commonwealth, and they provide funding to New South Wales to mitigate the potential negative impacts of their decisions. Very disappointing that it's come to that, but nonetheless, that is for them. Minister Moriarty manages the administration of those funds.
So you go and say, please don't do this, but as you say, they can go ahead and do it anyway, and then it's up to Minister Moriarty to work with the communities in terms of buyback. So your role sort of finishes at the point where the Commonwealth, with respect, probably ignores you and does what they choose to do.
I'll take that comment with respect, and the answer is yes.
Okay. Have you had any agreements with the Commonwealth to obtain environmental water through rules changes?
No, we haven't at this stage. Other than, I should say, perhaps we have had agreement to trial shepherding environmental water from the Northern Basin through to South Australia as part of flush provisions, which were primarily directed to clear blue-green algae blooms from the Menindee Lakes, and I'm very pleased to report that that was successful. So that is a trial of the movement of environmental water from the Northern Basin.
But when you said at this stage, are you having discussions about future changes to the rules for environmental water?
Yeah, I mean, we are. But for starters, we're having discussions around whether or not we might formalise the trial that I just referred to be a more ongoing opportunity for us to move environmental water from the Northern Basin to South Australia as part of efforts to ensure water quality through the Darling Barker. And look, we need to do the accounting. I should say that very clearly. It's not just New South Wales, Victoria, South Australia, the MDBA. Everyone is very concerned to ensure that the accounting is done properly. And that is what is happening right now. But, Ms Mitchell, I have to say the feedback that I have received from communities along the Darling Barker, in particular in the lower Darling, was that trial of the movement of environmental water was very successful, and they were very pleased to see the breakup of the blue-green algal bloom that had been a very big concern to those communities.
Okay, I've only got 30 seconds, but I want to quickly go to the connectivity expert panel report and implications for the Northern Basin. There was a delay. It was meant to be released on the 1st of July, but it wasn't released until the 8th of July. Can you explain the week delay?
I can't off the top of my head. I'll have to take on notice.
Okay. Will there be any ground testing of the panel's modelling and assumptions?
So first of all, the modelling isn't even done. We are finalising the modelling, particularly in relation to hydrological and economic modelling. So once that's done, we'll make decisions about what the next steps are. Whether or not that involves ground testing, I can't say at this stage. We need to finish the modelling work before we move to any kind of decisions in relation to that.
Okay. Thanks, Minister.
Thank you. Back to mental health. How many current vacancies do we have in New South Wales for staff specialist psychiatrists?
Oh, look, I may have to defer to an official on that or take it on notice. It will definitely be a number. Brendan, do you have that?
I do, Chair.
Excellent.
So there's 416.4 positions for staff specialists in New South Wales, and 121 of those are currently vacant.
Okay. So about a quarter of those positions are currently vacant. What are you doing to attract and retain staff specialist psychiatrists?
So there's two pieces of work going on, Dr. Con. I just, first of all, should say I meet regularly with ASMOF, the College of Psychiatrists, and the AMA in relation to this issue. I'm well aware of the concerns that they have in relation to how difficult it is for New South Wales to attract and retain staff specialists. And as a consequence of those vacancies, it's actually costing us a bucket load in locums, which is not an ideal situation. We're doing two pieces of work. One is a range of non-award provisions that we can use to attract and retain staff. Again, Dr. Wright and Dr. Flynn are heavily involved in that. I can ask them to elaborate now, or you can talk to them this afternoon. There are regular meetings between themselves as representatives of the New South Wales Ministry and those organisations about on-call rosters, about leave provisions, about advertising of vacancies. Even those kind of things have been raised. LHDs not advertising vacancies in the way that they should be. So all of those kind of things are wrapped up in what I consider to be quite a positive piece of work that is making progress. And again, I can ask them to elaborate now if you'd like. The other piece of work that we are doing is around award provisions. And I've always said to those groups, and they have been very positive engaging in our non-award work plan, but they also have been clear to me that they do not believe that there is any real path forward without award revision. And that's work that Minister Park is leading. I'm obviously playing a supportive role. It doesn't just apply to staff specialists in psychiatry. Obviously, it applies more broadly. Look, it's tough work, it's tough negotiation, but I think my observation is that Minister Park is doing a really good job working with ASMOF to try and make progress on that. I can't report anything more than we recognise it is a problem, it is costing us money and locums, and there is a formal process that is being engaged with through the mutual gains bargaining provisions, and I'm very hopeful that that leads to progress in relation to the award.
Thank you. Look, I'm glad that you brought up the award negotiations. Do you know what the pay gap is approximately for a staff specialist psychiatrist here compared to Victoria or Queensland?
I can't off the top of my head. I have seen a table that draws out that. You should see the pay gap with WA. It's substantial, Dr. Con. So I can take that on notice and perhaps table that that I have seen. Your point is valid and well made. There is a gap. We recognise that. It's been brought to my attention by those specialists, and the numbers speak for themselves. There's no way to fudge it.
Absolutely. Please do table that for the rest of the committee. My understandings from the figures I've been provided by the College of Psychiatrists, that the pay gap to Victoria, Queensland, I'm focusing on the states that neighbour us, where it's very easy for people to move in a town like Albury-Wodonga, that pay gap's looking like 25 to 30%. Why would a newly trained psychiatrist actually choose to live here in New South Wales when they can earn 25 to 30% more in Queensland or Victoria?
Yes, well, my pitch to that newly trained psychiatrist is live in the best state in the Commonwealth and enjoy all of the awesome things that New South Wales has to offer. And we have an incredible team at New South Wales Health that can really support your career progression, help you to be the best possible physician that you can be, and give you all of the kind of opportunities to do the work that you trained to do, changing the lives of consumers. I recognise that money talks, and that my pitch on all of the incredible opportunities that we have in New South Wales Health for psychiatrists might bump up against some of those realities that you have outlined. All I can say is that the process for resolving that is award negotiation. That's the well-recognised process that we have when people who work in the public service, including staff specialists, feel as though they're undervalued. And that process is being led by Minister Park. He leads on workforce matters, and I'm doing everything that I can to support him. And as I said, I don't want you to think as though the work that we're doing on non-award matters is a mere footnote. Obviously, I'm not trying to deny, I brought up the award as an issue, but some of that work is substantial, and psychiatrists have raised a number of issues in relation to non-award employment matters that are really important to them, and we have a really solid plan to try and resolve some of those.
Notwithstanding your enthusiasm for living in New South Wales, I'm not sure all of our newly trained psychiatrists are willing to take a 30% pay cut to stay in New South Wales. Have you actually done any work to look at the figures of our psychiatry trainees? What proportion of the people we're training are actually choosing to stay on with New South Wales Health?
I'm not sure whether we have done that. Workforce Branch may have done that. I can take on notice. Certainly, I'm aware of surveys done by the College of Psychiatrists on those questions, and I'm aware that they indicate that there is a challenge attracting newly graduated psychiatrists to work in New South Wales because of some of those issues. I mean, it's not just the issues with pay. Obviously, we have a higher cost of living here as well, which compounds those challenges, but I am aware of that. I mean, the good news, Dr. Con, is that we are training and graduating psychiatrists at a very healthy rate. Unlike some other areas where we have a real pipeline issue, that's actually not so much of an issue in psychiatry. The bad news is we are struggling to bring those people into New South Wales Health. I will say it's not just the other states and their public health systems. The issue of the pay gap with private practice is substantial, and I have said, including to the college, and they know my view, that is an issue that is beyond our capacity. The fact that a early year grad psychiatrist can earn $700,000, $1,000 doing telehealth consultations is a extremely significant barrier for us attracting them into the public system. The issue around the comparison with the other states is fairer to the extent that there are other public health systems, but I think the challenge of the salaries that psychiatrists can earn in the private sector is very significant, and we need to talk up how important it is to work in public health and the opportunities that provides you, and that you're never going to earn as much money working in public health, but you're going to live a better and more fulfilling life and change people's lives, and that is worth something.
I would hope as well that our trainees would want to work with New South Wales Health and serve our public patients. You referred to the survey from the College of Psychiatrists. So that survey showed that 18% of trainees are choosing to stay in New South Wales. So that's 80% of our trainees choosing to leave New South Wales Health. I am interested to know if this is something that the Ministry or the Department is looking at directly as well.
As I said, I will take on notice it's whether Workforce Branch is looking at that specifically. I have been briefed on the survey results. I've met with the college directly. I've been provided with a copy. In fact, I've met a number of times subsequent to that survey being done. So I'm across it. Whether we're doing our own work, I'm not sure. Do you know off the top of your head, Dr. Flynn, or would you like to take that on notice?
I think we'll need to take that on notice, Minister.
Okay. Yeah. I mean, just as you may be aware, we obviously, Workforce Branch, lead with Minister Park these kind of workforce issues and award negotiation issues, and through the mental health branch we play a supportive role specifically in relation to the areas of our interest.
Absolutely. I've got plenty of questions for Minister Park about this tomorrow, but noting the particular impact that the shortage of psychiatrists is having on mental health patients.
I accept that, and also that it's actually a bit more profound than some of the other areas of shortages.
Absolutely. I also wanted to ask about the gap analysis that's been promised. The priority issues paper on community mental health that was released on the day of the federal budget estimated that 58,000 people in New South Wales with severe and complex mental health needs are missing out on psychosocial support. You've committed to conducting a gap analysis. What does that actually mean? How is that analysis going to be conducted?
So there's gaps analysis galore going on, Dr. Con, because the Commonwealth have done their own gaps analysis, which I think is the one that you were referring to, the national one, which has now publicly been released. I should say, in relation to the Commonwealth's gaps analysis, there are data concerns that I have in relation to that piece of work. I think it's a useful contribution, but you just so that you're aware, Dr. Con, that analysis assumed that anyone who was receiving psychosocial support of any kind was having their needs met. I think this is a bad assumption. And we cannot assume that just because you're receiving any level of support, your needs are being met. Nonetheless, it was stark reading, even with, I think, that poor assumption. So there's that. We've done our own gaps analysis. We've released a preliminary paper, and we're now doing more detailed work. Again, Dr. Flynn could probably update about where that's up to, just in New South Wales. And we have our own separate sort of psychosocial gaps analysis that we're doing alongside the Commonwealth piece of work. So there's lots of analysis of gaps happening. I know what your questions are going to be, which are, that's great that you know the gaps, what are you doing about it? Fair question. We've done some work to try and identify those priority gaps, and I think the funding that we provided in the budget on the community mental health housing liaison staff was an important part of that. There's obviously more to do, but did you want Dr. Flynn to just elaborate?
I do have these specific questions about the methodology, and you pointed out one of the flaws in some methodology that's been used previously. So I think it is really important to understand what is the method of the current gap analysis that's underway that you're doing.
That we're doing. Dr. Flynn, would you like to elaborate on that?
So to clarify, noting there are numerous analysis, we're talking about the New South Wales Health Part 2, if you like, the first part being the qualitative work that you'd be familiar with, and the second part is looking particularly at data related to services. What the mental health branch is doing is using planning tools, and in particular the National Mental Health Services Framework, but also there's some other tools like the Sachs Institute planning tool, to look at ambulatory, inpatient, and ideally, to the extent of our community partners and PHN services, using those tools to determine relatively where parts of New South Wales fit compared to each other in terms of subspecialist services. So an example might be comparing Southwest Sydney perinatal services with a regional area. There's also an element of that work that does allow for comparison with other jurisdictions, noting that the AIHW publicly available data talks about significantly different workforces between different jurisdictions.
So can I just clarify, so you've talked about comparing parts of New South Wales to each other and comparisons with other jurisdictions. I do love a comparison with Victoria as an Wurrunga resident, but I don't think any Australian jurisdiction has got it perfect in terms of mental health care. Is there any analysis happening actually compared to best practice or gold standard care, or is it only relative to other services that are also inadequate?
I don't think that we've actually defined what gold standard care is. And what I mean by that is the National Mental Health Services Framework, to take an example of a planning tool, I would say it's an ambitious tool. It's very well intentioned. It's got some evidence that supports it, but no jurisdiction in Australia is actually meeting what that particular framework talks about, including other jurisdictions that have had significant recent funding injections. So I think that from our perspective, we want to make sure that the population of New South Wales is served equitably within our state and compared to other jurisdictions. I think that I genuinely believe there are different opinions around what the notion of a gold standard service would be. And I think that's complicated in particular by issues relating to wellbeing and community supports, which are quite a far distance from clinical support of people who live with severe mental ill health.
You've mentioned the framework. While I can appreciate the value of the interstate comparisons from an equity point of view, is it not also worth, while you're undertaking this quite detailed quantitative piece of work, comparing services to the framework?
We are using the framework.
Yeah, great.
Yes, yes. No, I think there is value in that. One of our partners made a very good point, though, that there is enormous utility in checking in how it compares across jurisdictions, because otherwise, if we're just doing it internally, we won't have a sense of that.
Just to be clear as well, Dr. Connor, so as you probably are aware, we are leading this work, but we're doing it in partnership with the Alliance for Mental Health. And so they are our partners and, important accountability mechanisms on how that analysis is being conducted. It's not purely an internal exercise. They are engaged in decisions that we are making about how it is being conducted.
Thanks for clarifying that. Last year I asked about the extremely concerning reporting of hundreds of incidents of sexual violence in inpatient mental health services. I was advised at that time that the decade-old Sexual Safety of Mental Health Consumers Guidelines was under review. Has that review progressed?
Yes, it has. I can ask Dr. Wright perhaps to comment on that. But yes, as I indicated previously, we are reviewing and updating those guidelines, but perhaps Dr. Wright might be able to provide a little bit of information about where that's up to.
Thank you. Yes, the guideline is under revision. The projected delivery for the publication of the guideline is mid-next year. And you'd appreciate that there's a wide range of really quite important stakeholders in the revision process. I think at the same time we are also looking at the data that we can collect to, I guess, underscore how we are performing in relation to that guideline. That's a parallel process that we're doing alongside the Clinical Excellence Commission in New South Wales. But I think it's as you rightly know, it's a really important piece of work, and I think it's more than 10 years since it's been revised. So it's it's a large process that we're undertaking, but mid next year.
And I should also add, Dr. Conn, thank you, Dr. Wright. It's not just the guidelines that are being reviewed, it's the training modules or program that sit alongside them, which I think is very important as well, in that we want to have the most up-to-date best practice guidelines, but we also need to have some confidence that the training that we are doing to ensure that they are being adhered to by clinicians is also up to date, and that is also being reviewed. Of course, lived experience and carers are part of that process.
Thank you for that update and that clarification. In the interim, we've got at least 6 months to go before even the publication of the guidelines. For somebody who's being recommended an inpatient mental health admission voluntarily, obviously informed consent is part of that process, that they need to understand the risks and benefits of the treatment that's being offered. Is it actually discussed explicitly with patients that they're being exposed to a significant risk of sexual violence by accepting an inpatient admission?
I'm not sure if that is. Perhaps Dr. Wright or Dr. Flynn may have a view. Obviously, as you know, well, risk assessments are done on admission and then updated every 24 hours, and so we do take risk management very seriously. But in specific,
and can I be clear? I understand generally risk assessment in mental health as a former clinician. I'm specifically talking about this risk of sexual violence while all of this important broader work's underway.
Perhaps.
Thank you.
Yes.
I think I should be clear that we do have policy and guidelines and training in place, and so we're not talking about a vacuum where there is no understanding or assessment of these issues. I think that it's the reason we're doing the work is we appreciate that in the 10-year period there's been substantial change and there's been substantial improvement in what we can do to reduce that risk. But I think we have always been attempting to carefully risk assess every single individual, and I take your point that the risk of sexual safety incidents is different to other risks, but there is a broad category of risk that we assess on every single person who is admitted, both as a victim and as a potential offender in terms of violence, whether it's physical violence or sexual violence. We have a long-standing issue of understanding, of appreciating those individuals who are particularly vulnerable, identifying them and taking steps to manage that. We don't always get it right, and that's why we need to improve the way we're doing things, and that's why we need to collect the data. But I think that the notion that we're not alive to the risk of any kind of violence, including sexual violence, that's not correct. We are absolutely alive to it, and our services are working on that every day.
And just finally to the Minister, is there a budget allocation for this important piece of work?
The review is being done within existing resources.
Thank you. I'll go to questions from the opposition.
Thank you. Good morning, Minister. How are you?
Hello. Yes, good.
Minister, last week it appeared in a sense that you threw Sydney Water under the bus when it came to providing timely water and wastewater connections to growth areas. Considering this, when you're stating that Sydney Water is a big problem, what actions is the government taking?
I think that if there was criticism that I was making, it was historic criticism that was probably more directed towards your former government than Sydney Water, but nonetheless, we can agree to disagree on that. What are we doing? Well, we're just making really clear what our expectations are. And as I indicated in that media article and elsewhere publicly, have some confidence that that work is yielding results. I think explicit statement of what priorities of government are and clear communication about our expectations that is the work that whole of government is doing is important. And as I said, I have some confidence that that's working.
So, Minister, with that confidence and with also stating that Sydney Water are understanding that better now,
yes, they are,
concerning their role in delivering housing, apart from that statement of expectations, what's changed at Sydney Water?
Well, I mean, leadership, I think, is what has changed, and that is at the executive government level. Sydney Water, how would I describe it? They have an incredibly important role ensuring the provision of clean and safe drinking water to Sydney, and they do that very, very well. My sense is that under the previous government, the relationship between the provision of water infrastructure and housing became very fuzzy and blurry. And I think that you can see that failure in what is happening in southwestern Sydney. It does my head in that we're trucking sewerage out of housing in Wilton. How has this planning failure been allowed to happen? Well, it's because previously Sydney Water were not brought in early on decisions around planning and rezoning, and now, sure, I mean, I think they're doing an excellent job playing catch-up, but that is what is happening. Shipping out wastewater is catch-up. And what we have done is brought them in from the very beginning. So, for example, the work that we did around the TODs, we ensured that that wasn't work that was just done in isolation over in planning land. We made them have Sydney Water at the table from day one, which they did. And so now I have the confidence that when I talk about the TODs, that the infrastructure around water and wastewater to support that housing is adequate, because we did not repeat the mistakes of the past of not letting Sydney Water be part of that process.
Minister, given that your expectations in terms of total dividend and tax equivalent payments from the PNFC and PFC sectors for Sydney Water are that they are to increase by 164% from this year to $766 million in 27-28, how are they going to be able to achieve the water infrastructure delivery that you expect when you're also expecting them to increase their dividends to the government by 168%?
Look, as you, I would hope, know, as the former Parliamentary Secretary to the Treasury, the shareholder ministers, being the Treasurer and the Finance Minister, manage the dividend payment process for Sydney Water. As the Portfolio Minister, I'm responsible for ensuring that the water infrastructure is available, and that, as I said, that core business, do we have clean, safe drinking water available for Sydney residents, is done. I have full confidence that through the work that Sydney Water has done to get their infrastructure pipeline moving, and as I said, there has been a significant improvement in terms of that planning and their engagement in that process, that they will be able to manage that alongside the dividend discussions that they will have with their shareholder ministers.
But over the forward estimates, you're expecting, or the government's expecting, $2.6 billion effectively in dividend payments from Sydney Water. Don't you think this is going to make it more difficult for them to be able to do their job of actually outlining water infrastructure to be able to service growing Sydney and increase density as well as growth communities in Western Sydney?
No, I don't, because, and this is the key difference, the planning has been done. So all of the work around where the houses are going to go, and it's not just residential development, obviously there's the development of industrial land and other work as well, but all of the planning work about where the demands on the growth of the network are going to be, they have been brought into the room from day one. All of the work around the infrastructure pipeline has been done. And that has been done alongside discussions with Treasury around dividend payments. And so your question may be valid if those conversations were happening in isolation. And to be fair, that is what was happening previously. I think if you look at the amount of the dividend payments that were being paid by Sydney Water in the periods 2017, 2018, 2019, they were astronomical figures. And my view is that that sat alongside a failure to properly plan for growth. This came together with the situation we have now, where there are large parts of particularly greenfield areas in southwestern Sydney where housing development has raced right out in front of the availability of water infrastructure. I have a very clear line of sight on how that failure occurred, and we are not repeating those mistakes. Those conversations are happening in tandem. So I can give you confidence that, yes, the dividend conversation that Sydney Water is having with their shareholder ministers sit well alongside the necessity of providing water infrastructure to support housing growth.
Minister, given that over 54,000 lots are facing development delays due to a lack of sewer and water connections, what immediate steps will the government take to ensure Sydney Water's servicing timelines align with the pace of housing construction?
Well, I mean, as I have indicated, I can't manifest a wastewater treatment facility overnight. They take time to build. We are doing everything we can to accelerate the provision of wastewater. So, for example, in the areas that most of those gaps that you have identified are, which is southwestern Sydney, we do have the Upper South Creek, we have the Upper Nepean, various pieces of wastewater infrastructure that we are doing everything we can to get moving quickly. But this is a failure of years in the making, where during the periods when infrastructure investment should have been made to support housing growth that was coming online now, that didn't happen. That didn't happen. And so now we are playing catch up. And I mean, how do you play catch up? Do everything you can to accelerate the delivery of the infrastructure that is needed to support that growth. But you cannot deliver a world-class, high-quality wastewater treatment plant overnight. It's a big piece of infrastructure that rightfully, it's treating sewerage. So it rightfully needs to have proper environmental and human health and other provisions go into its planning and delivery. We would not want slapdash, kind of done on the cheap wastewater treatment plant. That's not how Sydney Water does its business, and rightfully so. But that takes time, and I'm very sad that work wasn't started when it should have been done, but we're trying to get on with it now.
Minister, will you clarify whether the New South Wales Government will issue directions to Sydney Water to commence detailed design and construction of water assets earlier in the development process to avoid delays in housing delivery?
Yeah, if we need to, we will, although the pleasing news that I can report to you is that, by and large, because of the more explicit alignment with government priorities that I mentioned earlier, I consider this to be largely unnecessary. If we do see a repeat of a lack of planning and investment in wastewater infrastructure to deliver the housing that we need, of course we'll intervene. But actually, the good news is that alignment is already happening, and the plans are in place to ensure that we have that work done in a timely manner.
Minister, given this $2.6 billion worth of dividend payments that the government's expecting from Sydney Water over the forward estimates, is there any view from you to review Sydney Water's dividend payout policy to allow the organisation to reinvest retained earnings into essential growth servicing infrastructure?
No, I mean, I'm not planning to review that, but as I've already mentioned, I don't actually manage the payment of dividends from Sydney Water, so you should have asked the Treasurer.
So you wouldn't like to see more money within Sydney Water to be able to actually deliver more water infrastructure sooner?
Well, I would like to see Sydney Water have an adequate provision of resources to ensure that the infrastructure that we need to support housing is there. I am confident that that is the case. In terms of how that sits alongside dividend payments, as I said, that's a matter for the Treasurer. If he has a view about how that could be managed better, I welcome that. That would be within his remit to pursue and advise. I have to ensure that as we deliver housing to support the growth of Sydney, that the water and wastewater infrastructure is there. I have to ensure that, and as I have indicated, I have a lot of confidence that we have the plans in place to make that happen now.
Minister, you've been quite strong when it comes to Sydney Water and your frustrations with that holding back new housing. Do you share similar frustrations with the current protected industrial action from the Electrical Trades Union against Endeavour Energy and Ausgrid, which has halted the connection of homes to power sources and made it more difficult for developments to continue?
I am frustrated at anything that stands in the way of delivering the housing that we need, including your efforts to cancel transport-oriented development. All of that is obviously of deep frustration to me. I encourage the parties to that industrial dispute to work together for a resolution. We're not parties to it. I have to say, I'm not across the detail of the log of claims made by the ETU and the response from the energy companies. Obviously, I would be hopeful that they would be able to resolve that, and I encourage parties to negotiate together in good faith. But anything that stands in the way of the urgent need to deliver housing in this city is a frustration to me.
Minister, do you agree with the ETU strike action?
I don't really know the basis on which they're taking industrial action. As I said, I'm not across their log of claims. I don't know the response from the energy companies. It's not something that I have been personally briefed on, doesn't really fall within my purview. I mean, the delivery of private market housing is the responsibility for Minister Scully. We're not experiencing any issues in relation to our housing delivery at Homes New South Wales, but of course I encourage the parties to work together to try and find a resolution.
So to that point, Minister, so no redevelopments undertaken by Land and Housing Corporation or the Aboriginal Housing Office or Homes New South Wales have been subject to the ETU's industrial action?
I'm advised that's the case, that there are none that have been held up.
So, Minister, you're not aware of that action actually affecting properties at Guild Road in Claymore, part of the transformation of the Claymore estate that's been subjected to protected industrial action of the ETU?
No, that hasn't been brought to my attention. Are you aware of that, Rebecca?
Okay, so no issue at all with anything when it comes to Homes New South Wales Land and Housing Corporation or the Aboriginal Housing Office?
No, I asked last week if there were issues in the delivery of our housing pipeline, and I was advised that there weren't.
Will you take it on notice in terms of looking at Guild Road at Claymore?
Yes, I would.
Thank you, Minister. Minister, how many parcels of land have been transferred to Homes New South Wales as a result of the land audit so far?
I think we're at 3. Have they actually been transferred, Rebecca? Or?
Not yet, but they're on the list.
On the list is 3.
Okay. When is it expected that they will actually be transferred?
Do we have a date about when we're expecting them?
We're just doing due diligence on those, so we don't have an exact date. It's just going through the land audit process now.
Okay, thank you. And with respect to 301 Samantha Riley Drive at Kellyville, what stage are you up to with respect to that project?
Rebecca, do you want to give an update in relation to that particular project? That's anticipated to deliver around 70 to 80 homes, and of course, as Rebecca indicated, we're just doing final feasibility work, but do you want to provide an update?
That's right. Kellyville, the site is actually next to the metro station, and we're currently in due diligence on that site to look at the proportions. It will transfer to Homes New South Wales. It's important for us. It obviously unlocks a number of nearby public housing dwellings that we'd be able to redevelop in the area and the community. So we've been quite strategic around the selection of sites to support the Building Homes for New South Wales program.
And given that site, under the most recent Kellyville Bella Vista TOD, proposes to increase heights to 67.5 metres with a floor space ratio of 2.2, why is it only that 75 to 83 homes are proposed on that site?
Yeah.
We have a design guide that really we focus on to deliver new public housing, social and community housing. So we've based the current proposal on our own design guide and what we need to deliver for people on the housing register. And we also overlay that with the nearby community properties that we have under management. So we've based that on a conservative estimate. Obviously, as the TOD changes come through, we will reevaluate that based on other priorities for our funding in that community.
Thank you. And Minister, we were advised previously that, at another estimates, that site was formerly owned by Sydney Water. What were Sydney Water doing with the site? Obviously, it's now surplus to their use, but why was it being retained by Sydney Water?
Oh, I'm not sure. Perhaps Mr. Chireau may know that, or perhaps take it on notice.
I can come back to Mr. Chireau.
Yeah. That's fine. He's nodding. Yeah.
Thank you. Now, Minister, with respect to sewage overflows into Scotts Creek at Willoughby, what immediate action is the government taking to address the sewage overflows into Scotts Creek, both from the sewage lines which run alongside Scotts Creek and from the north side storage tunnel, which overflows into Scotts Creek?
Yeah, I am familiar with this issue. The local member, Tim James, has raised it with me and written to me on a number of occasions about it. Look, sewage overflow is an unfortunate consequence of a couple of things. One, ageing infrastructure. Back to that old chestnut of not actually investing in upgrading the water infrastructure that we need for our modern growing city. Anyway, it is what it is. But also the kind of weather that we've seen. When we see some of the rain that we've seen in recent times, it's an unfortunate reality that our stormwater system is not always well designed and structured to deal with that level of water, and sewage overflow does happen. So I've met with Mr. James and Sydney Water to talk about what options we can take. As soon as there are alerts that sewage overflows happen after storm events, there is an immediate response from Sydney Water in terms of clean-up and remediation of the site. Obviously, we understand that local residents don't like to see that happen. We don't like to see it happen either. Mr. Shiro may be able to add something in relation to that site specifically, but as I said, I can assure you that it's been brought to my attention by Mr. James. It is an area where we have historically and will continue to see occasional sewage overflow when there are very heavy storm events, and we give the community an assurance that we have an awareness of that and will immediately attend on site and provide clean-up and remediation of the site. Brock, was there anything that you wanted to add on that particular site?
Yeah, thanks, Minister. I can add that we also have a program of not only desilting the mains around the sites, but also doing, I guess, inflow control. And the inflow control is basically avoiding all the stormwater getting into the network. So there's a lot of programs ongoing part of it would be rehabilitation of existing assets. Part of it would be also testing the connections at our customers' homes, because sometimes our customers are connecting stormwater to the sewage network. So we are testing that and discussing with our customers on how to restore stormwater connections, the gutters basically to the stormwater network, and the sewage connection to the sewage. So there is a lot of activity ongoing.
Thank you very much, Mr. Schreier. And Minister, with respect to short-term rental accommodation, you announced a review, of course, into short-term rental accommodation in February of this year. As we expected, the review will be completed in the first half of 2024. Why hasn't that deadline been met yet?
Because it's a complicated issue, Mr. Farlow, and you may recall from the debate that we had in the Legislative Council recently, and I thought it was quite a good dialogue. There are a number of priorities that we need to balance here. We're very concerned to ensure that there is adequate housing available for people in New South Wales, and we've talked about our changes to the planning system, attempted to be frustrated by yourself. Nonetheless, we overcame that. We've talked about the provision of $5 billion to Homes New South Wales to provide social and affordable housing. Short-term rentals are part of that, but we do need to balance the fact that for a number of local communities, tourism is a huge local economic contributor, and we don't want to disrupt that. We value the contribution of tourism to a number of those local economies, and their local small businesses value it even more than we do. So we don't want to make any decisions that are going to have negative consequences for things like local tourism. And it is a delicate balancing act, and it's complicated, and it's taking time. And I make no apologies for not riding roughshod into reform without having done the diligent work of consultation and consideration.
Thank you, Minister. And just for your information, I've got 2 minutes for the extra bit.
Sure.
Minister, so with that being said, when do we expect the review findings to be released?
Well, I think there's 2 questions there. In terms of the review findings, I'm not sure that we necessarily will release findings in that way. I think what you're asking for is when will we see a reform package based on the work that we have done. Look, I would be hopeful that we may be able to do that by the end of the year. But as I said, I'm not rushing a process in which I do think there are delicate balancing work that we need to do, and potentially different policy responses in different parts of the states, and that's complicated too. The issues in inner Sydney are going to be quite different to the South Coast, the North Coast, the Central West. You know, the experiences of people living in Orange are quite different potentially to the experiences of people living in Forbes, and even those two communities are within the Central West. So I am hoping that perhaps by the end of the year we may be able to release what we consider to be our reform package, but I'm not going to rush it because there's a lot of other work going on. And whilst this piece of work is important, I've never pretended it is the top priority in housing reform for the New South Wales Government. It is part of the suite of work that we're doing, but we want to make sure that we get the settings right, and that's the consultation and consideration that's happening right now.
Thank you, Minister. And Minister, with respect to those regional approaches, one of those, of course, has been the 60-night cap in Byron, which I believe has actually started this month. How many short-term rentals were there in Byron Shire on the 31st of August 2024, or the most recent date available?
I'll have to take that on notice.
Thank you, Minister.
We'll give up 5 seconds.
Yeah.
5 seconds.
Yes. Take it.
I will take that on notice, Mr. Farlow.
Thank you.
Are there any questions from the government?
No questions, Chair.
Oh, at this stage,
All right, in that case, we'll go to morning tea and we'll be back at 1:15. Thank you.
Okay.
For 20 minutes now for the crossbench. It'll be 5 minutes for Mr. Benasiak, 10 minutes for Ms. Fairman, and 5 minutes for Ms. Boyd when those two arrive. But seeing as you're here, Mr. Benasiak, you can kick off first with 5 minutes.
Early bird gets the worm. Thank you,
Indeed.
Deputy Chair. Thank you, Minister. Does the New South Wales Government acknowledge water licences as a property right as per the co-aid agreement on the Strategic Water Forum, the National Water Initiative and the 2012 MTB Intergovernmental Agreement?
Yes, that is the law.
That is the law. Excellent. So then, does the government then accept that any changes in rules or operational conditions, such as a drought of record that reduces the reliability of those property rights, must be compensated accordingly?
Yes, we do, as I indicated, recognise that the law is that a water licence is a property right held separately from the land, and that as a property right it needs to be dealt with in the same way as other property rights.
Meaning that if something hinders the reliability or the value of that property right, then...
There is a legal framework for the way that is managed in relation to water licences, and obviously we support and will be adhering to that legal framework.
Okay. So if the connectivity report, as indicates, sets up a process for water recovery for the environment, will owners of that water be compensated appropriately, regardless of how much water is recovered under that process?
Well, I would say a few things. One, you've walked a few steps ahead of where we're at and posed a hypothetical. I just really want to reiterate, Mr. Benasiak, that we haven't even completed the modelling work that underpins potential reforms under the connectivity panel. We will be doing that, and we want to get that work moving. But there is a long way to go from where we are now to the hypothetical that you have posed. However, and I have said this repeatedly, if there are any changes to people's entitlements to water as a result of that work, after consultation is done through the proper mechanisms in our rules-based framework, through water sharing plans, then yes, the provisions in the law in relation to compensation will of course be applicable.
Okay. So if I take some steps back to where you are now, in terms of the modelling, how you haven't even set up the process yet for modelling, or you're going through that process?
Yeah, so the hydrological and economic modelling, we have commenced some work on that.
And that's all done. That's all been done internally. No consultants doing any of the economic modelling at all, or
No, the department's doing that work,
Yep.
and we will have completed it by the end of the year.
okay. And is there a specific funding amount for that modelling to be done?
It's within existing resources.
Within existing resources, okay. And to be done by the end of
2024.
2024, and then it will be shared with the public?
Yeah, I mean, it's our intention to make it public. We have nothing to hide in relation to this. The draft report of the connectivity was made public. The final report was made public.
Am I right to assume, in terms of the economic and hydrological, you'll be doing a lot of consultation with irrigators who hold water licences as part of that?
If we need to do consultation to inform the basis of that modelling, we will. We want to make sure that modelling is robust and accurate.
I guess consultation is probably the wrong word. Will you be actually seeking input and data from them in terms of how much water they use? What's their economic output from the use of that water?
If it's required to ensure that the modelling that we do is accurate, then yes. We don't want to waste time doing modelling that is inaccurate and not accepted by people who are part of this process.
I guess in terms of economic, how else would you get access to that sort of modelling if you're not going directly to the farmers and water holders to say how much of does this water equal in terms of economic production? How else would you get that data if you're not going directly to
Well, I mean, there are other measures of economic activity and output per region than just asking producers in that region. But I accept your point that they may well have useful information to contribute. And as I said, I don't want to waste time doing work that people who are then part of this process are going to turn around and say, well, we don't even accept the fundamental basis on which you've made decisions. That's a waste of time. I'd rather bring people into the process so that everyone can accept the ground rules.
Thank you, Minister. That's our 5 minute speed dating round over.
Perfect. We'll now go to...
Time flies when you're having fun.
Ms Fairman for 10
Put on the
minutes.
record, 3 estimates in 1 day is absolutely ridiculous. Okay.
Noted.
Minister, you might need to do one. Will you require all water utilities, including Sydney Water, to do everything within their power to remove PFAS from drinking water?
I will require them to meet the Australian Drinking Water Guidelines, which is what they are doing. If those guidelines change, then we stand ready to comply with those amendments. But that is my expectation, that they are meeting Australian Drinking Water Guidelines.
Considering we know that the guidelines aren't up for review, I think they're being reviewed and they won't be changed until late next year, and the various reports, indeed evidence of PFAS in our water, why wouldn't you look at acting to ensure that the water utilities are putting in place measures to reduce PFAS though?
Well, I mean, to some extent they are, in the sense that particularly Water New South Wales as a catchment manager, has a range of work that it does to ensure that catchments are safe and clean, and that the water that is in our dams and reservoirs and then is treated by Sydney Water is as clean as it possibly can be. But as I've indicated, we're not experts in what is a safe and healthy level of PFAS for the human body to consume. That is a health decision, and we welcome health experts reviewing and updating that as constantly and rigorously as they can. But all we can do is ensure that as water utilities we're complying with those guidelines, and that is what we are doing. And we treat our catchments and our water reservoirs incredibly seriously. They're very, very precious things. That work is already happening, but beyond that it's not reasonable for us to do anything other than adhere to the Australian Drinking Water Guidelines.
Are water utilities, including Sydney Water, undertaking any work at the moment, or have they, in terms of the methods by which PFAS can be removed from drinking water? It's put in place different methods across different parts of the world. Obviously the US has a hugely reduced level guideline in terms of the upper limits now, and I know they're phasing it in, but they've started, and there are many measures that can reduce the vast majority, in fact remove the vast majority of PFAS from drinking water. What's Sydney Water doing and other water utilities doing at the moment to explore that? Because if the drinking water guidelines change, you'd want them to be prepared to immediately implement them.
Yes, I mean, I may ask Mr. Shiro or Mr. George to comment, or you could talk to them this afternoon. I would say a couple of things. We are engaged in work as utilities, also through the Australian Water Alliance and other national and international networks of researchers to explore how we can ensure that our drinking water is as safe as possible. I mean, look, it appalls me as it appalls you that the world is unfortunately contaminated with these pollutants, and big polluters bear a real responsibility for that. Yes, we are exploring what we can do. I should indicate, Ms. Fairman, it's challenging work. There is not an easy way to remove PFAS entirely from water or from, in fact, any substance. It is not straightforward. However, in answer to your question, both in terms of catchment management and the protection of our special areas that feed in to the reservoirs and dams, and in terms of exploring things we can do to treat water in a way that minimises PFAS. Of course, we are engaged in that here in New South Wales, nationally and internationally.
Okay. I just wanted to get to just the bottom of, I suppose, the testing by Sydney Water in terms of PFAS. Now, it was back in June that it was reported that PFAS levels were detected, and the results were, I think the Sydney Morning Herald reported it as put quietly onto the Sydney Water's website. So firstly, in terms of that, was that the first testing that had been undertaken by Sydney Water for PFAS?
No.
So was that the first time that PFAS levels had been detected in Sydney Water, our drinking water?
I might ask Mr. Chareau to come up to the table. I understand that water has been subject to testing since 2015, I think.
For PFAS?
I understand that is when Sydney Water first started.
So that's correct.
Yeah.
So we started discussing with Health and Water New South Wales.
Mr. Chareau, could you please just bring the microphone a little bit closer to you? Thank you.
Yeah, we started the discussion on PFAS with New South Wales Health and Water New South Wales back in 2015. So the Australian Drinking Water Guideline is pretty clear about the methodology that should be used in terms of any elements in the water and how they should be tested. So it's a risk-based approach.
Yeah, so when did you start testing?
So
when did Sydney Water start testing, Mr. Chareau?
The first testing was in 2018. And that was done at that time because we had...
How frequently? So starting at 2018?
So at that time we had some of our customers near the Richmond base that were worried about PFAS, and that's why we tested. Now the inflow of water is actually downstream, about 7 kilometers downstream of the intake of the water treatment plant. So we detected some PFAS, but not far below the Australian Drinking Water Guidelines. So in Richmond, it's been tested since 2019. And
how frequently is that tested?
It's every year.
That's right. So
yeah.
you're testing once a year.
Correct.
And what happened to those results once a year? And you tested how many locations?
So until this year, we tested only Richmond because the risk-based approach of the Australian Drinking Water Guidelines clearly says that there's no source or acute source of PFAS in the catchments, then there's no need to do testing. Now, we had more discussion this year with New South Wales Health and Water New South Wales, and because some of our customers were asking us what is the level of PFAS in our water, then we decided to test the water everywhere.
So this was this year?
That was this year, yeah. And of course, as the risk analysis was predicting, there was no PFAS level that were above the Australian Drinking Water Guidelines. So all the PFAS detected was under the Australian Drinking Water Guidelines.
In what form, when you're saying your customers were asking you to test, were they sending you letters? Like, how were they asking you to test this year?
Well, we always engage with our customers and community, and that's through all sort of things. So sometimes we've got people in shopping malls, or we've got surveys, we've got discussions, we've got town halls with our customers. And because the question of PFAS was coming up, that's something that we did.
So they were asking you to test. That's what the customers were asking.
They were not asking us to test.
Were the results put quietly on your website and didn't really come to light until the media started inquiring about it and it became front page news in the Sydney Morning Herald?
So they were not. Our customers were not asking us to test. They wanted to know if there was PFAS and at what level, and if it was compliant to the Australian Drinking Water Guidelines. So that's why we tested, and when the results were available, then we put them on our website.
I'm not quite sure how you can loudly put something on a website, Ms. Fairman. I appreciate...
No, I think the idea is, I think the whole point is that it was just put on the website as opposed to notifying those members of the community. If you're saying the community was concerned and then it was just popped onto the website, I mean, I don't know too many people who would continue to look at that. That's the whole point. There's a wide range of communicating with members of the community. So how much more frequently now is Sydney Water testing?
So we're testing every year because, as I said, there is no source of PFAS. Now, for one...
But PFAS is there. Minister, regardless of the fact there's no source of PFAS, PFAS is now there. Sydney Water testing as a result of community concerns actually found more PFAS than what Sydney Water was finding. I would suggest it's also probably because we have scientists and their PhD students testing the water and uncovering alarming levels and speaking with both Sydney Water and the community about that.
Well, I mean, I would reiterate that PFAS is a pollutant and we're distressed that there is pollutants in our environment. They are not alarming levels to the extent that they are consistent with Australian drinking water guidelines. Mr. Shiro has indicated that the reason that we didn't do an alert is because the question that was being asked of Sydney Water, is the water compliant with Australian drinking water guidelines? A valid question. The answer was yes. So I appreciate your concern, and we are in dialogue about a more regular testing regime. We want to make sure that we are meeting community expectations in relation to the provision of information. We don't have anything to hide here. And I take on your feedback, as does Mr. Shiro, about more regular testing. But at the end of the day, it's really important to indicate that every single test we have done so far has indicated that despite some evidence of trace and in a very, very limited number of circumstances, elevated PFAS levels, there isn't anything to be alarmed about because our drinking water is compliant with the guidelines, and if those guidelines change, we stand ready to comply with them as well.
Thank you. We'll go to Ms. Boyd.
Thank you very much, Chair, and good morning, Minister. I'm going to depart from tradition and ask you in budget estimates about expenditure in the budget.
I'm ready.
Brace yourself. So the $5.1 billion that was announced in relation to social homes, I understand that was 8,400 social homes, 6,200 new and 2,200 replacement over 4 years. In the infrastructure statement, it indicates that $1 billion has been put aside for this year for approximately 1,025 genuinely new social homes. Is that correct?
Yes, I was following along with your numbers there, but yes, I think that it is.
Does that $1 billion a year include the federal amount that came through the HAF negotiations that the Greens secured, that $3 billion that then got distributed?
So the Greens secured, I revised that. The Commonwealth delivered $2 billion as part of the Social Housing Accelerator. Mm-hmm. That's not HAF money, so that's called the Social Housing Accelerator. Yep. That's $2 billion, $600 million for New South Wales.
Yes.
No, that money is not part of the budgetary amounts that you have described. The HAF is a different source of money,
$1 billion.
which will $10 billion in the future fund.
Yep.
The dividends will be divided amongst the states. We've put in bids for round one, and we await news from the Commonwealth as to whether we will be successful. So obviously that's not included because we actually don't know what we will be receiving.
So where has that money gone then from the social
so that is
accelerator?
Listed separately in the budget as Social Housing Accelerator. You can see it separately accounted for.
So that's in addition?
Yes, that's right. So that was $600 million.
So how many new homes will that add to the 1,025?
So we are delivering 1,500 homes as part of the accelerator. Now, that is a combination of grants to community housing providers, homes that we are directly delivering, and vacant restorations.
Sorry, 1,500 over how long?
What is the timetable for the delivery of the accelerator? Over 3 years.
Over 3 years. Okay, so about 500.
July 2028, Ms. Boyd.
A year. Okay, so we're looking at about 1,500 social homes each year.
Well, we are hopeful to receive money from the Commonwealth under the HAF, but yes, obviously that is not secured at this point.
Given that we have a current wait list of 50,000 families waiting for homes, that then comes to about 5% of the new houses required just to clear the backlog. Is that correct?
Well, yes. I mean, and just to be clear, unfortunately, we currently have 56,000 families waiting for homes. So, yes, there isn't a suggestion from me, Ms. Boyd, that the contributions that we have made are going to clear the waiting list.
No.
The effort that I am making is to make a significant dent in the priority waiting list.
Yeah.
And over the period of the delivery of the accelerator, the Building Homes for New South Wales program and the HAF, that figure, we are really running headlong towards reducing it.
Okay, but how much? But we're still only looking at 5% of the new houses required, a bit under, because you've said there's actually more on the wait list. NCOS is calling for 5,000 a year. I understand that you've inherited a lot of this, but if we're looking just at supply and not addressing the multiple other levers that we could be pulling, we are really behind. Like, that is... So what are we going to do, I guess, to increase that amount times 20? It seems impossible.
Well, I mean, as I've indicated, yes, we are behind. This is a historic investment. Is it going to clear the social housing waiting list? No. What are we going to do about that? Well, ensure that this delivery pipeline is done on time and on budget, makes the kind of contribution that I hope it makes, in particular to the priority waiting list.
Yeah.
My view is that this work will demonstrate how valuable these investments are, the impact that the government housing delivery program can have on overall supply, and that this will create the conditions for further investment.
I guess given that this is comparatively small and we have...
Well, it's comparatively
I understand,
large.
and it's not going to happen, sure, it's all relative, and it's not going to happen for some time. There are levers we could be pulling right now that would release new homes. For example, empty homes levies, meanwhile use, there's a whole bunch of other things. What is your government doing to implement other things that would have a much quicker impact?
I'll just mention two briefly for you, Ms Boyd. One is meanwhile use. You are right to identify that as a big opportunity. We have a program to unlock our homes that are vacant on the path to redevelopment that you have described for meanwhile use. And we've already delivered one of those at a property in Glebe, and there are others on the way. So yes, we are doing everything we can to make our homes available for meanwhile use, as well as exploring opportunities in the planning system for others. The other thing that we are doing is our work on modern methods of construction, which is a way that we can deliver homes, not necessarily permanent social homes, although potentially permanent social homes, much more quickly. And that is part of our new supply pipeline. The AHO in particular has done an excellent job at turning around new homes for Aboriginal people very quickly. So those are just a couple of examples of what we are doing in the short term to address the challenge.
Thank you. We'll move back to opposition and Ms McLaren-Jones.
Thank you, Chair. The New South Wales Government made an election commitment to fund and fast-track a new Yass water treatment. We're now 17 months on, and what's the progress on that?
So we've made a submission alongside the Council to the National Water Grid to secure funding from the Commonwealth to complete the funding package. I'm very confident about that submission, but obviously we are relying on the Commonwealth to make a decision. But we've contributed the $13 million that we promised in the budget. Excuse me, Ms McLaren-Jones. We've contributed the $13 million we promised in the election. We've added $6 million to that in the most recent budget. So we are now contributing close to $20 million towards that project. That's not the entire cost of the project. It's an expensive project. With Commonwealth funding, we will have the full funding envelope, and then we'll get on with delivering the upgrade.
And what's the total cost, projected cost?
I understand the total cost in the final business case is, what was it, 28 million? Or I might have to take the final
23 and 18. So yeah, it's just over
40 million.
And when do you expect to hear from the federal government?
When are we expecting?
End of the year.
End of the year.
And do you have a plan B if the funds aren't approved at the federal level?
Well, I mean, find the money ourselves. That's not straightforward. As I said, we've come up with about half of that amount. We're looking to the Commonwealth to contribute the rest. If we have to find a way to reallocate within our resources to make this project happen, we will address that when we come to it. But obviously, as I indicated, I'm really hopeful that the Commonwealth understand this is a growth community. They've been promised an upgrade for many, many years. Nothing's happened. They're not comfortable drinking their water, even though, of course, I reiterate it's completely safe to drink. I understand it tastes and smells a bit funny and they don't want to drink it. So, yeah, I'm hopeful the Commonwealth understand that this is a very worthwhile project.
And will you rule out that there'll be no increase in water rates for local residents?
Well, I actually don't issue water rates to those local residents. There's a local water utility who does that. I can't speak for them. That's their decision. So ask Yass Valley Council.
Minister, in 2023-24, how many young people transitioned from specialist homelessness services to stable accommodation?
I might have to take that figure on notice, but we can get it for you.
And for 2023-24, do you know how many young people were sleeping rough?
Look, no. The best estimate that we have of rough sleeping is obviously the street count. That was about 2,000. I don't think that is broken down demographically, so I probably wouldn't have what I would describe as an accurate figure that represented that. Data capture is obviously a bit of a challenge in homelessness, so we sometimes don't have the kind of data that we would like available.
And what steps are you taking to be able to capture particularly that hidden homelessness, so people that are couch surfing, house sitting, various other types of
it's a really, look, it is a valid question, and I think you have perhaps moved a motion in relation to this in the chamber before, Ms McLaren-Jones, and I've supported your call and the sector's call to find ways to capture hidden homelessness better. We have the homelessness strategy that we are finalising at the moment, and obviously part of that is capturing the data we need to make good decisions. There are ways that we try. Obviously the census, is a point in time, but yes, I think, as again you've rightly pointed out, and I agree, and the sector's pointed out, well, that's a one-night capture in 2021. How can we use that really now to make decisions when we know so much has changed? I could ask Ms Pinkston perhaps to talk more, or you could talk to her this afternoon about some of the detailed work in the homeless strategy around data capture, but it is something that we are trying to get a better handle on. Is there anything you wanted to add?
I'm happy to cover that this afternoon.
I understand. Yeah.
But has there been any funds allocated in this budget for data development?
Well, we've allocated $100 million for the Homelessness Innovation Fund, and it could well be the case that improving data capture and development is a very good use of some of that money. Obviously, a bunch of that money is going to go to direct service provision, but the principle of the Homelessness Innovation Fund is there are a lot of very good ideas that previously have struggled to get off the ground because of resource limitations, and we want to give them a go. And so innovative ways to capture data could well fall into the category of...
But no specific funds have been
No,
allocated.
but the $100 million for the Homelessness Innovation Fund is a pretty good start.
Minister, do you monitor the housing status of adolescents entering and leaving detention?
Well, we do have a piece of work with Youth Justice and actually Corrective Services around people exiting forms of custody and ensuring that they don't enter forms of homelessness. So we do have a collaboration with Youth Justice.
And do you have the figures for 2023-24 of how many homeless adolescents were detained under Section 28 of the Bail Act?
No, I don't. I'd have to take that on notice.
Minister, could you outline what family intervention programs are available to support homeless adolescents on community orders and leaving detention?
I think that would largely be managed through Minister Washington's portfolio. Our role is to ensure that if those orders require housing support, that we are able to make that available, and we do that. In terms of the management of family intervention orders for young people leaving Youth Justice, as I said, that would either be Minister Washington or Minister Dipp, but if as part of that work there is a housing gap, that is a piece of the wraparound support that a young person needs, we would then ensure that that need was met.
Minister, you announced in the budget $250 million to support people who are homeless or at risk of homelessness leaving correction centres and mental health services. How much of that money will be actually going to young people?
I don't have a demographic breakdown. I was very proud of the investments that we have made to break cycles of recidivism, re-entry into forms of incarceration.
But Minister, this was an announcement you made specifically to address people who are at risk of homelessness leaving detention centres. Now, will that support young people or is it only for adults?
No, my understanding is that it is available for everyone who requires housing and homelessness support, but I don't have a breakdown of how that will be allocated across different demographics.
And it's being managed by you or by Corrections Minister?
By the Corrections Minister, but as I said, we work deeply in collaboration on these issues. If there is it's not, obviously, as you know, Ms McLaren-Jones, often the needs, not just of young people, of everyone leaving incarceration, but particularly of young people, are broad. There's not just housing support that they need. Perhaps there is mental health interventions or drug and alcohol interventions or family restoration.
But you can't provide a breakdown today as to how much will support those that are leaving correctional facilities, whether adults or young people, and nor can you give a breakdown of how much will be allocated for those leaving mental health services.
No, I can't provide that detailed breakdown, but I will take it on notice.
Thank you. You mentioned the homeless strategy. Now, at last estimates, you said that would be released in mid-July. We're now in September. When will the announcement be made of the new strategy?
Well, we're looking towards the end of the year. The reason for the delay is, one, we had homelessness services come into Homes New South Wales from DCJ, and so that machinery of government change was one that we needed to ensure was successful, which it has been. And two, we had the budget. And the budget is a game-changing intervention for homelessness, not just the $100 million Homelessness Innovation Fund, but every service that I talk to, every homelessness service, there's many issues. Probably number one is lack of stable long-term public housing. Okay. That is
Minister,
critical.
I'll just focus on the strategy, so that'll be at the end of this year. How much has been allocated in this budget to the implementation of that strategy?
Well, $6.6 billion. Because
the implementation of the strategy.
The strategy goes to all of the issues that we have addressed.
I'm asking
now.
specifically, Minister, how much has been allocated for the New South Wales homelessness strategy?
Well, the development of the strategy or the implementation of the strategy?
Well, both the development and implementation. Is there any money that's been allocated in this budget for the homeless strategy?
Well, yes. So I understand around $20 million, perhaps $25 million for the development of the strategy. Now, that is a different thing to the implementation of the strategy. So, yes, we have allocated money to develop the strategy, but the strategy is worth nothing. It's a waste of $25 million or however much we put in. I can get you the exact figure. If, as you say, the implementation is not funded. So the $6.6 billion speaks directly to the priorities of that strategy. There may well be other elements of that strategy that require additional budgetary allocation, and we'll deal with that through the budgetary process next year. But as I said, every homelessness service that I speak to says the number one thing you can do is build more public housing, and we've put billions of dollars in the budget to do that.
Minister, will there be a youth strategy?
So we are doing a youth action plan alongside the strategy. That decision was made in collaboration with the sector, who wanted a separate piece of work that spoke to the particular issues of young people, and that youth action plan is being co-designed with those organisations, and they're...
and is there funds allocated to that plan? Or is it part
to the development? So the development, I think, is funded within that budgetary allocation for the homelessness strategy because they sit together. The implementation, well, again, there is budgetary allocation within the $6.6 billion specifically for programs for young people.
Okay. Minister, I've asked you previously about the link to home service, and in particular, we've seen an increase to over 38 minutes from 7 minutes in that 12-month period. In the budget, has there been anything allocated to meet that demand?
Well, yes. The reason for that increase in time is that we have seen over 100,000 additional calls in the last 12 months to Link to Home. And that huge volume increase has unfortunately had an impact on wait times for the service. Through the budget, we've allocated money
specifically to try and resolve the immediate need for accommodation that Link to Home primarily meets, and that is temporary accommodation. So many people...
I'm actually asking about the Link to Home service. So there's been no change in staff numbers.
So there has been an increase in staff numbers. Ms Pinkston, do you want to speak to that? We did absolutely surge staff numbers to try and resolve that.
What's the current staff number?
Let me get it for you. At the moment, staff that are trained for Link to Home, because people move around within the call centre, are 252 of the 352 staff.
Okay, thank you. I might move on to the Innovation Fund. Now, when is the criteria for that fund going to be announced?
Very soon.
Do you have a time frame?
Weeks, within the next few weeks.
And you would be quite familiar with salt waters down in the South Coast. Now, they've been advised by the local member that they would be able to apply for funding through the Innovation Fund. Is that correct?
Yes, that is correct.
So what criteria are you looking at? We've heard before that it could be quite broad.
Yes.
So how are you intending to allocate that $100 million?
Well, I mean, it is quite broad.
Anyone can apply.
Well, I mean, it is quite broad deliberately because we want to make sure that all of the full range of services that might be meeting the needs of the homeless community are able to participate. There's going to be a few things that are top priorities for us. One is temporary or emergency accommodation. We are seeing literally just following on from our conversation about Link to Home, a huge increase in demand for temporary or emergency accommodation. And so services that are meeting that need and are able to work with us to manage that are going to be, we're going to be very interested in those applications. The other ones, filling gaps where existing specialist homelessness services and other programs are not operating or not operating well. Obviously, we're keen to identify them. And then just creative ideas. My view is that there is a lot of really interesting stuff that the sector has proposed over many years that has struggled to get off the ground because resources have been limited. And a number of these ideas have got a lot to offer. So yes, we're going to have to make decisions. There's not going to be enough money for every good idea, but those are the kind of things that are going to frame the decisions we're making about what programs to fund.
Thank you. I might examine that a little bit further this afternoon.
Sure.
I might move to a couple of questions around mental health. Now, the mental health complex at Westmead, it was originally stated that it would be completed in 2026. That date's been revised to 2027. What efforts are being made to ensure construction will be completed?
Well, the SWIM-HIP, the Statewide Mental Health Infrastructure Investment Program, or whatever that ridiculous acronym is a big piece of work. And yes, Westmead is one of our top priorities. I mean, what are we doing? Well, trying to get on with it as quickly as we can.
And how much has been allocated to this project?
Do you have the Westmead figure? $540 million.
What efforts are being made to ensure that adequate training for staff at the existing Cumberland facility and the mental health complex at Westmead will be ready when it's operational?
Yeah. Well, as I think we've talked about at previous estimates, we have a pretty robust engagement with staff at the Cumberland Hospital. There's obviously been issues in relation to staff there, and we accept that. And so, based on the work plan that was developed by Dr. Lyons and Dr. Wright, that I asked them to develop, based on some of the concerns that were raised. That's given us a roadmap for that work. We have a new...
Are you implementing all the recommendations?
Yes, we are. And I'm advised that the implementation of all of those recommendations is on track. I could ask Dr. Wright to elaborate, or you could ask him this afternoon. I will indicate that we have a new General Manager of Mental Health for the Western Sydney Local Area Health District. So we have also done some restructuring of the executive leadership at the LHD to meet exactly the need that you have identified. It is a big move to the new Westmead campus. I'm very excited about it. We want to make sure we're well set up for success there, and that's why we've done leadership restructuring, reviews of processes. We're implementing the finding of those reviews. Those recommendations have all been accepted. And look, I have to say, my sense is that things are improving. There are still issues in Western Sydney LHD, I don't deny that. But I have seen an improvement in terms of some of the culture and engagement in recent times, which I think is positive.
Thank you. You announced that the establishment of 3 sites focused on specialised long-term housing for those with mental illness and psychological disabilities. One of those sites has been announced for the Central Coast. When will the announcement for the other 2 sites be made?
We're working with the Haven Foundation, which is our NGO partner on those sites. They are trying to secure land. It's not straightforward. Land is expensive. And we're trying to make sure we get maximum value for money, as it were, for that election commitment. I am hopeful that we will be able to have the other locations identified by the end of the year, but I've met with the Haven Foundation a number of times this year to try and ensure that that project is on track. It is difficult for them to secure land that is suitable for the type of specialised housing that they are providing, within the budgetary envelope.
And just on the Rouse Hill Hospital, is the government on track to deliver the mental health services there?
I'm advised that we are. It's not been indicated to me that there are any challenges. Ms. Wilcox is nodding.
Not that I'm aware of.
Not that she's aware of.
And how much has been allocated to deliver those services out of the 300 million?
I'd have to take that on notice.
Yep. In relation to the 527 million to address homelessness that you announced this year, is that new money or some of it existing funds that are carrying over?
That's new money.
And how's that being broken down between emergency crisis housing, support services and innovation fund?
Well, $100 million is going to the Innovation Fund. My recollection is around $300 or so million. I might have to take the exact figure on notice, is for temporary or emergency accommodation. And then there are some, I'll have to take the rest of it on notice, or I could try and find my note, but those are the kind of 2 top line elements of that, but I'm happy to take on notice a specific breakdown.
Minister, how much was allocated in this year's budget to crisis accommodation?
I wonder if that's here. I might have to take that on notice, or perhaps I can come back to you just at the end with that figure.
That's fine.
Thank you. We'll go back to the crossbench. Ms. Fairbairn.
Thank you, Chair. Minister, I wanted to turn to the issue of Walgett town water quality. I wrote to you, I've written to you, as you know, and you've written to me in response a number of times about this issue. In response to one letter I wrote to you today, this year, you responded to me on the 23rd of May this year saying that I can assure you that the town water for Walgett is safe to drink. So on what basis did you make that assurance?
On the basis that I was advised by the local water utility who deliver the drinking water there that it was within Australian drinking water guidelines.
So what the bore water, which of course is what many people are drinking unless they're buying bottled water, is that particularly with people with for people with severe medical conditions, that it has sodium levels 15 times higher than what is safe for those people. So I know there's drinking water guidelines, but then there's others for people with kidney issues and other health issues. So how can that be considered safe to drink for the particularly First Nations community of Walgett?
Well, as I said, it's safe to the extent that it is within Australian drinking water guidelines. And that is a very important principle. Those guidelines are robust and clear, and drinking water must be within them, and it is. If I did not indicate this elsewhere in my letter to you, I apologise, Ms Pham, because I have indicated various times publicly, I accept that the bore water is higher in sodium, and that can pose a particular risk to some people with particular medical conditions. I accept that. Also, it doesn't taste very good, and the community are, similar to questions in relation to Yas earlier, dissatisfied with drinking water, tap water, that tastes bad, and they don't drink it on that basis, and that's not acceptable to me. So it is safe. I don't want people to think that they are going to get sick purely on the basis of drinking the tap water. They're not. But it isn't acceptable to me that the primary water source, which is not bore water for Walgett in non-dry times, it's river water from the Namoy, and that, in my expectation, is that water is the water that is being provided there.
So there's I understand that the Darawar Elders Group from Walgett has been working with a partnership with the University of New South Wales and the Walgett Aboriginal Medical Service. That partnership, that project, has recently undertaken testing of the water. So they've undertaken testing for nutrients, chemical oxygen demand, metals, pesticides and algae in the Namoy and Barwon rivers. They're releasing that report. In that testing, they found nutrients, metals and pesticides. Some results exceeded the levels recommended for healthy ecosystems. As you're aware, there's drinking water guidelines in healthy ecosystems. They do say that 3 of the pesticides detected are banned in the European Union. These are atrazine, diuron and a mixture of S and R metolachlor. What have you heard of this? Have you requested Water New South Wales to undertake testing of those rivers, and why is the community having to undertake testing itself? I don't think they've got any confidence in what they're hearing.
Yeah, I mean, well, this is perhaps an even more challenging circumstance, Ms Fairman, because they don't want to drink, understandably, they don't want to drink the bore water. It is higher in sodium and it doesn't taste great. They should be drinking treated water from the Namoy River. Now, I mean, I'm not familiar with that research, but if the treated water from the Namoy River if the water from the Namoy River is also problematic, well, I mean, we're in a little bit of a pickle here. I'm not familiar with that research. I have met...
I think it's just been completed.
I have met with the Darawar Elders Group and the Walgett AMS in Walgett, so I am familiar with their advocacy. I can ask Water New South Wales to comment on the testing, although I'm not sure that would really be, yes, Andrew's shaking his head, it's not really something that Water New South Wales would do as the river operator. They are not really responsible for that.
Okay, back to responsibility, I suppose, then, because you have provided assurances in the past. It was one of the very early issues that you dealt with when you became the minister. So what then, in terms of your responsibility as minister, can you do for the people of Walgett to provide them maybe with the ability to test the water, because they're doing it themselves with their own money or with independent funding? It just doesn't seem right, does it? That you're kind of at the one hand saying you're concerned, but then Water New South Wales, for example, isn't responsible. How do you assist them?
Yeah, well, I mean, we work with the local water utility there. And so, in terms of the division of responsibility, I accept these are fair questions. Like, this is the point of estimates, in a way, to try and get to who is responsible for what. The Walgett Shire Council, which is the local water utility for Walgett and Lightning Ridge, is responsible for the provision of drinking water, the testing of that drinking water, assurances that it is within drinking water guidelines. If they are not doing that. I mean, Water New South Wales is responsible for river operation, not that kind of work that I have just described. If there is a suggestion that the local water utility is failing to do that work, which I think is part of
I think that could be fair to suggest that's the case in this situation.
Then we would look to intervene. We have done a bit of that already to try and support them. Obviously, we funded a water treatment plant for them. We funded a reverse osmosis plant for them. They're not currently operating them, which is a source of some frustration. To be fair to them, there are workforce challenges. We are looking at what more we can do to support and hold accountable our local water utilities, particularly in Far West New South Wales. That's come out of the Productivity Commissioner's report into local water utilities and other work that we've done. So, you know, we need to be sensitive. We're very supportive of our local water utilities. A lot of them do a wonderful job. And there was a parliamentary inquiry that was led by Stephen Lawrence. That is all really important work. But ultimately, if there is a suggestion that a local water utility is not meeting the needs of its community, there are levers that we can pull, and we're willing to explore that.
Because we've also got information that suggests, I wonder if the Walgett, the Darawai Elders Group has informed you about this, that they're concerned that the supply of water with elevated levels of sodium in Walgett and surrounding communities is exacerbating corrosion problems in the plumbing infrastructure, as well as making the water unpalatable to most, if not all, residents, and obviously potentially harmful to residents taking medication for hypertension. That's with the water, as it is with the high sodium levels. Have you been informed about that?
I have. To be fair, the issue around corrosion is new to me. The other two issues I have been informed of. I am aware of those concerns. I do not consider bore water to be the primary water source in Walgett for those reasons, and in addition, perhaps the corrosion concern that you have raised. We have provided infrastructure to the local water utility to treat water from the primary water source, which is the Namoy River. It is not being used. As I have said, that is a source of frustration to me. There are workforce challenges, but as we continue to work with them to explore why, despite the provision of that infrastructure, which costs taxpayers in New South Wales millions and millions of dollars and is sitting there idle, why that is happening, we are willing to look at ways that we can more directly intervene.
Can I ask whether, so there's the Australian Drinking Water Guidelines, which is what you've referred to with the Sydney Water PFAS issue, Australian Drinking Water Guidelines, which sets individual parameters within that. Do local water utilities in New South Wales have to publicly report their drinking water quality data when they monitor it against those guidelines?
Well, I mean, they have to comply. Do they publicly report that information, Amanda?
They do report the information. I think we do publish that information.
Yep.
So every water utility has so you have a database that is publicly accessible for every water utility where the drinking water quality, the parameters as they relate to the Australian Drinking Water Guidelines is available.
It's probably presented as it mightn't be presented exactly against the guidelines. But yes, yes.
Okay, I'm the understanding that might not be the situation, so we'll just possibly even check on that. I'll check on that at lunch and come back.
We can also take on notice. I don't have any problem with the proposition that you are accepting, Ms. Fairman, which is that people in regional New South Wales should absolutely have an assurance that the water that they are drinking is compliant with drinking water guidelines, and that there would be some public reporting on that. And so if there's a slip betwixt cup and lip in how that's happening, we're happy to take that on and come back to you with what we think is being reported and compare that with your understanding and expectation.
Okay, we report on performance and health reports on the drinking water standards. So
thank you. Minister, who within the government, where does the overall healthy catchments sit, responsibility for the health of catchments?
Yes, it's a very good question. It sits between myself and Minister Moriarty primarily, as you know, with her responsibility for local land services. The issue that I assume you're going to allude to is the fact that that perhaps is not an optimum state of affairs. And we certainly have reflected on the fact that catchment management is not particularly well managed with that relationship between someone being responsible for the river, and then as soon as it goes onto the river bank, it's someone else being responsible. Obviously, they're directly linked. And so one of the things that we've done out of the chief scientist's report into the mass fish deaths was fund a piece of work to better integrate catchment management within government and have more direct responsibilities.
What is that piece of work?
It's an integrated catchment management framework. It's part of the $25 million over the next 4 years that the government has committed to respond to the fish death report by the Office of the Chief Scientist and Engineer. As the Minister says, it pulls together local land services, water in terms of...
Just for that catchment?
No, for New South Wales.
For New South Wales.
A whole catchment management framework for the state.
For $25 million?
No, with the work for that's the whole package.
Okay.
In response, so it's about 1.7 million. It'll take about 2 years. It involves...
Thank you, Ms Jones. I can come back. We can come back.
And BCS.
But I am interested. I'm very interested. Last week I heard you say that you answered questions about Yass Water earlier when I wasn't in the room. Last week I visited Yass and spoke to people obviously about the very ageing water treatment plant, but also the issue with the catchment, because there's no protected area. Everything flows into Yass River in terms of industry, farming, and it did alert me to the fact that, of course, the catchment action plans that were in place under the catchment management authorities in the previous government, that in fact I was on the Natural Resources Advisory Council and had quite a bit to do with that, which has started almost 22 decades ago now, but was very much in place when the former Labor government was in, the coalition government came in and scrapped the lot.
Yes.
But what those catchment action plans did was had science-based targets for riparian vegetation, for monitoring the health of the catchment, KPIs, a lot of money put forward, integrated. It was, it was a big deal. Then I've just, it has come to light, of course, that this current Labor government doesn't seem to be considering that at all.
Well, no, we are. So, Ms Fairman, you are absolutely right. I am aware of the history that you are describing. In Victoria, they still have catchment management authorities.
The question is, please, in terms of the targets around healthy catchments from an integrated way, ensuring that, water is protected, like what we started to see in the previous government. What is your government doing or will do to get there?
So we're developing the framework. Now, obviously we're not at the point of the targets yet, but we have put money aside specifically to develop the framework. And yeah, it's unfortunate that we're coming from a low base. As you say, that work was undone, we don't have it. You started your question, who is responsible? There isn't a clear answer to that. But I'm indicating to you, I recognise the point that you've made. So is the Chief Scientist. He specifically identified this lack of integrated catchment management as one of the contributing factors to the mass fish deaths in the Menindee Lakes. So I recognise it's an important piece of work, and we have funded in the budget the development of a framework which seeks to rebuild what you have described.
So that, yes, will take some time, because it was also the work of the Natural Resources Commission for a bit to look at that. Now it's all, water sharing plans, water management plans in terms of water, in terms of biodiversity, it's forests. It all seems very disconnected. So if you're doing a framework, what are the terms of reference what have they been asked? What has that framework been asked to come up with? Again, just because this was a whole of government, very, very big, government system, but framework with the catchment action plans and CMAs. Because, local land services just don't operate like that, although I know it's the wrong budget estimates to talk about
But it is true to say that is a gap, that we don't operate well together. That is why we are developing the integrated framework. Ms Jones can talk a little bit about that now, or perhaps you could ask her this afternoon, but I want to assure you that our intention for that work is to create the framework for the kind of integration that you have described and that we are lacking.
Okay, well, I will come back to it, and I will be looking at that with a lot of interest in terms of how that develops and how quickly that develops. I do want to go back to the gas water issue, though. I'm aware that there's the funding that has been applied for. Your government has committed some funding, and there's a funding that's been applied for from the National Water Grid?
Mm-hmm.
Yes, of $18 million or something. What happens if that isn't provided by the federal government?
Ms McLaren Jones did ask this. I apologise, Ms Fairman. 3 estimates on one day is a challenge for you. I can't take responsibility for that either, but I do apologise. We will have to work on a plan B. Now, we don't prefer plan B because that requires us to find the $18 million from other sources. I reiterate my confidence that the National Water Grid will see the value of this investment for not just the people of Yass. This is a growing region, and I have visited that water treatment plant. It is ageing. It is not a fit-for-purpose modern facility. I have been public in my advocacy for the Commonwealth to look fondly upon that application. If we need to go to a plan B, I guess we'll go to a plan B. But I'm not going to, at this estimates, my position is plan A. The Commonwealth comes up.
And in the meantime, because it's going to, if it is approved, it'll take 4 years to build.
There's other things that we're doing with the council there in relation to, cleaning the pipes and other things. That's sort of part of, I think there's a magnesium build-up in the pipes, and we're dealing with. There's other things that we are doing. Again, perhaps Ms Jones can talk about that this afternoon. I want to assure you, to the extent that we are doing things now, we can. That is not going to fix the problem. The water treatment plant is the fix. It's an expensive fix, an important one. So that's why we're very focused on that. Did you want Ms Jones to elaborate now on the short-term work, or?
No.
That's fine. She can do that this afternoon.
Thank you. Minister, in the short time, so McPhillamys Mine, Bolubular headwaters, what involvement did you have in... not what involvement. Have you assessed from a water perspective the impact of that tailings dam? Have you been briefed on what that tailings dam on the headwaters of the Bolubular River, which was going to concrete over 22 springs that flows into the Lachlan, into the Murray-Darling Basin. Have you been briefed on what the impact of a tailings dam on the headwaters would mean for that system?
I have been briefed on the fact that the department provided advice to planning as part of their independent planning process, which did assess those issues that you have raised and indicated to planning that there were no critical barriers or issues from a water perspective. Now, that happened prior to myself becoming the minister, but I have been briefed that rigorous assessment was done and that advice was provided to planning as part of the original granting of planning consent.
Thank you.
So we'll go to the opposition.
Thank you, Chair. Minister, you said earlier that you're working on, I think, the new structure for sort of young people and their voice in terms of state government. Do you respect the current avenues that are in place for young people in New South Wales to be heard?
Yes.
Yep. And then as part of that, obviously a key part would be the Youth Advisory Council. Can you advise, I understand applications opened for those positions some months ago. Is there an update on when the next iteration of that council will be announced, the membership?
Yes, I think it is within the next few weeks.
Okay.
I think in my diary in the next few weeks, I can take on notice the exact date. There is an opportunity for me to contact those new members alongside the Advocate for Children and Young People to advise them that they were successful.
Okay, so you would expect that, say, by, what are we, early September, by early October, that would be done and announced and
yes,
set
I
up.
would. Yeah.
Okay, thank you. I want to take you back to water and specifically the 5 accelerated SIDLAM projects. My understanding is that the federal department say that the 5 projects represent a $445 million investment in water infrastructure. Is that correct, that figure?
Oh, yes. I mean, I can check that figure. $445 million sounds accurate. Amanda, yes?
Yep.
Yes.
And so just on that, Minister, and I also want to talk about the budget papers, just so Miss Boyd doesn't think she's the only one who does. Just in relation to your own budget papers, they quote the SIDLAMs at $281.6 million over the forward estimates and an estimated total cost of $311 million. So why is there the difference between the federal amount of 445 and the 311 in the budget papers?
I might ask Ms Jones to comment on that. It is potentially because those funding arrangements between New South Wales and the Commonwealth are subject to various state federal funding agreements that are in the process of being renegotiated as part of the extension to the Murray-Darling Basin Plan. And so it is, as we are renegotiating around the delivery of our projects under the Murray-Darling Basin Plan, there's still work that is going on between New South Wales and the Commonwealth to finalise some of those projects. I want to reiterate, I'm very enthusiastic to have them finalised as soon as possible, but there is still some work to finalise, and that until that's done, obviously we don't have final executed funding agreements with the Commonwealth for all of that work. Amanda, did you want to add anything?
I think that it probably combines the 6 SIDLAM projects as well as the Reconnecting River Country
okay, because that was going to be my next question, because the Commonwealth in August, they're talking about $274 million through Reconnecting River Country.
That's correct.
So is that part of the 445?
Yeah.
Yes.
Right, okay. In terms of the funding agreement for the SIDLAM projects, the completion date, I think, for all of them is the 31st of December 2026. And that's a hard and firm date?
Well, it's currently legislated.
Okay.
So that's for the 605 gigalitres. Obviously, the 450 additional recovery is 2027. But yes, they are now legislated dates for the Commonwealth.
Are you comfortable that you'll be able to, I guess, hit what you need to by that date, Minister, for lack of a better term?
Oh, yes.
As much as you can?
Look, I don't want to be on the record here, Ms Mitchell, saying absolutely no problem, it's all done and dusted. That is not the statement that I'm making. As I've just indicated, there are elements of those projects, but we haven't even finalised our path forward with the Commonwealth. It is going to be challenging. It is going to be challenging. And communities are rightfully concerned, and they want us to be clear about what we are doing and when. We are working through the Basin Officials Committee and the MDBA on that. But I've always said the reason I supported the renegotiation of the agreement is we obviously needed more time and more money. We have secured that. Is it 100% assured that that is going to be an adequate time frame and funding envelope to deliver on the commitments that we've made under the Basin Plan? It's going to be challenging.
My understanding again is you're currently tendering for a managing contractor to provide oversight for those projects, is that correct?
For the SIDLAM projects, that's correct.
Yes. And when do you anticipate that contract will begin?
We're anticipating awarding the contract in October, so that the successful contractor can be ready to actually start work in the dry season by March.
Okay.
Yeah.
So, Minister, just coming back to you, so start March 2025, and I appreciate what you say about there being multiple factors, but all work completed in terms of that legislated timeframe by the end of December 2026. Do you think that's enough time for that work to be done?
Well, that is the time frame that we have from the legislation now. We are going to do everything that we can to ensure that as that work is done. I mean, there are multiple SIDLAM projects. I mean, New South Wales is responsible for How many, Amanda? I mean,
It's the 6 projects, but
Yeah.
there are multiple work
Yeah.
sites and multiple
Like, it is-
projects. It's
77 smaller sub-projects.
Yeah,
is
so-
the figure I've been given to. Yeah.
it's a big piece of work.
Yeah.
No, I do not want to be on the record here as saying 100% I can guarantee that that will all be done and delivered by that deadline. But we do have more time now, we do have more money now, and that is a huge improvement on where we were, and gives us a lot more confidence that we will be able to make substantial headway.
How much funding's been allocated for that contractor? Is that a figure you can provide?
No.
Okay.
It's a procurement process at the
Okay.
moment.
When will you, Minister, once it's been finalised, the procurement process, would you potentially be able to provide that figure in the
If it's
future?
information that we're able to provide, it's not subject to commercial in confidence or some other provision that would make that difficult for us to release, I'm happy to provide it.
Okay. Wilcannia Weir, I want to go back to, well, not back to, but I've asked you about that
Yes,
in
you
previous
have, yeah.
estimates as well. Again, it's currently on hold, I'm told, pending an independent review. Can you provide any more information about that review process? Will it be a panel, consultants? Is there a tender project? What's the latest?
Yeah, so
on that?
the intention is to have a panel. We're finalising the membership of that panel right now. I would hope to have that done within coming weeks. We have been wanting to consult with community as to the membership of that panel because, again, I don't want to waste time doing a review of a project that the community don't then accept as a valid piece of work. But I feel confident that we have a short list of names that will be acceptable. It will be a combination of some people with technical expertise and some people with expertise in relation to government processes and the way that decisions are made, because part of the intention of the panel is to assess whether or not it is accurate that some of the barriers that were identified to me as reasons why the original design was not viable are, in fact, legitimate barriers. I accept the community has genuinely said, we think you have been poorly advised in relation to those barriers. I've heard that. When I went to Wilcannia and sat on the banks of the Darling River for many hours, hearing community rightfully frustrated, that is why we've paused the project and asked for this independent review, and I want them to accept the outcomes. I want to have a shared understanding.
Them being the community.
That's right.
Yeah.
I want to have a shared understanding with the community about the outcomes of the review. Couple of weeks we'll have the panel members, and then we'll need to give them a little bit of time to do their work, but I'm imagining perhaps a couple of months.
Okay, so that was going to be my final question on this one. The time frame of the review, you would hope to have it finished by the end of the year, early next year?
I think
What are you
early
looking
next
at?
year is more realistic.
Okay.
Again, I'll need to be guided by the panel members. I'm not going to put arbitrary deadlines on them that then set them up to fail. But no, I do want their assessment of whether or not the barriers that were identified to the original proposal are genuine barriers or not.
Okay, I've just got a couple on safe and secure water before I hand to my colleague. Again, we've asked you about this in estimates before, but can you confirm that there aren't any plans to put any additional funding into this program before 2028?
Well, no, I can confirm that there was no additional funding put into this into the program in this budget. You will be well aware of that. Look at the budget papers. That no additional funding was provided this budget. That is because we are still trying to get the funding that is there spent, and not unreasonably, whilst there's still a reasonable amount of money in the fund, we're keen to spend that. But I'm not making any commitments in relation to further budgets. If we are able to get those projects moving and on track and the fund actually spent down, then of course we will look at what more needs to happen to support.
So taking your point that the program's not, I guess, fully exhausted, are you looking at reallocating any of the funds within the program?
There has been some reallocation in order to try and get projects moving. So yes, that is something that we're looking at.
Okay, and then just one last one from me. At the Local Government New South Wales Water Conference last month, I think you said that you are advocating for national disaster funding to be extended to include local water utilities. Is there any update you can provide the committee on that work?
No, there isn't. And that's not just advocacy, I should say, that I was making nationally. I've also raised that issue with my state colleagues. There isn't any update on that at the moment. But I continue to be of the view that there is a real challenge for local water utilities who have infrastructure damaged in natural disasters, who are unable to access disaster recovery funding because of the way that those schemes are set up, and it isn't fair on them. I, as I said, accept that point, and I've raised that not just with the Commonwealth but with my state colleagues as well.
Okay, thanks, Minister.
Thank you. Minister, with respect to the Housing Australia Future Fund, how much money has been dispersed to organisations in New South Wales or the New South Wales Government as of yet?
$0.
$0. Thank you. And Minister, I understand the New South Wales Government submitted an application for a number of projects to receive HAF funding last year. How many projects were included in that lodgement?
Oh, how many did we put in, Rebecca? Three. And does that include ones that we did in partnership, or were they just our ones?
We've led that.
We've led
application
three.
process.
Yep.
Thank you. And what's the New South Wales Government's expectation with respect to those projects and their funding out of that program?
I mean, I think that they're all excellent projects. We were very thoughtful about the submissions that we made. My expectation would be that they're funded.
And have you got any visibility from the Commonwealth Government as to when a decision will be made or when funding will be progressed?
We were advised that there would be some decisions in relation to macro allocations. I think that's sort of state-by-state allocations in September. I think that probably is late September at this point. And no, we don't have a date.
Okay. Minister, last week was reported by the Australian Financial Review in an article that social, and I'll quote, social housing offers 8 to 12% infrastructure-like returns. Did you see that article with respect to the Housing Australia Future Fund?
I actually didn't see that article.
Okay. Is that something you'd support in terms of having private sector investment into the social housing space?
Look, I would. My conversations with private development partners, and I absolutely talk to everyone who's involved in the provision of housing, is that they haven't seen social housing as an investment vehicle that would work for them because the requirements for government subsidy are too great. However, I'd be happy to have a look at that article, and any private market player who is perhaps listening to budget estimates and would be willing to partner with us and thinks that they can make social housing work, we're open to that. But as I said, Mr. Farlow, my feedback is that affordable housing is something that private market players are interested in investing in and can see as a viable vehicle, but that social housing is not. And I mean, we accept ultimate responsibility for the provision of social housing, and this is why we have put billions of dollars in the budget to provide it.
Thank you, Minister. Minister, with respect to the Riverwood Housing Office, many residents have relied on the Riverwood Housing Office for support, housing and maintenance issues. Could you therefore explain why the decision was made to close the Riverwood Housing Office?
Yeah, we moved the Riverwood office along with another one to Ashfield, didn't we? Yeah. Well, I mean, simply because we wanted to ensure that we had better integrated services. I recognise that I've heard a little bit of feedback as well from some residents in Riverwood that they, were concerned to see the office relocate. The creation of Homes New South Wales was a really big opportunity for us to bring our services together and to create spaces where allocation staff, where tenancy management staff, where maintenance staff were able to sit together and work together. And so some of that has involved bringing staff from different offices together. We wanted to really make sure that we were meeting the needs of Riverwood tenants, and so we've been doing a lot of outreach, going to them with pop-ups, with mobile visits, really trying to make clear to them that they don't have to come to the office in Ashfield to have their needs met. We're able to come to them in their communities, on their doorsteps, and whether it's a question about maintenance, whether it's a question about a transfer or another tenancy issue, or reporting antisocial behaviour, there's no need to come into the office for that. In fact, that's something that we can come to them and manage through local engagement.
So how often are Homes New South Wales having these engagement forums in Riverwood or actually having pop-ups or the like?
I might take that on notice in terms of how regularly that's happening, but I do know that through ourselves and our community housing provider partner in Riverwood, which is St George Community Housing, that they are there regularly, we are there regularly, and we are funding local community groups and neighbourhood organisations who hold weekly events and weekly barbecues. And certainly to the times that I have been there have been staff around who are able to talk to people about concerns that they might have on the spot. And with our new maintenance contracts, we're able to be a lot more responsive, particularly to maintenance concerns as they're raised.
And Minister, as you'd be aware, Riverwood and Ashfield aren't necessarily close and are particularly quite challenging to get to via public transport. Are there any other options that you would outline for Riverwood residents in being able to access Homes New South Wales services in person?
Well, as I said, we are regularly in the community and welcome the opportunity to engage with residents in any of those outreach services or pop-ups that we're providing. I also encourage Riverwood residents to use the community centre there, which is a fantastic local community organisation that is also regularly in contact with me and Homes New South Wales. It's a very trusted place where residents can go and raise issues. So there are, and that is literally on site there at the Riverwood estate. So there are plenty of ways that I feel residents can contact us with concerns, including in person.
Thank you, Minister. Minister, another budget question, surprisingly. When it comes to the modular housing trial, last year's budget outlined a $10 million allocation. This year it's been revised to $8 million. Why is that?
I think
it's just about the 7.8 million. It's about the delivery of those that have been announced.
Yes, I mean, I think we haven't cut the budget. I think we've spent some of the budget, and this is the updated budget figure.
Well, it's the total, and I'll draw it to it, it's the total budget allocation which has been outlined. So the estimated total cost in this year's budget is listed as $8 million, while the estimated total cost in last year's budget was $10 million. The allocation for last year was $1.5 million, of which the estimated expenditure in the budget was only $207,000. It doesn't appear from the budget papers that in some way it's just a reprofiling of what's been spent.
Look, I can take that on notice. There's a bunch of figures there in relation to this year's budget and last year's budget, but far from removing funding from the modular housing trial, we're looking to increase its funding. There is a substantial portion of the $5.1 billion that we're spending on new housing supply that looks to take advantage of modern methods of construction. So, you know, we're very hopeful that this is going to be a very significant opportunity for us to do more in that space.
Thank you, Minister. And Minister, given that being the case and the interest of the government, why was it that only $207,000 was spent last financial year rather than the $1.5 million that was allocated?
It's just the way that we were rolling out the work of the task force. You know, as I said, we're hoping to scale this. We're hoping to make this a big piece of work. There was necessary planning work that needed to happen. We're coming off a very low base. So, as I said, it's nothing more than just doing the work that we needed to do in those early stages to get our settings right, to ensure that we don't want to waste taxpayer money if modular housing is not going to deliver the quality that we want, is not going to deliver the speed that we want. We wanted to make sure that that was the case. That is exactly what the task force has been doing. And if there's been some budgetary reprofiling that's happened as a result of that, I'm very relaxed because I know that we have a lot of money to spend delivering housing and that modular housing will be a part of that pipeline.
Thank you, Minister. Minister, are you aware of the water issues with Oxford Gardens development in Ingleburn? And do you have any update for the residents there?
Look, I am aware of them. My understanding is that Sydney Water is working with residents and the developer to provide a temporary solution. I mean, this is just yet another example of the failure of the link between planning and water that we have already talked about. Obviously, my heart goes out to those residents. They just want to build and live in their dream home, and they can't because they can't get Section 73 certificates. I don't know if Mr. Shiro has an update other than Sydney Water is working. He's just nodding that Sydney Water is working with the residents and the developers on a temporary solution.
Thank you. Minister, shifting entirely back across to mental health. We had a discussion earlier this morning about the gap analysis that's underway, and you assured me in the committee that that exercise is being done in partnership with the Mental Health Alliance, and that it's not an internal exercise. Concerns were raised with me by members of the Alliance that they didn't understand the exact methodology being followed. Could you please clarify exactly which members of the Mental Health Alliance have been involved and what that work has been?
Oh, well, I mean, that's, I was not aware of those concerns, and I meet regularly with the Mental Health Alliance, including meeting with them both before and after the recent Mental Health Ministerial Council meeting. At the second of those meetings that I held with the Alliance, Dr. Flynn was online to talk about the gaps analysis. All members of the Alliance, I can't, I'm going to say all, perhaps there was some missing, but Way Ahead was there, Being was there, Carers was there, Black Dog was there. I recall that they were all there, were involved in that conversation. Now, if they were not satisfied with that conversation with Dr. Flynn and other engagements that they've had with the mental health branch, I'm not aware of those concerns, but I welcome the opportunity for them to let me know that engagement, which was
19th of August.
The 19th of August was quite recently. If that didn't provide them the information that they were looking for, we're more than happy to follow up any concerns that they have.
Okay, thank you. Thank you for clarifying what that engagement has been. And in my last couple of minutes, I'd love to ask about peer workers. Your enthusiastic support for peer workers is already on the record, and I understand that the statewide peer workforce framework is close to being finalised from your response to the mental health inquiry. My question is there anything in the budget to actually implement that framework? Is there money for peer workers to be employed?
No, we haven't specifically allocated additional money for that in this budget. That is partly because, as you have noted, we don't have the framework yet. We are looking for that work to be done. We want to make sure that peer workers are supported. We've employed a senior peer worker sort of lead within the mental health branch to coordinate that work. I have engaged with the Health Services Union, which is a representative body for peer workers, to make sure that they understand the process. They seem satisfied with where that engagement is up to, but obviously, if as a result of that there is additional funding that is required, we'll need to look at what that is and ensure that those needs are met.
Thanks. And I understand that there's already a KPI around recruitment and retention of peer workers in the service agreements. What are the current numbers for peer workers? I
probably don't have that. We'll have to take it on notice. I mean, it'd be very LHD to LHD. One of the things that we've heard is that some LHDs share my enthusiasm for peer workers and are sort of very forward in making sure that the positions are filled and that peer workers are valued and have career progression. Perhaps that's not the case with all of them. There can be a bit of a mixed bag. Do you have that off the top of your head, Brendan, or you know that there?
I do have this information, Minister. So, Dr. Cohn, the statewide target is 255.4 FTE, and as of 30th of June, there were 241.4 FTE employed, noting that there's also 18 FTE in the Aboriginal mental health and social and emotional wellbeing peer workforce.
Thank you. I appreciate that you had that to hand.
You
must have known I was going to ask about it.
Excellent.
I think there's a couple of minutes left for the opposition, if you have any more questions.
Oh.
We're in the strange overflow time.
We thought it was all you. So we were, right. Do you want to touch? Or?
Yes, I might just ask, work that's been done by, in relation to the Macarthur region, they've estimated around 300 young people between the ages of 14 and 18 across the area are experiencing homelessness, which is higher than the state average, and yet there's no youth refuge in Campbelltown. Do you think it's appropriate that a young person is being sent to a motel unsupervised, often outside the area, because there's no youth refuge?
I mean, no, that's clearly not acceptable. And I am aware of some excellent advocacy that has come out of the Macarthur region. My colleague, Minister Harrison, was in Campbelltown recently and meeting with a range of organisations who presented her with a report on behalf of the community, which she, of course, passed on to me and I have looked at. we, through the work that we're doing through the Homelessness Innovation Fund and our other opportunities for funding, want to identify exactly these gaps. As I mentioned to you when you asked about what the criteria for the fund may be, and the second one that I said was filling gaps. So we would welcome the opportunity to partner with local service providers and NGOs to explore how we can meet those needs.
And do you have the data on the number of crisis accommodations that are not available by suburb?
I don't have that off the top of my head. We could take on notice the provision of what data we did have.
And if also by breakdown by region as well?
Yeah, it would likely be data that we would have broken down by region, as that's how we normally track our data. But whatever data we have, we will take on notice to provide.
And just a final question in relation to specifically youth homelessness. How much in this budget has been allocated to programs and services to support young people experiencing homelessness?
I can take on notice whether we have an overall figure, but we have ensured that under our $5.1 billion capital program and our $100 million Homelessness Innovation Fund program, that the needs of young people are reflected in the allocation of that funding. So if there is a specific figure that we're able to bring together,
Mr. Tidball might be.
Oh, here we go. Mr. Tidball's providing me different pieces of money. But that doesn't bring together the capital program. So I'm going to take on notice because I want to make sure that, so we've got obviously the former Premier's Youth Initiative, HIAP, Rent Choice Youth, so I have figures for those programs, but that doesn't include some of the other programs that we have newly in the budget. So I can take that on notice.
Oh, thank you.
Thank you, Minister, for your time and attending the hearing. We're finished with your questioning, and we'll see the rest of the department witnesses back after lunch at 2.
Great, thank you.
Welcome back, everyone. It being 2 o'clock, we'll resume questioning and starting with the crossbench and questions from me, which are going to be about mental health. I was just hoping to follow up some of the lines of questioning with the Minister this morning, and there were a number of issues that she suggested I follow up with you this afternoon. The first one of those was the retention of psychiatric trainees when they finish their training in New South Wales Health. What work's being done on retention at the moment?
Yeah, you go.
Thank you, Chair. I'll just move the microphone. I would need to take on notice the figures around retention, which I think is an important part of the discussion, but I can give multiple examples of what work is happening in New South Wales to retain trainees, otherwise known as registrars, throughout what is usually a 5 to 6 year training program. New South Wales specifically aims to offer a range of metropolitan and rural experiences that are not necessarily available in other states, where people can be, if you like, employed and located in one particular either regional or metropolitan area. There's 3 high-quality postgraduate courses, including the HETI one, which has recently reduced its fees, I think from in the high $5,000 to $1,000 per year. There is a strong desire on the part of services, even when the senior workforce is challenged, and I know that's an issue that's been well canvassed and may even be canvassed more so this afternoon, to ensure supervision for trainees, so that, in other words, every time the sustainability of a service is looked at, it needs to be, as priority number 1, does this work for the consumers? But part of what's working for the consumers in the community is retaining trainees, and so we need to make sure that the terms are compliant with the college's specifications for that. So I know that many directors of medical services across our mental health teams are particularly aware of the supervision requirements for registrars.
Absolutely. The Minister, in her answer this morning, she mentioned the high cost of locums at the moment.
Yes.
As one of the reasons in favour of award reform.
Yes.
Do you have the figures of the expenditure on locums at the moment?
I don't have that information. I would need to take that on notice.
Sure.
But it will be... can I check, Chair, whether you're referring to the locum cost for covering trainee vacancies or senior positions?
I'm interested in locum expenditure for psychiatric doctors, so registrars and for staff specialists.
Yep. No, that's fine. So we can take that on notice.
Thank you.
But I think that's it's a related issue, I guess, to the things that we're doing in order to sustain retention. And the other thing I should just briefly add is protected teaching time is also really important.
Absolutely. The Minister mentioned some of the non-award provisions
Yes.
that have been negotiated.
Yes.
Could you provide more detail about those?
Yes. There's a working group which I have been involved with, and Dr. Wright and Dr. Michael Bowden have also been involved with, which is run and chaired by Workforce, but is really looking at trying to extend, particularly to staff specialists, everything we can do to make staying in that role attractive or joining one of those roles attractive. So again, specifically, that involves making sure that if we've got a permanent staff member as opposed to a locum, that the permanent staff member can essentially express what their preference is around either working in a community team or an inpatient unit or both, to make sure that that mix is something that suits them professionally and is sustainable. We're also looking at trying to minimise any barriers to access to protected time, which is part of the Staff Specialist Award, or for training, education and study leave. That's also part of the Staff Specialist Award. We're interested in looking at innovative models for out-of-hours care, and a significant issue for many staff specialists in New South Wales is the after-hours roster coverage, which is run differently across districts, and to be fair to the people we heard from in the group, people have different views about, but we are particularly interested in looking at what models would make that more sustainable. And a common story that I'm aware of is older staff specialist psychiatrists saying that the after hours is onerous, and that can be a factor in their decision making. Yeah.
Thank you. I also wanted to follow up the discussion. I think this is going to be a question for Dr. Wright, but about inpatient experience of sexual violence. In particular, you talked about some of the work being done by mid-next year involving data collection. I'm interested in how that data is being collected at the moment and what those gaps are or what needs to be done differently.
Yeah, thank you. The data has been collected for a long time through the IMS system, which is the health service-wide incident management reporting system, and so the data has always been there. It's but the until we have extracted the data and looked particularly at the reports of sexual safety incidents, we haven't had the opportunity, I guess, to look at some of the challenges in the reliability of the data that's reported. You probably understand that the IMS system is a clinician generated system. So if I'm working in a service and I am involved and I see an incident, then I make that report. Until we, I guess, have consistent awareness of what constitutes a critical incident or an incident which is worthy of reporting, people will have a different threshold for making that report, and people can report the same incident in different ways. And when the data was extracted the first time around, it was quite clear that there are differences in how people perceive what's the threshold for an incident and how they characterise them. And so, and we've experienced this before with other reporting systems. So most notably when we first started reporting on seclusion and restraint, it took several years of cycles of reporting until we were clear that most services and most clinicians had the same understanding of what constituted an incident of restraint or an incident of seclusion. And so it's not until you have that kind of consistency that you can then report the data and then do what you really want to do, which is compare what's happening in a service over time or compare between different services. That benchmarking process is critical for us to understand where we need to put our improvement efforts. So what we found with the reporting of sexual safety incidents is there's a wide variation across the system in how reliably these are reported. So what we're doing in the revision of the policy and the guidelines is making sure that there's elements within that and within the training where there's some clarification of what the different sorts of incidents are that we want to have reported and how to define those. And so it'll be building, I think, a greater level of confidence in the reliability of that reporting.
I'm interested in all of that work being done around the data capture for safety, if there's an extension of that to include safety for staff as well. And I'm asking because in the hospital in my hometown, they reported an 80% increase in aggression towards staff. Yeah. Last year, I recall in my own time as an emergency department doctor, at one point they installed an occupational violence button whose sole purpose was to count instances of occupational violence, and nothing would happen when you push the button other than it counting. Yeah. Are you looking at improving safety for staff?
Well, I think the IMS system it captures all sorts of incidents, and again, that's one of its strengths, is that there are no kind of barriers to reporting incidents. So if you feel that you've been involved in or witnessed an incident, you make the report, and so it's and then it's there in the system. With the sexual safety incidents, we're looking at the whole of the health system, and we identify whether the victim is a patient or a staff member, because that could be either, and so could the perpetrator. Okay. And so there's no differentiation in terms of we need to capture all of those sorts of incidents. And as for violence of any kind, I would take the same view that they're all members of the community, and violence can happen in all sorts of ways in our health systems, and we want to be able to capture all of those instances.
Thank you. While I've got you, Dr. Wright, I also wanted to follow up the questions I asked this morning about psychedelic-assisted therapy, and your comment was about the need to balance access against safety, which I absolutely appreciate, and when something's a new or an emerging therapy, of course it needs to be done as safely as possible. But I suppose in the context of benzodiazepine or first-generation antipsychotics being available not just from outpatients but from first-year intern graduates, I suppose when you compare with other jurisdictions, are there any identified issues with safety in an outpatient setting for those psychedelics that you're particularly concerned about?
Well, I think it's an important question, but I think the issue that we need to remind ourselves of is that no other jurisdiction in the world is as far down the track of enabling these treatments as is the case in Australia. And in fact, in America, as you're probably aware, the Food and Drug Administration has recently rejected an application for MDMA to be approved on the basis, and it's a very important basis, that they critiqued the quality of the research on which the application was made, and they've made some really important, I guess, criticisms of the nature of the research. The concern that we have, and this is I'm voicing a concern which is shared by our professional college, is that we've got phase 1 studies, we've got some phase 2 studies, but we've got no phase 3 studies. Now, it's highly unusual for any medication to be released onto the market without phase 3 studies. The total number of active treatments of either psilocybin or MDMA worldwide in peer-reviewed journals is less than 500 at this point. And so the numbers treated is actually quite low. And so we strongly believe that this is a very promising emerging treatment, but the numbers, the confidence of what the safety profile is or the risks are grows as the numbers treated increases. And again, you'd be familiar with a number of drugs which have been extremely well received when they first come onto the market, and it's only after a period of time that we appreciate what some of the risks are with those drugs, which has modified their use and in some cases led to them being withdrawn from the market. That's something we don't want to see happen with these treatments, and that's why we initially have had quite strong restrictions on the places in which the treatment is given, so that if there is some kind of sort of urgent medical event while the treatment's being given, there is a capacity to respond. I appreciate that the rules as they've been played out in New South Wales are different compared to other states. I don't believe they're different to the rules in South Australia or Tasmania, but they are certainly different to what's happened in Victoria. But at every step we've checked with, there's a working group from the College of Psychiatrists that has put out a memorandum on how they believe psychedelics should be approached within the profession, and I have checked with them on the approach that we're taking, and they're supportive of our approach. We are interested in seeing whether we can assure the same kind of, I guess, protections for consumers in terms of unknown side effects without necessarily having to insist on the treatments being given in a private hospital, because it doesn't have to be a private hospital, but it's more about the capacity to respond in the event of some kind of urgent medical event during the course of treatment.
Thank you. And my last follow-up, I think for you, or it might be Dr. Flynn, from this morning was about trauma-sensitive care. I'd asked the Minister about the recommendation about a centre of excellence and particularly what happens for services when their capability through that scoring tools assessed as poor. Could you provide some of that detail of what current practice is?
Thanks, Dr. Cohn. I'll try and go first. I would make 2 points. So I think that this morning's discussion covered the fact that there is the self-assessment tool, But the key, in a sense, the key intervention that we can offer if someone or if service came to not score well on that would be to make sure there was access, and there is significant access through the ACI, to tools and materials that assist clinicians in updating their skills and knowledge and practice around trauma-informed care. And in particular, there's the trauma-informed care framework for change, which and the intention of this framework is actually to go beyond mental health services and make our entire system aware of what issues and history and vulnerabilities that anybody who meets any of our service providers brings to that interaction, and to think about that and to respond sensitively, and always to be conscious that we actually have sometimes the capacity, if we get that wrong, to do harm. So I think that's probably the first place I would direct the answer to. The other thing I would say is, even predating the ACI work, it's actually an expectation for health graduates who work in mental health services, including nursing staff, medical staff, allied health staff, etc., to be very much aware of the importance of a person's narrative and a person's story. And I accept that historically our services have not always got that right, and that's why that framework is so important to provide a tool to improve practice across the board.
Thanks. And when that training is provided to a service, you talked about assisting clinicians in updating their skills. Is that then provided to staff on their paid time?
The assumption would be that all of this work is done within paid time. There's also some scholarships available. So HETI and the ACI fund scholarships for trauma-informed care. The latest data I've got around that is that there's 174 HETI or ACI funded scholarships that have been offered in the most recent round. In a sense, our hope is that provides a workforce who are particularly aware and current around this information, and who can build capability amongst their colleagues and model safe and sensitive care.
Thank you. And those 174 scholarships, which I should say that that's a really important piece of work, can you give me the breakdown of what types of practitioners or what professional groups those are?
I would have to take that on notice, Chair. I don't have that information.
That's right. But are they made available across different practice groups, or is it, for example, only for medical practitioners or only for nurses?
No, my understanding is that they're across different practice groups.
Okay.
Yeah, the whole workforce. Yeah.
Great. You've sort of half answered my last question, which was going to be about that sort of specialised workforce. So last year, the Minister and I had an exchange about the trauma inpatient facility in Thirroul, run by Dr. Karen Williams, which is excellent. And I understand that a significant barrier to expanding that service is the limited availability of workforce with the specialised skills that are needed. I was going to ask, what are you doing? Obviously, those 174 scholarships are one of those things, but what else is being done to develop that specialised workforce in New South Wales?
My view is that having this discussion in our services, having our clinical leaders draw people's attention to the importance of this, to the materials and resources that are available, including the scholarships and the framework, and also hearing from consumers publicly when this care does not go well, is critical, because in my view, our entire system, even beyond mental health services, needs to be trauma informed, and I guess conceptually I would like to see something that addressed this across the board, rather than saying that a specific unit or service would be the place we would send people. Unfortunately, in mental health, as you would know, so many people with so many conditions, and classically we used to think of this as personality vulnerabilities, but increasingly the concordance with early childhood trauma is across the board, even including for chronic psychosis. It is relevant for virtually every individual that we see. So I guess our priority is to make sure that message is significantly understood across the system.
Okay. And have you got any oversight of that? So that service capability, you've explained in detail what happens now, but what is the performance across New South Wales health facilities?
Look, a useful performance indicator would be the feedback we get from our consumers around how they've experienced either the inpatient unit or how they've experienced the community service that they might have engaged with. I don't have those figures in front of me, but in general they're very good. So we tend to see that, and I should take the opportunity to clarify this later if I need to, but from memory, around 80% of our consumers rate some of their community experience in particular as very good or excellent. Those questions are actually designed to allow people to tell us the whole unvarnished truth, and I think it's very important that people do so if they feel that their story hasn't been heard or responded to.
Sure. We're out of time. I'll go to the opposition.
Thank you very much. I actually might ask the advocate to come forward. I have just a couple of questions.
I don't think it's appropriate to woohoo, but it's nice to be here.
Thank you. I just wanted to follow on from a topic that was covered off at the last estimates, particularly around the work that's been done in the Northern Rivers and engagement with young people that are living in pod villages, for a better term. But and I understand you've had forums up there, and I just wanted to understand a little bit more about some of the findings from your engagement, particularly since our last estimates.
Yes, so at the end of last year we held a roundtable with a number of young people but also service providers who attended that. And that was the opportunity for young people to talk about their experiences in those pod villages. The team up there have been working with, at one stage there were over 300 people under the age of 24 who were living in pod villages, and that's everything from working with them to connect them into services if they require different services, or if they have, for example, needing to assistance with school and attendance at school, working with the schools around making sure that these young people can attend schools. Also going into the pod villages and holding Children's Week events and making sure that the young people in those villages are connected and being seen by the people that need to. That funding for that team actually ends in June next year. And so we're currently in the process of making sure that we're working with our colleagues at Homes and other services in that area to leave whatever it is that we can that young people have provided insight to. And that includes things like providing feedback on disaster action management plans. That includes feedback in terms of their experiences of living in pod villages. But also one of the big things that we're working with is, as those families and young people transition out of pod villages, making sure that they feel like they can still be connected to their schools and the community and their supports. And so that team is in the process of kind of winding down that support service because the funding's not there beyond June, and making sure that they can pull together the recommendations that they've had from young people, including things like what they would like to see in terms of volunteering and young people being able to assist in disasters in community, but also if young people have to live in those kind of villages again, what they would like to see, including making sure that there's kind of privacy, ability to have I suppose recreational facilities in them as well. And so there will be a final report that team prepares that will be shared widely.
And what's the time frame for that report?
So they will start winding down the kind of it's not case management service, but the support service that they've been doing this side of Christmas. And then there will be the opportunity for that to be reviewed. And then I imagine June next year, as the funding ends, that will be. Although I should say, obviously, we are actively saying that we should continue to support young people in that area and that it's a service that should continue, because everyone knows that disasters don't just end after 2 years, and the impact on young people can be long-lasting. But at this stage, it would be June next year for that report.
And you might need to take it on notice, but how much is that funding?
I do have it in here. This is where you get to shuffle papers. I mean, I'm happy to take another question whilst I'm going through a folder.
Do you know how many young people under 24 are currently in the pods?
I'll take that on notice, but somebody... No. I'm sure I can get that to you.
And maybe someone else, so with the funds or this service sort of being wound up in June next year, what is being put in place to continue that support of young people?
So at the moment, the Reconstruction Authority is responsible for managing the decommissioning of some pods. Those that would stay will transfer management to Homes New South Wales, and we'll be working with the community housing providers that are already managing those locations in terms of the ongoing transition and support, the Housing Plus type services that will continue. But we would be looking to normalise those arrangements under current contracting that Homes New South Wales has in place with community housing providers. So those were temporary arrangements. For the ones that will stay in place, we would then go back out to contract and tender for those providers in the area.
And the funds that are currently allocated for those services, will that be rolled over into new contracts, or will you need to find funds in existing budgets?
No, we're working on a transition plan with the Reconstruction Authority that looks at the overall operating costs of those villages in totality, and so that's a process that will go through government, not to just transition over into Homes New South Wales management. But we're going through that process at the moment to really plan out the villages that will stay, and then the resources needed to manage them on an ongoing basis.
Okay, thank you.
So I have that data for you. So it's jointly funded, obviously, under the disaster recovery arrangements through the Commonwealth and New South Wales Government for approximately $2.2 million over the 2022-2023 and 2023-24 financial years. It's worth noting that since March 2023, the team up there have consulted with over 635 children and young people. And I do have figures in terms of pod villages as of the 20th of June, if that's helpful. So in terms of the Korakai and Wardell villages, the total in that, as we understand it, is 116. And in the other villages, which is Lismore, Ballina, Wollongbar, Evans Head, Brunswick's Heads, Kingscliff and Mullumbimby, there's 166.
Okay, so it's gone down a little bit.
Yes.
Yeah. I might move over to just ask you some general questions about the types of requests for information or research that you get from, I suppose, all the departments, and whether or not, I suppose, what is the type of request that you've been getting over the last sort of 12 months?
So I'm sure we can provide a very detailed list on that, but in terms of some examples, obviously the vaping piece of work has been a big one. Mental health for young people, cost of living, understanding the kind of education settings and working with the department around things like belonging. And the team are also doing a lot of work right now in terms of focusing on refugee and migrants. So working with both the department and other services to inform them in terms of some of the needs of some of those young people. I'm certain I'm missing. So obviously we do work with New South Wales Police in terms of young people. So the asks in terms of detail are things like access to the data, but we always make our data very transparent, so that's available on our website. But then also if there's specific insights, we're supporting the Premier's department in terms of the social media summit and making sure that young people are part of that conversation. Also obviously supporting the Minister for Youth around the Youth Summit. And so that is one, making sure that children and young people can be part of the conversations, but two, if there's any particular insights that we might have from data or some qualitative work that we've done.
Oh, sorry. On Social Media Summit, I was going to ask about that, so I'm going to jump in now. Sorry.
Sure.
In terms of the voice of young people, can you advise as best as you can, like how many young people we would expect to be there? How will they be chosen to participate? If there's any advice in relation to that.
Yes. So there was a public expression of interest that was put out for people to apply to come to that. Obviously, it is mostly being run by the excellent team in the Premier's Department who are leading this. We have assisted by ensuring that young people can provide advisory support in terms of actually guiding the design and who's at the summit and why they're there. So there will be young people who sit across that. And the intention is I hope that those young people will be able to inform any policy decisions after that summit as well. We have obviously assisted by reaching out to Youth Advisory Council alumni, Regional Youth Task Force alumni, and working within our networks to ensure that young people are in there. And as I understand it, the hope is that there will be a specific session facilitated by ACYP for young people to come up with their ideas and solutions and present that back. But then there is also a conversation going on about making sure young people are represented on those panels. So it's not just dividing adults and children into different rooms, but having them come together and talk about solutions and hear directly from each other some of those things, and making sure that there is also that balance of what we know about social media, but also that there are some positives that come from social media. But also the last thing is also doing that very important polling around actually what young people themselves are saying in terms of the raising the age. And so that's been work that has happened in the form of a very formal survey. But then in terms of consultations that our office and the Office for Regional Youth and DCJ are running in terms of asking young people in every consultation right now, what do you think in terms of raising the age?
Thank you. Sorry, I didn't mean to hijack your time.
No, it feeds in. But, so in relation to the requests you get from other departments, have you seen an increase in the last 12 months?
We have seen an interesting kind of consistent conversation. I think it has been different because this has been a year that has been very much focused on our special inquiry, and so that has been a huge focus of the office. And so unfortunately, due to the kind of restraints of a funding envelope, there are only so many things that we can do. I would say that there have been a lot of conversations where there's kind of been things that have happened and we are part of that conversation. Perhaps so, our kind of example is the social media summit, is that was a conversation that started happening in the media and in other places, and so we've kind of very actively said, well, we want young people to be a part of it. So there's some that are very proactive from our office, and then there's some that are a bit reactive.
And I suppose it brings to the next point, which is how do you balance what you have to do with your strategic plan, plus the requests. I know from a parliamentary point of view, some of the committees have asked you for input on inquiries, or at least developing some of the terms of reference, and then obviously the additional things like the summits. How are you making those decisions within your budget?
So it is always centred on what matters to children and young people, and the fact that we consistently do our polling each year to see what those issues are helps us make the decisions on that. In terms of things like inquiries and submissions to inquiries, if it is work that we haven't done, it is fair to say that we wouldn't put a submission in that until such time as we've heard from what children and young people themselves have said. I think it's always a priority of our office to make sure that where there are inquiries, where there are particular pieces of work like the Social Media Summit and the Youth Summit, that is something we prioritise. It would be ridiculous for me not to say that the team isn't completely stretched, and that is actually, there is always a need to make sure that we are meeting children and young people where it matters to them, and that we're doing everything that we can to be in those places. But we have a small team, and so we do our best, and I think we are mighty even though we are lean.
And has your budget changed for this financial year?
For this current financial year?
Yeah.
I can't confirm our budget for this current financial year yet.
Okay.
It hasn't been confirmed with us, as I understand it.
Is that usual?
It's not unusual for us because we are part of a bigger machine,
budget.
And so that hasn't been confirmed.
Okay. And just in relation to the Youth Week survey, what were the results of that compare with, I suppose, the strategic plan as to what you saw as a priority over the last financial year?
So I think that highlight that we've talked about in a number of places is that children and young people this year seem to be faring well. So there has been an improvement in some of the key themes from that. So in terms of key data, which obviously we are very happy to provide a copy of this. So it's the sentiment in terms of life as a whole has remained stable. They, interestingly, and this is me giving you an executive summary, I don't know whether this surprises anyone necessarily, but young people still feel that the New South Wales government is out of touch with their generation. I don't think that's
even with Skibbity Riz? Sorry.
It's not reflective of any of our ages around this table right now at all.
Sorry.
We did ask questions in terms
I saw that.
where they go in terms of advice and comfort and things like that. And so friendships still remain to be the priority for them. They talked about in this particular Youth Week survey, we looked at life skills and the kinds of things they're thinking about in terms of jobs, because we thought that was useful in terms of some of the work that government's doing. And their careers as well. And we also did some specific work this time in terms of those people who migrated to Australia. But in terms of the kind of overarching issues that children and young people are saying they still face, mental health still features in that. Cyberbullying and bullying is still a focus of theirs. Cost of living is still something that gets raised. Obviously, that's with some particular cohorts, but we have heard of that younger generation feeling the impact of that as well. And then also their kind of general advice to government, which is always wonderful for us to hear, but it's not necessarily something that we feed them, is they talk about obviously having their voices heard and being part of conversations that matter to them.
On budget, if I
Yep.
may, without interjecting, just...
Team, take a note.
The budget for 24-25 for the ACYP is 4.2. It was 4.2 in 23-24 with actual expenditure of 3.8 million.
Okay, thank you. Final question before I hand over to my colleague, just around the Central Youth Agency, which was asked about more last estimates. Have you had any dealings with the Minister or the Office in relation to the establishment of that and how it will operate?
So we continue to support the youth survey that the Minister touched on this morning and making sure, so our office is in charge of kind of reviewing all of the responses to that and providing a monthly report to the Minister about what young people are saying. That is the extent of the conversations that we've had today. My team do have regular fortnightly meetings, but that is focused, as I understand it, on the Youth Summit and the survey responses.
And the monthly survey responses that you're getting, have they, I suppose, what are the key themes? Have they changed over the month? And then also from metro to regional, is there much of a difference?
So interestingly, in the last cut of data that we did, and I will double check the themes, there was a shift in the themes. So cyberbullying and bullying has still featured, but there has been a shift in it, and I'm sure I could get it to you before the end of today, but they have changed a bit. We have worked very hard to ensure that there is representation of regional areas, but the difference in terms of that detailed breakdown I don't have. I can take it on notice.
Okay, thank you.
No, I think that's it. I don't think we have any more questions for the Advocate Chair, just so I don't know about other...
Thank you. I had one. I'll ask it before.
That's okay.
I turn to.
Thank
Trying
you.
to save you time where we can, all of you.
Yeah.
We can't always.
Prioritise. So, Ms Pinkston, I'm just going to turn to you in terms of the land audit. Does Homes New South Wales have a projection of how many parcels of land will be transferred to Homes New South Wales over the forward estimates at all?
What we're doing through the land audit is tranches are coming through. As those tranches come through, Homes New South Wales reviews those. We have to do due diligence on all of the sites. At the moment, 3 have been announced, but we're hopeful that further sites will be announced that we can basically use to help us unlock other Homes New South Wales land for redevelopment.
So 4 have been announced so far, but it's also been identified that there are 44, I think, as part of this tranche that the government's identified. Are there other ones, I take it, that Homes New South Wales are expecting to be transferred to them as well?
We're looking at other sites on that list of the 44.
Okay. Right. And as I understand it from the lands and property budget estimates, that Homes New South Wales has got first dibs on sites. Is that a fair characterisation?
That's right, ourselves and then Landcom.
Okay. And just going through back to that 301 Samantha Riley Drive, Kellyville site,
Yep.
and Mr. Shrew, you might be able to outline this as well. So, in terms of that land, how large is that site that you're talking about?
I can take that on notice in terms of the total parcel. Our estimation is that block of land is also subject to flooding. So we've made an estimation based on that land that would be used for new homes that wouldn't be subject to flooding. And at the moment, we're looking between 75 and 80 new homes on that site.
Okay. So in terms of that land parcel, Mr. Shrew, what was that being used for previously by Sydney Water?
So it's a land that's part of the different pieces of land that we've got across Sydney, and we've got a number of lands that we keep for future augmentation of the system. So that's typically one of them.
And was that seen as trunk drainage land, all that previously, or?
Look, from memory, it was seen as a stormwater management land.
Okay. And in terms, Ms Pinkston, of the site and the amount of the site, so I take it is a portion of that entire site owned by Sydney Water. Now, I think you mentioned previously that that site could be used to unlock other sites in the area. So what's the plan with that?
So for our approach to land audit sites, obviously Homes New South Wales have significant land holdings and properties under management, and our the major issue that we face is places for people to move into, to relocate, to unlock that land. So we're looking at those sites as an opportunity to do that in the neighbouring area. Kellyville is one, as is the Camden site, and also Everleigh. They provide strategic sites for us to get started early. That would also help us unlock other areas in the area to redevelop on our own land.
And as part of that unlocking, I know we had a little bit of debate in the lands estimate as well about that site, and there was a private parcel on that site as well. Is part of that unlocking giving access to that private site as well, or developing roadways or easements or the like for that?
Look, we're
parcel?
at the very early stages of due diligence, so as those have come up, the process is that we nominate those sites that we want to do extensive due diligence on, and that would be one of the issues we would consider, as would the flooding within the area and other land use concerns that might be there on the site.
Thanks, Ms Pinkston.
I have one question for the advocate, and then we can let you go at afternoon tea.
Thank you.
At the previous estimates, I asked about youth-specific tools to support young people with quitting vaping, which is as urgent as it's ever been with the federal government's recent changes. And you said that you and young people had been involved in conversations about the design of a youth-specific online tool. Has that progressed? What's happening in that space?
So it does continue, and we do it with our friends at New South Wales Health, and there is a young person from our Youth Advisory Council, and I believe others, who are actually working with them around what those tools look like. So it is ongoing and it does continue. And I do have the themes, Ms McLaren-Jones, in terms of the youth survey, which actually, to your question, includes the fact that vaping has increased as a particular concern for young people in the time. Cost of living apparently has gone down, but mental health remains the same. Availability of housing has gone down in terms of a concern, so perhaps well done, Homes New South Wales. Vaping and e-cigarettes, drug and alcohol use has gone up, and domestic and family violence concerns has gone up as well.
Thank you.
Thank you.
Can someone here answer the other part of that question about the online tool, or is that a question for the other members of the department tomorrow?
It's probably a question for the Centre for Population Health, I think.
I can also check through these notes and come back to you if there
Thank
are
you.
more notes in here.
That's all right. We'll have population health tomorrow with Minister Park. So coming back to mental health, I asked some questions at previous estimates about the LGBTQIA+ health strategy and various parts of work to address that priority population. In the answer to a question on notice, Dr. Flynn, you provided some information about an LGBTIQ+ inclusive support guide for child and adolescent mental health services, which is obviously an important initiative. I'm interested in the uptake and the implementation of that since that guide was written.
Chair, I do recall mentioning this at the previous estimates, and I can confirm that one of the partner organisations that we work with, which is 2010, received funds from us to do two related pieces of work. One of them is diversity training and capability improvement for our child and adolescent mental health services staff, and that's a $265,000 investment over 2 years. And the second investment that's related is for a transgender mental health service for young people, and that's also 2010 who are contracted to do that, and that's $725,000 over 3 years. Your question around uptake, I would have to take on notice, but I can say that I have heard from within the branch that the programs have been received well, and I would, I think, emphasise what we would all consider, that it's important to, to direct programs towards vulnerable populations. So, yeah.
Thank you. And in taking that on notice, I'm interested in that the 265,000 that you just mentioned for 2010 for staff training over the next 2 years. Do you know how many New South Wales health staff are expected to be able to access that training with that funding?
That's what I would have to check. It's not necessarily prospectively 2 years from now. It's over 2 years, and this year may be the second year, but I will come back with that information.
Okay. Thank you very much.
Thanks.
I also had some more questions about the plans for suicide prevention training. So I understand that the previous package ended at the end of June.
Yes.
And that was with Living Works.
Yes.
So I'm interested in what's happened since the end of June and what the new rollout is, please.
Okay. I would have to take the Living Works issue on notice to come back to you with specifics around that. That's probably the safest thing for me to do, because it was a significant investment, and it was a significant expectation around the number of people who would be trained. We did work with Living Works as a important partner with New South Wales Health to try and expand. When a couple of years ago we were concerned that training wasn't perhaps getting to as many people as we wanted, but I'd probably need to come back to you with the I guess the plan after conclusion of those funds.
No problem. Yeah. And I appreciate numbers being taken on notice, but I'm interested qualitatively in the answers to your questions on notice. So last year we had been talking about Living Works, but you said that planning moving forward was considering the key target audiences for suicide prevention training. What are the key target audiences in terms of regions or priority population groups?
So I think Living Works has a very broad remit, as you would be aware, and key people who we would like to ensure are targeted. Originally, there was work done in schools. There was programs offered to parents of young people in public schools. There is also the importance, and I think this is increasingly the case, of people in a community who are identified, often not necessarily officially, as the effective leaders in that community who people look to when there's adversity or a natural disaster. And it's not, I guess we don't access that group only through suicide prevention training, but one of the initiatives we've been able to roll out in the last 12 months or so is ongoing funding for the 30 disaster recovery clinicians, and their role is very much around capability building, particularly after a critical incident and particularly in relation to wellbeing and suicide prevention.
Thank you. I appreciate this one's going to get taken on notice. Could you tell me where the 30 disaster recovery clinicians are located?
I could not. I could tell you that the funds share $23.7 million over 4 years for those, but I would need to come back to you with the exact locations. They will be based in community mental health teams, so that information won't be by district. Those teams, as you know, normally map to an LGA.
No problem. Yep. Thank you. I wouldn't expect you to know off the top of your head. We've been talking about suicide prevention training, which is, of course, only one piece of suicide prevention. And as you know, because I know you were listening during the mental health inquiry, there was a lot of discussion around the question of aftercare generally for people with lived experience of suicidality, but also for their carers and their loved ones.
Yes.
Could you provide an update of the work that's already happening in terms of moving towards universal aftercare?
Yes, I'd be happy to. As you're aware, the Universal Aftercare Initiative is a significant part of the bilateral 50-50 funded between the Commonwealth Government and New South Wales, and the quantum involved is $121.3 million. We have worked closely, and I think are close to finalising now, agreements with every PHN and LHD, looking at how to operate those services, sometimes delivered by partners in each local environment. There is, as you'd be familiar also, there was work done around the model that's used, and one of the key issues and this is probably less of a data question but more of a reflection from a systems level, is the importance of ensuring that our frontline clinicians, particularly agency staff or locums, and particularly after hours, know about the services that New South Wales is investing in, because actually that is potentially a gap that we have seen. So there's work to be done in terms of awareness of our clinical staff, the coordinator positions that have been an important part of this program. Part of their role at each district is to make sure that that translation of information happens. And also, I've just mentioned the ACI have also been involved, and that this has matured, I think, since the last estimate session around the model of care that would be rolled out in terms of universal aftercare. So ACI have been working on that and have, considered the evidence and spoke to consumers and clinicians. They're just trying to make sure that that model is consistent and safe. There's an older person's extended trial for aftercare that's offered in a small number of districts. And the other part of it is the youth aftercare pilot. I think you might be familiar, the youth aftercare pilot's offered in Tamworth, Coffs Harbour, Bankstown and Mount Druitt, and it has had an evaluation since last estimates. The young people told us that they had a good experience with that service, that they felt it listened to them, and there were demonstrable decreases in suicidal ideation and increases in confidence and preparedness to seek help. So I know that's a smaller part of this, but we thought that was very good news.
Thank you. One of the recommendations of the mental health inquiry was the expansion of safe havens to 24/7, and the government didn't accept that recommendation. It was something that was brought up by a number of stakeholders, particularly acknowledging that some people either don't feel safe or can't access emergency departments, that that's not the right solution for a significant number of people in crisis. Given that the government hasn't accepted that recommendation to extend safe havens to 24/7 coverage, what other work is happening to provide options for people who may not feel safe or comfortable going to an emergency department after hours?
Yes, okay, thank you. If I may just start on the safe havens themselves. We have 21 now operational, and you are correct in that. And a simple Google search for anybody in New South Wales will demonstrate the hours of operation, and we have good access. But I'm conscious that some of the facilities are only open for certain days of the week and for a certain period of time. The issue for us is that within the existing resources, the first thing we need to do is to make sure that the time that the safe havens are open actually matches when the demand is. So there has been work around that, and I'm satisfied that each safe haven has now looked at the hours that they're open as being the best match for their community in the absence of resourcing for continually being open 24/7. The second thing I would say about the safe havens is that there is an evaluation piece that needs to be done for all of those towards zero suicide initiatives. So you'll be familiar with the Safe Haven team, the SPOT, suicide prevention outreach teams, rural counsellors. That evaluation of that whole suite of investment is due late this year. I think that will be important information for the Minister to determine whether or not we are on the path to extending those services. But I guess that to answer your question specifically around what else are we doing to assist people avoiding emergency departments, there's quite a lot, but they are often programs that you'd be familiar with hearing about from the inquiry. So examples include PACER assessments, mental health first responder in regional New South Wales, where 85% of people seen do not need to go to an emergency department. The MAHAT team in Western Sydney, our assertive community, or the assertive community part of our community mental health teams. The mental health line as it exists, and it will even be better with a single front door, does give people good advice around the things they can do if they don't need to go to hospital and don't need to wait for potentially a period of time in an environment that's fairly stimulating. And I think, again, all of us would agree is not revealable to someone who's having a very distressing time. So I would just sort of emphasise that the mental health branch is alive to that issue, and notwithstanding the situation with safe havens, we are still working on everything we can do to avoid people needing to come to ED. Noting that for ED, ED for some people is the right place, and we want to make sure that if someone has a genuine, critical, time intense or time important intervention, that is the right place. And I can think of many examples where that's a very important thing, but I can also think of many examples where consumers will say that was not a great environment, and I wish I had some option to access something different. Yeah.
Thank you. This morning I had a brief interaction with the Minister discussing the Better Access Scheme and its interactions with primary care.
Yes.
Obviously that's federal,
Yes.
but I am very interested in primary care integration of mental health services, and in the inquiry we heard about the Uniting Care project by Dr. Paul Thorne in
Yes.
embedding mental health clinicians within general practice. I understand that's very promising.
Yes.
Is there work underway to look at replicating that in other local health districts?
I have spoke with Paul about that program. At the moment, I'm not aware of any work underway to replicate that exactly, but to answer the question around the work that we do in partnership with general practice, that is very much the issue around the partnerships that our districts and networks make with PHNs. I think that's considerably improved across New South Wales compared to 5 or 10 years ago. I accept that there's always more that we could do. The Commonwealth have worked on co-commissioning guidelines to make sure that when those conversations happen, that the sort of full needs of the community are being addressed. But the other example, if I could, that I might give is the Head to Health hubs, where we have tried to ensure that the districts and networks have a stake in the discussion around which consumers are offered that service, what's the best way to access it, what's the best clinical service to offer, based on the demographic needs of people within that PHN. I know that doesn't go to the issue of better access, but I guess because that's not a lever that we can pull, we are very interested in what else we can do in that link with primary care. I hope that answers that question.
Partly, and I'm interested in your opinion that it's improved over the last 5 years. I think a significant number of consumers see a really fragmented and siloed system. I'd be interested in any examples you can provide of
Yes,
recent
yep.
successes.
I would certainly endorse that many consumers and community members would describe the system as fragmented. The improvement that I see is that the directors of mental health and our PHNs are regularly meeting and working on their joint regional plan, and now working on joint projects like Head to Health. Whereas previously, many of the clinical activities that happen in each entity were not visible to the other. So that I certainly would not contest the experience of the consumer can still be incredibly frustrating at times, but at least that connection at the level between the district or network and the PHN, in my view, is significantly across the board. I can imagine there might be examples where that's not the case, but my observation across the state is that they have improved significantly. When we have mental health directors meetings, the PHN work comes up a lot more than it used to 5 or 10 years ago. I know that's not a data
It's a start.
question, but yeah, a data answer.
That's right. With my last few minutes, I'll bring up my last mental health inquiry recommendation for the day. I could do this all day. We made a recommendation around contract duration for non-government organisations. DCJ has moved to 5 years of funding. Every organisation that we spoke to that provides psychosocial support for people experiencing mental ill health said that short funding contracts were an issue for job security for their staff, for continuity, for trust with consumers. Are you looking towards 5-year funding contracts moving forward? Appreciating that the government supported in principle that recommendation.
I will answer and say that I heard that evidence. I see that frustration again from staff and leadership at our partner agencies and from consumers. The nature of a lot of our funding is tied to treasury cycles. and tied to, I guess, arrangements that are sometimes outside of certainly the remit of the mental health branch. What I can say is that we are doing what we can and advocating where we can to make sure that those issues are addressed, not just, or not, I shouldn't say just, but not only with our partners, but even at times, sometimes within the health system where there are time-limited programs. And I think everybody appreciates certainty around the service and around roles. The other side of that I do have to mention is that we also have to be reasonably flexible should some of our programs not demonstrate at evaluation that they are as effective potentially as other models that are out there. But I am alive to that concern and heard that from the CMOs, and it is something that does feature in discussions within health as well.
Absolutely, and I appreciate the piece about needing evidence of effectiveness, but when you've got programs like like PCLI that are overwhelmingly effective and cost-effective,
well made. Yeah.
I'm interested in getting my head around how this was so readily implementable for DCJ and not for health. What is the difference in how the funding's awarded?
Look, I think that's a reasonable question. I cannot answer it. I can commit to coming back perhaps with some more advice or information around that. I certainly would not want to suggest that some of our programs, and a good example is HASI and CLS that have international level evidence, that there's any suggestion that funding is tied to concerns around evaluation outcomes, because that's not the case.
Thank you. We'll go to the opposition.
Thank you. We've got 4 seconds, unexpectedly. Ms Pinkstone, just to pick up on that land audit issue. Now, with respect to that site at Kellyville, it's been indicated that Homes New South Wales would be developing the site and that 50% are to be social and affordable homes. Do you have a breakdown yet as to the apportionment for social and affordable?
No, just the target for the 50%.
And I take it that's the same for all of the sites?
Some of them will be 100%.
Different, yep.
For example, the Camden site is going to be 100% public housing.
And with respect to the affordable homes on the sites, who will they be managed by? Will they be managed by Homes New South Wales or a community housing provider? Or?
Probably a community housing provider. We'll have to go to procurement for that site.
And will you be taking that across the whole gamut, or will you be doing site-specific community housing providers?
It'll be site-specific.
Thank you. And are there any parameters as to what definition of affordable housing you'll be using, or who those homes will be made available to as of yet?
Look, within Homes New South Wales, when we partner with community housing providers, we use the New South Wales Affordable Housing Guidelines. And so there's a couple of requirements. For us, it's that the properties are held into perpetuity and that they're managed in accordance with those guidelines in terms of eligibility and income setting, rent setting, sorry.
Thank you very much. And with respect to the private homes on that site, is there any view as to whether they'll be build to sell or build to rent at this stage?
Traditionally, it's been build to sell, underpinning those models.
And that's what you...
We will go and,
once
we've done the due diligence, we're really aware of the actual number of properties, then we will model out to see the best delivery approach for each site.
Now, with respect to that site in particular, that's currently owned by Sydney Water. It will be transferred to Homes New South Wales. Does Homes New South Wales have to pay any exchange for that property?
We do.
Yep.
Under the current guidelines within the New South Wales government, we do pay for those sites.
Yep. And in terms of that, and I take it that will be across the board, whether it's a state-owned corporation like Sydney Water or whether it's another entity like, let's say, New South Wales Health, for instance.
That's right.
Okay. And are evaluations being taken on the sites, and if so, who's undertaking those at the moment?
We have evaluations through the Valuer General, and that approach will stay, the current approach in place to value those properties and a negotiation around the value.
Okay, thank you. Now, with respect to the North Everleigh site, so that was previously announced in 2022, I think it was, for 600 new homes. Now it's been announced for 500. Is there sort of a change of profile in terms of what's expected on the site or the size of housing, or...?
No, that's another one that we're, as much as possible, trying to leverage off the work that's already taken place, but we're also looking at increasing the mix of social and affordable housing on that site to 50% as well.
Yep.
And that will also include commercial and open spaces and things like that.
Yep. And is that site currently owned by Tahi? Is that
That's
correct?
right.
Yep.
It's one of the
Okay.
Tahi sites.
Thank you very much. And with respect, as you mentioned, Camden, so this one's 100% social and affordable homes to be delivered on the site, and it's 10, is it?
That's
that you're
right.
intending
10 at
to...
the moment is our sort of initial view on how many will be delivered.
And given it's right across the road from Camden Hospital, are you looking at any potential key worker housing as part of that development?
Affordable housing under the guidelines does meet the definition of key worker housing because it enables people who are earning an income to be able to rent those properties.
Okay. And the zoning around the site at the moment's R3, which should allow for some density on the area. Is it thought that will be sort of a low-rise apartment development or the like that you're looking at?
It will be. I mean, at the moment we are taking a conservative approach around the sites based on our initial assessment. I think once we've done the due diligence, we'll know if there's uplift available.
Okay, thank you. Now, with respect to that, and that I take it is New South Wales Health owned land, is it there? Or
I'll have to take that on notice. I can't remember off the top of my head. If it was,
Fantastic, thank you very much. And now with respect to the West Connect Dive site at Camperdown, now this is one that was said to be delivered in partnership with the private sector. Were Homes New South Wales able to make an election for the site?
We decided not to select that site. We've got a number of properties, but they're much further down, and we're also developing in Glebe. So we didn't decide that wasn't a priority for us. Understand then that moves to another process with Loncom and other parties.
So you made the decision at the time that effectively you had other assets in the area, other homes that you could make available, and other projects that were ongoing, which is why you chose not to make a determination for that site.
That's right.
Okay, thank you very much. Now I might just turn to some of the questions around the budget as well, and the social. I don't rip my pages, and the social housing investment within the budget. Now, one of the things, and I guess this is somewhat explained in terms of the consideration that might be paid by Homes New South Wales to other agencies as well, but in terms of the $4 billion over 4 years to fund 5,400 new social homes, including 1,300 replacement dwellings, part of the characteristic is, well, for land purchases. So in terms of anything that's revealed as of the audit, I imagine those land purchases would be part of that consideration in that $4 billion?
That's exactly right.
Yeah, okay, thank you. And with respect to the budget allocations, sorry, now I guess trying to work out in my head the operation of Homes New South Wales now with Land and Housing Corporation and also with the Aboriginal Housing Office. This money has been allocated to Homes New South Wales through Department of Community and Justice, but there's still allocations for Land and Housing Corporation for new housing supply and also for the Aboriginal Housing Office. How's this working in terms of delivery agencies and the like?
So we're actually working through that at the moment, having them come through, and the management of sales as well between agencies and DCJ. Obviously, it has to be considered in that. But we are looking at it from a budget as a whole. We have allocations for public housing, those that will be social housing, so developed in partnership with community housing providers, and then the AHO will have their own budget for delivery of new supply as well as maintenance.
Yep. So I guess I understand the distinction between the Aboriginal Housing Office and Homes New South Wales, but what's the demarcation you're using in terms of the Land and Housing Corporation and Homes New South Wales when it comes to new supply? Is it just a continuation of existing programs and the like that'll be undertaken by Land and Housing Corporation, or is there a specific task that Land and Housing Corporation are undertaking now as part of the asset portfolio?
No, they'll continue to have their delivery of new supply. We'll also be delivering new supply through grant programs that have traditionally sat within the Department of Communities and Justice, and maintenance will still be administered through the Land and Housing Corporation. In February, we came together as one agency, but we're still working through a number of issues that impact on the budget, including what was traditionally a funding agreement between the Land and Housing Corporation and DCJ. Doesn't really make sense anymore now that we're one agency, and we're working through that, but it isn't resolved yet.
Thank you. So in the 23-24 budget, Land and Housing Corporation was allocated $310.286 million for new supply funding. Yet in this year's budget, the estimated spending to the end of June 2024 was only $145.315 million. What's the reason that only 47% of the funding allocated in the last budget was used for new supply under the Land and Housing Corporation?
Sorry, let me just have a look. I'll take that on notice. That's and come back to you. That's not the numbers I have.
Sure. Thank you. Would it be possible for you to break down for which departments funding from the Building Homes for New South Wales program has been allocated by department?
Sure,
on notice,
I can,
that's fine.
I can
Yep.
take that on notice.
And how much of that funding comes from the Commonwealth at this stage?
Look, at the moment, under the national agreement, about 70% of funding for housing and homelessness funding comes through the state, and 30% on average from the Commonwealth.
Okay. And that's the characteristics of that program? Yep.
That's right.
Okay. Now, in terms of the 8,400 figure, which is cited in the budget for new social housing, does that include funding from the Social Housing Accelerator Fund as well?
I'll take that on notice. I think the accelerator is due to complete next year.
Okay.
So I can take that on notice for
Thank you. And how many homes are projected to be delivered through the Social Housing Accelerator Fund?
Let me just look that up for you.
Thank you.
So under the Social Housing Accelerator, we're delivering 1,500 homes by July 2028.
Great. Thank you very much. And with respect to that as well, while you've got the page up, I might have the information as well. How much funding has the New South Wales Government received from the Social Housing Accelerator Fund?
610 million.
Okay, so far. And how much is expected to be received until 2028 then?
That's the entire
Oh, that's the entire funding
commitment.
allocation? And how much have we received so far in terms of that funding? Or is it a forward funding agreement?
It's a forward funding agreement, but I can take that on notice and see if we've had it up front.
Thank you. Excellent. Now, just back to that modular housing trial. So the government's still on track to deliver 20 homes as part of the modular housing trial?
That's right.
Yep. Okay. And now the recently announced homes in Dubbo that I think are not necessarily modular housing but are alternative build methods, they're not included, I take it, in the...
They are.
Okay.
They're outside of the 20 homes that are delivered by
Okay.
Housing Portfolio. They're through the AHO.
Okay. Thank you very much. And is that a model that you're looking at using in other social housing across the state as well?
It is. This is very early days in testing that technology, so we are piloting through the AHO, and we'll see how it works out and how it stands up after that process. I mean, the AHO have already, as well as Teachers Housing, have implemented a number of modular projects, and so we've been able to learn from those as we're developing the program for public housing.
Okay, fantastic. Now, with respect to the modular housing trial, what are the success criteria being used by the government to be able to assess the success or otherwise of that trial?
Yeah, I mean, for us, it was about testing a few things with modular. It was to test there's two elements of that. There is the modular housing, a whole house that's being built and transported on site. And those are the things that the Aboriginal Housing Office and Teachers Housing have done for a number of years. The work that we did to set up the task force was to say, what are the conditions you need to put in place to have this industry grow as a whole in New South Wales? So we have seen in other jurisdictions MMCs being used a lot. That's not only about whole houses being built, it's also about a kit of parts. So what are the components of a house that you might be able to make in a modular sense that could help build that property? So for us, it's about a few things. It's obviously speed. It's about reducing cost in areas where, like regional and rural New South Wales, where we know those costs are higher due to travel and getting workforce. We're also looking at the environmental impacts and elements of that as well. We've heard through the task force that there is significant wastage in the current construction of properties, and that MMC has the ability to reduce that waste and also improve environmental outcomes for those developments. So there's a few parts of it, as well as looking at what would be required from a pipeline perspective to give industry assurance in New South Wales that they could scale up and deliver. So what we've heard is, with the new technologies that are being used under MMC, it is really important to have a sort of line of sight of a pipeline so that you can be sure that you can scale up your factory, that you can make decisions about those kit of parts. So there's a few elements of that under the task force, and the whole aim of the pilot is to start testing elements of that. Is it actually quicker if we use this technology? What's the environmental outcome when we're building? Right down to, are there particular parts or components of a building that are best targeted at MMC as opposed to other parts? And what size of a building is more financially feasible to develop, and what type of and style of a building can best utilise MMC technology?
So in terms of the budget allocations then, nothing would necessarily prevent those, is it 8,400 homes being largely, well, I shouldn't say largely, but a component of those being MMC homes potentially if these trials are successful?
That's my whole aim, is to use the pilot to really test those ideas and in what parts of the program we could best use them.
Thank you. Now, with respect to lax capital maintenance budget, in the infrastructure statement 2.9, it says that $700 million of this $1.3 billion will be met from proceeds of land transfers from Homes New South Wales and the Department of Community and Justice. What land transfers are those?
We're currently in the process of working through the program in terms of land transfers, but like other agencies, we're also looking at underutilised land and land for other purposes, and want to use that money to best effect through the maintenance program.
Okay, so that would be effectively land sales to the private market potentially, or?
It could be a transfer between agencies as well.
Okay. So if, let's say, for instance, you had a parcel of land, education were interested in it, for instance, that education could buy that land from you just as you bought land from Sydney Water?
That's right.
Yep, okay. And so that's being used to partly fund that capital maintenance budget of Land and Housing Corporation?
In part, yeah.
Yep, thank you. Now, it's outlined as well that 2,200 of the stock in terms of the new housing will be replacement homes. Just to clarify in terms of that term replacement home, does this mean a knockdown rebuild effectively, or are we looking at the transfer of, let's say, a knockdown of a house and turning into apartment blocks or the like? Or
that's exactly what we're looking at. So, within Homes New South Wales housing portfolio, they've done a detailed analysis of the current portfolio that we have under management, the 96,000 properties. And we also are working with community housing partners that manage around 30,000 dwellings on our behalf to really identify those properties that have reached the end of their life or aren't fit for purpose anymore, but have the potential for uplift and redevelopment. And for us, that's why the land audit can be useful in some respects, because the major issue is making sure that people can be relocated as much as possible in their own community to enable that to happen. And we know that there's a greater demand for smaller units. We know that there's a greater demand for accessible units and disability accessible properties. So the whole purpose will be to actually identify those and wherever possible redevelop on site so that people can stay in community.
So will you be outlining a list of those properties or that soon? Or
we are. We've got our current program for this year. We're actually in the process of working through the full program for the 4 years, which will actually be 7 years delivery time. And we're leaving some flex in there so that our partners can come to us with ideas about the properties under their management as well.
So that's sort of the community housing providers and the like?
That's right,
yep.
That's right.
Okay, thank you. With respect to those 2,200 stock of replacement homes, so that will be, so how many existing properties are you looking at that will be effectively removed from the system in order to facilitate those 2,200?
Well, it'll be a rolling program across the 7 years, and we'll have that detailed program by the end of this year. So I'll be able to come back with that detail. At the moment, we're working through how many and in what locations and at what time.
Thank you.
Before I go to my colleague, I think the advocate had an answer on notice for us.
So just in terms of the vaping tool, that is due, the Cancer Institute is co-designing it with young people, and it's due to go live, I understand, in December, with some updates next year in June 2025.
Thank you, that's very helpful. Ms. Kate Fairman.
Thank you, Chair. I've got a question for NRA, Mr. Barnes. I just wanted to get an update on something that actually took place a couple of years ago, back in 2020, and it was the compliance crackdown on blueberry farms. So I've seen the reporting from back then. My office is contacted a fair bit by people concerned about not just water take, which is your issue, but obviously pollution, runoff, and a range of things. But in terms of water take, the compliance crackdown that you did at that time found that 28 out of the 31 farms you inspected around the Coffs Harbour region were non-compliant. Just wanted to see what the update on that was. How regularly do you re-examine an industry like that? Has NRA been back on the ground and had another look in a comprehensive way?
So we look at irrigated agriculture across the state, and intensive horticulture was a campaign from a few years ago. We are due to have a look at a follow-up on that area this financial year, and we'll be in a position to report back. I would speculate, though, Kate, that there are still non-compliances in that area, that it is commonly dams that are well in excess of what their maximum harvestable right exemption is, and that is a challenging matter to resolve, and one that was previously been led by the former government in terms of changes to the coastal harvestable rights exemption policy itself.
Yes, because it states here, I'm going off the Sydney Morning Herald report actually. I don't have the detail from your website, but it does state that 13 farms were ordered to reduce the capacity of dams among 25 directions. Now, did all of those 13 farms reduce the dams? They've all done that?
So I would take that on notice if I may, but I can say generally that we have a program to follow up on the outcomes of enforcement actions we undertake in particular directions to ensure that they have been complied with. Where they haven't been, we will consider what additional actions have been taken. Recently, a court case concluded where we prosecuted an individual for not following the directions that were previously issued.
So in terms of following up, for example, around what looks like whether it's a decommissioning or reducing the capacity of dams, which in itself is probably a complicated exercise for landholders to do when the rain falls, or either got to decommission or pump water out, I'm assuming, when the rain falls. Is that right? I mean, reducing the height of dams, or you can't fill half of it in, or maybe you can.
Yeah, that's right. And that's a circumstance where the water user, landholder, has been unable to have their dam licensed with the assistance of Water New South Wales. So where that is the conclusion and it's a structure that needs to be modified, that's when we can utilise directions to do so.
So what is in terms of NRA actually going back and ensuring that this is done, so 13 dams, it does look like there's a lot of breaches. We know the blueberry industry, in fact, over the last 4 to 5 years, even the last couple of years, is expanding at a rate of knots. And so if there was an issue back then and the NRA hasn't gone back to really closely examine the industry, there might be, as you said, a few issues remaining. But with those dams, so you said you'd take it on notice, but what is the requirement for NRA to go back? Do you follow them? I recognise resources, you do have resources constrained, but do you actually follow them closely and work with them to ensure, do they have a period of time by which to comply, for example?
Yeah, so direction would specify what's required and over the period of time that the water user needs to undertake those works. At expiry, we will follow up. That's a common action that we take to ensure that the water user or the landholder has met the directions that were specified. Where that is not the case, we can then take escalated action.
So just be clear, you'll take some on notice, just to in terms of how many of those orders back then have been complied with and outstanding matters?
Yes.
Thank you.
Your position?
Yes. Do you want me? Thank you very much. I've only got a few minutes, but I just wanted to go back to a couple of questions around mental health. In particular, the Living Well Mental Health Strategic Plan that recommends early intervention for mental health for young people under the age of 16. I wanted to know what's being done to provide that level of support and ensure that it also, because I understand the new plan comes in place next year, new strategic plans next year?
I think the Commission is undertaking generating the new strategic plan, yes.
Okay. What work's being done for that particular cohort?
All right, thank you. Thanks for your question. So, look, I'll take a very broad approach for suicide prevention and mental health supports for younger people in New South Wales. We have numerous programs that are at the less, if you like, acute end, but are really important for access. So New South Wales Health provides $17.1 million over, I think it's over 5 years, so I could double check, to Kids Helpline, which is a very important investment for specific skills for operators on that line for younger people. Our safe havens and spots are able to see younger consumers who present independently. The safeguards teams, as you'd be aware, are, if you like, an enhancement of existing child and adolescent community teams, and have generally been well received. Their role is specifically to look after, in a shorter term model of care, usually for around 6 weeks, young people who may present in crisis, not necessarily to an ED, but possibly to the GP, a safe haven, a community team, or an ED with suicidality, and often that's related to a significant personal stressor. and time is provided to provide support and coping strategies and psychoeducation. And then if that young person is actually suspected or demonstrated to be experiencing mental ill health or a mental illness, they can transfer over to the community mental health team as well. And then for people who need more intensive care, we've got a statewide networked series of child and adolescent mental health inpatient units. So,
And could I get a breakdown of the budget for last year and this year for each of those programs or initiatives that you mentioned?
Yes.
But also how much is being spent on community mental health for both, particularly for youth and then overall?
yes, I might start with, for example, the suicide prevention initiatives. They are not necessarily delineated on basis of age, because it's the one service. But the Safe Havens are $45.6 million, and that's a funding package that goes up until the end of 25-26, and the SPOT teams are $41.9 million. The community teams, I don't have separate figures for the child and adolescent community mental health teams and I can undertake to do our best to get those, because often they are standalone teams, so that should be information we can provide. I don't think we've necessarily got separate, we certainly don't have a separate budget for child and adolescent inpatient care. That would fit under a mental health services inpatient unit budget, if that assists.
And I've got 4 seconds. Final question just around that, leading on from the community-based workforce. Has additional funding been allocated to grow the workforce?
In the recent budget, there was $30.4 million for 35 new mental health clinicians. There are 5 that go to St Vincent's to assist with homelessness outreach. There are 5 mental health homeless liaison positions, and there are also positions for justice health for people coming out of corrections. All of and the others are, if you like, universal positions that can be used to boost the establishment at the teams that we've identified to boost the establishment staff profile with this budget package. All of those clinicians can see younger people. It will depend on where that service needs to utilise. So if you're in an area where you're not meeting or you're having difficulties meeting child and adolescent demand compared to adult, there's certainly the option to put that position in a child and adolescent team. So they're not specifically adult or older person or child and adolescent.
And I'm mindful I've sort of run out of time, but just in relation to those clinicians, you said some were attached to St Vincent's. Are any attached to regional towns?
Most of the others are
hospitals?
attached to regional, and I've got a breakdown here. Just looking at regional LHDs, Hunter New England has 3 of the community and 1 of the mental health homelessness liaison positions. Mid-North Coast has 2, Murrumbidgee has 2, Southern New South Wales has 2.
Thank you.
With the Chair's permission, I also have 2 little further pieces of information that may assist with the previous questions or otherwise, if that's of assistance. 413 staff have undertaken the 2010 CAMS training program.
Thank you.
And after the Living Works contract, each PHN now is getting $50,000 from the bilateral funds to do that local suicide prevention training in a way where I guess it can be adapted to the local community's needs. I've also got the list of locations of disaster recovery clinicians, but everybody may be happier if we provide that on notice.
I'm happy with that one as a written answer. Thank you.
Yes.
That brings us to a short afternoon tea break, with my apologies that I won't be in the chair after the break because I'm deputy chair of the committee that's examining Minister Dibbs, so I've been running between the rooms today.
And Chair, can I just, I have been called to, and I think it's been agreed that I'll attend the final hour of
That's
of
correct,
Minister
Mr.
Dibbs'
Temple.
estimates. Thank you.
I'll see you in Portfolio
Thank
Committee
you.
8 with
We won't
Minister
take it personally when you walk out.
Start with questions from the crossbench. So,
Thank you, Chair. Just wanted to go back to the issue of Sydney Water, Mr. Shiro, in terms of the PFAS testing. Why is PFAS tested once a year compared to other testing that's undertaken? Why is it annual?
So testing will depend on the potential elements that we're testing. So some of the elements can be.
Can you move the microphone a little bit closer to you again? Thank you.
It's designed for loud politicians, I think, as well.
Yeah, so testing will depend on the elements that we are testing. So sometimes, and where they're coming from. So sometimes, and I take the example of some of the biological contamination, we have to test it every day and several times a day because we know that it can happen at different moments during the day. When you're talking about an element like PFAS, we know that it's not going to happen several times a day. So you know that if there's a source, the source of contamination will be there, and the contamination will last for a very long time. So you can detect that there is a contamination, and therefore you can do the analysis once a year. If there would be a risk in the catchments that it could happen, in that case, the testing would be more often. But the catchment is actually protected. Therefore, if there is a source today, it's existing, and it's very unlikely that there's another one coming tomorrow.
So is that the same as other chemicals broadly? So I understand in terms of E. coli and what have you, of course that's what you're referring to,
yes.
But is it this broader sampling of chemicals that for all intents and purposes could be unexpected or could not be, but are they all tested annually?
Yes,
or
that's
is
correct.
there
That's correct.
right, and is that the case for the local water utilities, as far as you're aware, in terms of testing for chemicals, Hunter Water and others? Do they all have to do the same? Just once a year, they test for these range of other chemicals?
So all the analysis programs are discussed with health. And at the end of the day, this is not a decision from the water utility, but this is a joint decision between the water utility and New South Wales Health. So if health would be asking us to test once a month, then we would be testing once a month. We have one site, which is Cascades, where we are actually testing PFAS once a month. The rest of the sites, it's once a year. So it very much depends on the discussion and the risk analysis that is done jointly with New South Wales Health.
So with so Cascade and Medlow Dam, so the media reports were that it was Medlow Dam that was shut off from the rest of the water supply, is that correct?
Yeah, that's correct.
So does Medlow Dam, I'm trying to picture the way in which the catchment works, does Medlow Dam provide or supply, water to households so that when it was cut off they've had to, no, so it goes into the catchment?
It goes
into the dam?
I should ask my colleagues from Water New South Wales, but Medlow goes into Greaves, and then you've got Upper Cascade.
Medlow goes into, sorry?
Grieve. Andrew?
Mr. George, why not?
Yeah, so there's 5 dams in the Blue Mountains
Yep.
that feed the Cascade Water Treatment Plant. Medlow Dam is at the top of the system, which flows into Greaves Creek Dam. Greaves Creek Dam then flows into the 3 Cascade dams.
Okay, and so Medlow's been cut off for now?
Correct.
And what is required for it to be brought back into play, into supply?
So it's been taken offline to support our investigations into trying to determine a cause or source for the slightly elevated levels of PFAS in that catchment. So the benefit of being able to isolate it from the supply is that it just removes a number of other variables. So we, excuse me, so we can explore those likely sources and understand what change occurs in the cascade dams as a result of isolating them from the supply.
What investigations have you undertaken at the moment? I've asked the EPA this question as well. I know the EPA is working on it, but Water New South Wales is also undertaking work?
Yes, we are. So we're doing more sampling within the catchment itself to see if we can narrow down which part of the catchment these elevated levels are coming from. We're also having those conversations with the EPA, as you indicated, as well as RFS, the other firefighting agencies, so fire and rescue. We were looking at historical uses in the catchment, historical fires, and trying to understand how those fires in the past may have been put out, whether or not chemicals were being used. So there's a bit of investigation going on historically to understand where this might be coming from.
Say if there are, I was actually in the Blue Mountains in Springwood on Saturday and speaking to a number of locals who were obviously concerned. They did mention they believed, and so this is probably the conversation that's going on up there, that the fires of, was it 2011, 2012, that one of them was working, was in the Rural Fire Service, and that PFAS foam was potentially used, they believe, in that fire at the time to put that out. So say if that is the case, we're not going to obviously speculate here whether, and I'm not going to ask you to speculate on that, but if it is, with Water at New South Wales and Medlow, let's use Medlow Dam or even Cascade, what are the options that you have available to treat that water to reduce PFAS levels firstly?
So it's very difficult to say at this stage. If we could isolate it in a best case scenario to a very small area where it might be found within the soil, for example, and we know that PFAS is highly soluble, so it may be when it rains that the PFAS is mobilising and flowing into the dam through the tributaries and creeks upstream of the lake. So if that's the case and we can identify exactly where this is, we may be able to put in place some remediation activities to remove it from that part of the catchment. That would be a best case scenario.
That's the best case scenario, because some of the what's happening in the US, where admittedly, yes, they have a phase in time, of course, to reduce PFAS in water supplies down to the 4 parts per trillion, I think it is, that there's a range of different ways. I was talking about it very briefly this morning, but a range of different technologies that exist. Is Water New South Wales looking at what range of technologies exist? And Mr. Shiro, I'll ask you the same question in terms of treating PFAS.
So we do work together with Sydney Water and New South Wales Health, and we adopt a catchment to customer risk-based approach, so a multi-barrier approach to protecting drinking water. So in the catchments, we'll see what we can do in the catchment. So as I said, obviously the most preferred approach would be to remediate the site and remove it from the catchment. If that's not possible, then we will look at other interventions as you move down the supply chain until you get to the treatment plant itself, which might be where you're referring to some technology and treatment actions.
Because it was reported in the Sydney Morning Herald about, with this PFAS report, that they spoke with businesses, a business that actually treats the water to go back into the river system from, they didn't mention what business, but potentially heavy industry, that has to be treated at a level a lot cleaner in terms of PFAS, removing a lot more PFAS than drinking water. So it is able to be done. So I'm sure Water New South Wales and Sydney Water are aware of what the companies need to do. I know it's potentially an EPA thing, but they are discharging into the water. So I would assume, given what's happening with PFAS, you are scrambling, you are at least tasking somebody internally to have a look at, if you do need to treat it, if the federal guidelines are substantially improved to reduce that amount of PFAS, then you're going to have to act pretty swiftly, aren't you?
So Just want to repeat the fact that water is compliant with Australian drinking water guidelines. So all the water that goes to our customers is compliant. In case the regulation, the Australian drinking water guidelines would change, and that would go below the level that we've got, which is already very, very low, then yes, potentially we would need to build additional treatments. The sort of treatment that you built on water treatment plants are well known. So in case the regulation would change, then yes, we would go straight into building the additional facilities.
You did say it's very, very low, but it is extraordinary that the US EPA, which I've had a look at, how they evaluated it, the work in which they undertook 130 new epidemiological studies, and they've reduced it down to 4 parts per trillion. Remind us what is the Australian Drinking Waters Guideline
70.
again?
70, yeah.
70 parts per trillion. Mr. George, do you have, what's Water New South Wales's role, if anything, in the, again, I've spoken with the EPA about this, it is, we've got the EPA, Sydney Water, Water New South Wales, there'll be New South Wales Health tomorrow, multiple agencies on this kind of health, the health of water in our rivers and drinking water. In terms of the water that has been detected in the Belubula River, the contaminations in the Belubula River, what role has Water New South Wales played in that particular situation, if any?
Yeah, no, so we've had no role to play in that matter.
Okay. So with Water New South Wales's the water storages that you are responsible for across the state, we've got the water testing that takes place, this annual water testing. Is there any other testing for chemicals, PFAS chemicals, that you've been undertaking, particularly, I suppose, since the last couple of months when this has really hit the headlines?
So we have a very different role to play in the Greater Sydney catchment compared to our role in the rest of the state. So our role in Greater Sydney, particularly in the declared catchments, is around the protection of those catchments from water quantity and a quality perspective. So in the Greater Sydney catchment, we are now engaging with Sydney Water and New South Wales Health on a broader monitoring program. So over the next 5 weeks, we will be undertaking more sampling in the dams that supply the various water treatment plants. Just within Greater Sydney. We do not have the same role in regional New South Wales. In regional New South Wales, it is the responsibility of the local water utility.
Yeah, thank you. I wanted to turn to the issue of water use, water supply to mining companies now. Ms. Jones, I think this is probably you. So you would be well aware of the licensing exemptions, the excluded works that mining companies are able to use in terms of water. So they do water take that isn't licensed, that is off the area of, say there's a mine with 3,000 hectares footprint. They are able to take that water. It's not licensed, they don't pay for it, but they use it. You're aware of that procedure, that system?
Are you speaking about Dendrobium in...
No, I'm actually going to speak about McPhillamys, Bowdens, Cadia, coal companies, coal mines in the Hunter Valley in the Central West.
So mining companies, if they're doing a development and they're looking to make any works on a site and use any water, it's not that they're exempt. So normally they would need to go through an EIS process for the overall project, but also if they were building a work, so a dam, or they were extracting water, they would need those activities to be licensed.
That's extracting the water, but I'm being told that it's not the extracting the water, it's the runoff, the rainfall and runoff figures that go over that land in terms of capturing all of it and it being, essentially contaminated, but they're able to use that in their operations. I've got figures here, for example, from McPhillamy's Gold Project, there's 1,971 megalitres. They can do that. Moolarben Coal Expansion, 1,102 megalitres. Bowden's, the Lead and Silver Project, 954 megalitres. Cadia Gold Mine, 8,871 megalitres. A couple of others, which brings it up to 12,717 megalitres average per year. This is what just in one particular area. And so the question is, in terms of that cumulative impact, like that's not a water take like pumping it out of the river or pumping it out of, in terms of groundwater, but mining companies or industry are able to get at being able to get away with that, I think. The question is there an authority that approves that take?
So the overall approval for the mining development is under the planning legislation. If it's an issue around actually potential pollution or contamination of waterways, that is a licensing issue for EPA. If it's a water take, then it's a licensing issue for the department. And if it's a works approval for holding water, then it's also a licensing issue for the department or New South Wales, depending on the amount of take.
Yes, so some of these developments, excuse me, so do they have water management plans in terms of their whole operation? I know there's water access licences, but then the way in which does the department approve that, or is that a planning thing?
No, it's a planning thing.
Is it?
Yeah.
So, and I've asked this before, I'm going to ask it again. Within it's now DQ Water, is there some unit within the department that looks at the cumulative impact, the cumulative take of water from mines? So there's a range of different projects up for approval. In terms of expansion, Central West is a critical minerals rich area apparently, and potential many more mines will be seeking to mining companies will be seeking to operate. Is there a cumulative database of the water in which is licensed to mines, as well as this rainfall and runoff take?
So the water take is looked at under our water sharing plans, and the compliance for those plans, either for an LTEL compliance or an SDL compliance, depending on where the plan is. In DQ Water, we have a small team who look at state significant developments, which mining developments often are. They will be assessing those developments not from an environmental impact perspective, not from a water quality perspective, but from a water availability perspective. So on McPhillamy's, for example, all of the department's advice is on the planning website, but that advice is all about the volume of water, not about the environmental impact assessment.
Yeah, so that's what I'm asking about here in terms of the availability of water, given that, for example, within the Murray-Darling Basin Plan, with the there's a limit, of course, in terms of what can be diverted and what can be taken, and although there's a fair bit of a huge amount of wriggle room, as we've discovered in recent years, but with this, that doesn't fall within that water that has been allocated within the plan. So this isn't water that's allocated within the plan, is it?
Depending on where the mine is.
So the Belubula headwaters, let's look at that one, which flows into the Lachlan, which flows into the Murray-Darling Basin.
Yeah, so in the case of...
there's a pipeline or something that has to be built for that, isn't there?
well, the McPhillamys development, basically our advice about that proposal is on the planning website. But in April 2022, under the previous government, a regulation was made for a specific category of licence, so a special purpose licence. That licence hasn't been provided. It's still being reviewed by the department.
Sorry, just one follow-up. The special purpose licence for that particular project?
For water take, for that project, for McPhillamys.
Thank you.
Karen Jones?
Thank you very much. I've only got a couple of mental health questions. One is last year, additional funding was given to Lifeline to expand into text and web chat support. Interested to know that. Do you know if they needed to put in any additional safety measures, particularly for dealing with children and young people who might be using that service through that type of communication?
I'm happy to answer that. Look, I'm not aware of whether Lifeline has needed to do that or in fact has done that. Lifeline have quality controls around the work they do and very much a trusted partner in this work. The case was made to expand to media or medium that young people in particular are more comfortable with. But I don't have today full details of any arrangements in particular that might have been made around that. I suspect that they would have needed to look at what the model of care for text and web chat would include. Yeah.
And is there an evaluation of that service as part of the, was it a 5-year funding that they were given?
Yes, Lifeline, in addition to the 13 million annually, they were given, I think it was 6.1 for the text and web chat, 1.6 million. All right, thanks, Deb. I haven't, certainly there's no evaluation that we have received around that. I, again, would need to come back around information, but our expectation would be that Lifeline and other partners providing similar services would be providing evaluation material.
Thank you.
I'll just add this to Karen Jones. We do have the Kids Helpline, which is a $17.1 million investment over 4 years, specifically for young people between 5 and 25.
Yep. Thank you. The other one just is following on from the single front door program and particularly around mental health. Is there, I understand that it's being delivered through Health Direct. I was wondering whether or not you had an indication of whether or not rolling this service out will have an impact on wait times.
Thank you. Did you want to? Yeah, sure. Thanks, Dan. Look, we would expect, if anything, that it would decrease wait times. In general, statewide, we keep KPIs around the number of calls that are abandoned, the number of people who wait. I think it's for more than 2 minutes. Statewide, the issue with the mental health line has not been so much those performance metrics. It's been that it's fragmented. Individuals have needed to tell their story multiple times. It doesn't have access along the lines of text or app or web chat. And so the opportunity with the single front door is predominantly around those things and trying to get a uniform service across New South Wales. Notwithstanding that, there are some situations where people have waited for significant times, but certainly the new contract would include monitoring that.
And also an evaluation?
Yes, it would include evaluation.
And what's the time frame for the evaluation?
So the time frame to get the project started initially is with the first 7 districts or networks going on in February 25, with hopefully all of our networks and districts going on by mid-2025. The evaluation would obviously come after that, but as a part of running a good program and setting up a good program, we're putting that into the structure at the start. So, yeah.
And I could just add, just in terms of Health Direct and our contracts with them, we do, as Dr. Flynn pointed out, have KPIs around people, not waiting and jumping off the call, and part of our contract management would be to monitor those KPIs probably on a monthly basis so we could track performance and make sure we're meeting the needs of the community. Thank you.
Thank you. And that's so on the New South Wales Health website, it says that in 2023, over 400,000 calls were taken through the single front door /Health Direct, and over 315,000 people were assisted and triaged. So the remaining around 85,000 people who phoned in, what happens to those?
I think that entry on the website might be around the physical health single front door that exists already. It's only now that mental health services will be joining that as an integrated service. So I'm not sure I can provide information around that.
I suppose the only thing is something being put in place to prevent people sort of stepping off the line, or if they do, what's the follow-up so that no one misses out?
Yes. There are safety protocols around the concern, I think, that is understandable that we would all have is if someone waits online and then hangs up, and around that the work that we do is making sure that whilst people are waiting they've got access to who to call for an emergency, because people ring with, as you can imagine, a spectrum of acuity to that service. But we also do collect data around times where the mental health line might drop out for technical reasons, and there are contingency plans in place around that as well. We're hoping the new system with Health Direct, and we have an expectation that it would increase our capacity to monitor this and decrease those events, simply because it's going to be a single integrated statewide system.
And I'm happy for you to take this on notice, but you just said that you monitor those that drop off because of technical challenges. Could you provide how often that has occurred?
I could. The one I'm thinking of is the sort of worldwide internet outage a couple of months ago, where on a Friday afternoon that was a significant concern for lots of people for lots of different reasons. I certainly could come back with any information around any other dropouts and perhaps also the duration around that one as well.
Thank you.
Thank you. Just for the benefit of the committee, there are no more questions for the mental health portfolio from the members, so we're happy for Dr. Wright, Dr. Flynn and Ms Wilcox to be excused. Sorry everybody else who's still got more for you, but we're trying. Thanks very much.
Thanks very much. Thank you.
Mr. George, I have a couple for you, if that's okay. I wanted to ask about the process around the tender for the Upper Hunter pumped hydro projects.
Yep.
Specifically, I guess, the details around the competitive tender process and what exclusivity rights have been given to Upper Hunter Hydro as part of that.
So that process started with an expression of interest a number of years ago, where we went to the open market as part of the former government's pumped hydro roadmap approach. We received quite a range of interest, and we had a particular party that eventually came through the process, which, forgive me, I forget the name at this point in time, it's escaped me. They started going through the process. They were unable to get approval through FIRB, the Foreign Investment Review Board. As I understood it, they effectively sold their interest in the project to Upper Hunter Hydro, who carried on with the project from that point forward.
And is it just the two? Is it Glenbourne Dam and also Glennies Creek? Is it just access to those two?
Correct.
Okay. And is there any information in terms of access to land surrounding those dams? What will happen, I guess, for some of the local landholders and how that will work? Can you provide any information?
So that's a matter for Upper Hunter Hydro. So they've been given, if you like, access rights to Water New South Wales land for the purpose of their development. To the extent that they need to engage with or negotiate with private landholders as part of their development, that would be a matter for Upper Hunter Hydro.
Okay, and similarly, if they have to look at any compulsory acquisition, that's a matter for them as a company as well?
Yes, but I'm not sure how a private sector business would undergo compulsory acquisition.
Yeah, okay. In terms of the length of the exclusivity of that arrangement or that tender, do you have any information in relation to that?
Not in front of me right now, but I can take that on notice.
On notice is fine, yeah, thank you. Okay, I just want to come back now to you, Ms. Jones, just in relation to some of the questions I was asking the Minister earlier today in relation to the AITHA report, and particularly the recommendations that go to structural adjustment measures. Is there any work underway in the department in relation to the specifics of that report?
So the recommendations you mentioned were 5, 6 and 7.
Yes.
So recommendation 5 and 7 are really about the design of the buyback framework. So the reason we commissioned the AITHA work was to, as an advocacy piece with the Commonwealth, as part of alternates to buybacks. So we have advocated with the Commonwealth about taking into account those two recommendations. 5 was about that there should be the consideration of exit grants for high security licence holders. 7 was about looking at opportunities to rationalise networks if licences are being bought up within an irrigation organisation, for example. The Commonwealth to date hasn't actually reflected those kinds of ideas in their current framework, which they have published. However, where they're currently looking at buybacks, recommendation 7 probably doesn't apply. We'll continue to advocate with the Commonwealth that they take heed of those of that advice. Recommendation 6, which is about providing adjustment where impacts occur, so providing adjustment payments or opportunities, taking account of where the actual impact occurs. So the water right might be brought up in place X, but the actual industry it affects could be in place B. That idea will definitely need to be considered and will be considered by Minister Moriarty, I'm sure, when designing the framework for structural adjustment in New South Wales.
And just going to that point, when the Minister obviously spoke earlier about the role of Minister Moriarty, how is your agency working with the Department of not Department of Regional, their new acronym, in terms of the specifics of any structural adjustment? What does that look like at an official
There is a steering group working between the two agencies, and we'll definitely support Department of Industry and Regional New South Wales in any advice and support they need to think about how to frame the program in New South Wales.
Okay, and one of the other recommendations from that report was around clearly communicating strategy and intent. I think it was recommendation 2, just so that I guess entitlement holders can consider the implications whether they do participate in buybacks or not. Again, is there anywhere since this report has come out, and I appreciate what you said about it being kind of an advocacy piece, but that gives any more information?
So from the Commonwealth's perspective, they've published their framework, but from the perspective of how structural adjustment might be managed and communicated, there's absolutely a commitment, as I understand it, from Minister Moriarty, and certainly Minister Jackson supports this approach, that the communities affected will absolutely be consulted about the types of initiatives that could provide relief to those communities should buybacks occur.
Okay, thank you. I want to take you now again to some of the questions I asked the Minister earlier just about the Connectivity Expert Panel report. My understanding is in terms of some of the data collection, and it was particularly in relation to the Northern Basin, effectively because of the absence of data, there's some sort of recommendations about reducing diversions. So an average of 4% across the Northern Basin and 6% in the upper 3 catchments. Has there been any work, or is there any work being undertaken at the moment to analyse the economic and social impacts of those diversions across both the Northern Basin and the upper 3 catchments?
Yeah, so the independent panel made recommendations about both holding additional environmental water for pulsing and also about end of system measures as well. They also made recommendations on the operations of Menindee Lakes. There is a roadmap in the panel's report, I think on about page 115, and it sets out the time frame. They acknowledged that the work needed to be done to analyse the implications, potential benefits and implications of the recommendations they were making. So the department is doing the hydrological and economic analysis between now and the end of the year. We're looking to, in March next year, be able to consult on what we found, and by the middle of next year to have a next steps kind of options analysis piece ready to consult on as well. With regard to Menindee Lakes and the operation of Menindee Lakes, this is really an issue for the basin, so this is not something that New South Wales can do on its own. It needs to be consulted through the Basin Officials Committee and through MINCO, and that's what will happen. We can't change the operations of those lakes without the other basin states agreeing.
Yeah.
I might mention that it's a really exciting but very challenging time over the next couple of years in the water planning space, because while we're looking at the recommendations from the independent panel, we're also, and I think this was referred to this morning, we're also looking at what the minimum inflows should be in 7 of the inland surface water plans, and they're the plans from which most water is extracted. Now, setting those minimum inflow standards also has an influence on how much water you assume is available in those catchments. So we have some competing ideas here about how to set rules in water sharing plans to share and manage the water. So we really need to make sure that all of this work is in alignment, so that we can understand how the assumptions work together or work in or conflict with each other over the next period.
Thank you for that. And I want to take you also now just back to the issue around the SIDLAM's projects. And I know that earlier in evidence you were talking about, I think, some of the work hopefully starting in the dry season, in March. But obviously depending on, bomb predictions and what may or may not happen in terms of rain events, I guess, is there any kind of contingency built into the projects, given that you obviously can't control when it may or may not rain? And how do you manage that, I guess, or mitigate?
So they're in the contracted arrangements, we will definitely incentivise for completion of projects.
Yes.
And there are, while there are 6 SIDLAM programs, if you like, or projects, if you like, there are 79 sites. So, and they're all in fairly remote areas, and the works are not big works necessarily, but it's a challenging series of projects to manage from that perspective. Rain could disrupt us. There's nothing we can do to prevent it. That's why we're really focused on getting the managing contractor up to speed so that they are absolutely ready to start with their workforce, with the materials they need, in the locations that they need to work. And as I said, there's 79 sites. So that as soon as the dry starts, they're ready to work. So the way we can best manage the water risk is to be as prepared as we can.
Yeah.
But there's no doubt that if we had an extremely wet period, that would disrupt the work.
Yeah, and presumably the intention with the contractor is to be doing as much concurrently as you can across those locations as well. So,
yes, correct.
And then the Reconnecting River Country program, projects under that, is that in addition to the SIDLAM projects, or is there any overlap?
Yeah, so Reconnecting River Country is the projects that we have to deliver to the end of 2026 are a combination of completing a business case, but also one of the key projects for the Murrumbidgee is looking at how we can run the Murrumbidgee water sharing plan at its full flow rate. At the moment, Water New South Wales is constrained in being able to release environmental flows because there's about 150 private properties that can experience inundation if that water is released at the full flow rate. And then there are a couple of bridges and other things that we're building to make sure that forests in a couple of places are wet. So there's a particular scope of work that we have to deliver by December 2026. And it's focused on those things.
Okay.
The broader program itself, as fully envisaged in the two business cases, would take 10 years to achieve and involve like 4,000 landholders. So, and it's not funded yet. So the approach to these water constraints projects is really, I guess, stage by stage.
Yeah. And are those water constraints projects, I guess, or is that work prerequisites for some of the environmental water to be delivered as well, or does it just depend on the...
It supports environmental water being able to be delivered.
Okay, so do you have to do one before you can do the other, or does it depend?
Well, a lot of the water's been bought back, or it is held under licence. In these particular catchments, we need to do these projects to allow it to get to the places that need to be wet.
Yeah, okay, sure. Thank you. We're back to crossback.
Thank you. Chair, may I be excused to
you certainly
visit the other
may,
committee?
yes,
Thank you.
Thanks,
Chair.
for your time.
Thank you, committee.
As long as it's to go to another committee.
Or the bathroom, either one.
Thank you, Chair. I just wanted to turn to the connectivity, the independent connectivity expert panel report. And after the release of that report, I think it was afterwards anyway, that the government has said it's undertaking detailed hydrological and economic modelling to assess the findings of that panel. What's the kind of scope of work of that? Has any agencies, or consultant been contracted to undertake that work?
No consultants have been contracted that I'm aware of as yet. We are scoping both the hydrological work and also the economic analysis to be done. It may be that we need to contract assistance for both. Modelling and modellers are quite in demand at the moment, but also from the economic analysis perspective, we will obviously consult with Agriculture New South Wales, and we'll look to ABARE for the work that they've done, but you know, there is likely to need to be some expert advice in that space.
Sorry, did you say likely to be needing some...
expert advice in the economic analysis space.
In the economic analysis space. So with the modelling work then, is that, I think the panel recommended that it be completed within 6 months. Is that the time frame?
That's what we're aiming to achieve, yes. It's the end of this year. So end of this year, and in March next year, we're looking to be able to present what that analysis has shown. Yeah.
Present publicly?
Yes.
So the panel also recommended that to ensure accountability, there should be independent oversight of further assessment to ensure that the intent of the recommendations isn't lost. So is the department, or are you looking at ensuring independent oversight of this additional hydrological and economic modelling that is going to take place?
So our modelling work is always independently peer reviewed, and there's not been a decision to have anything in addition to the normal oversight of our work. So it's either Natural Resources Commission looking at the effectiveness of our work in terms of the water sharing plans, or the independent review of our modelling. Our modelling, depending on its use, is also reviewed by MDBA, and they often get independent review of the work as well.
When you said with the modelling, that the modelling is always peer reviewed, I think, did you say?
Yeah,
peer
yes.
reviewed. Remind me who undertakes that, or do you mix that up?
It's it's variously experts in the field, and yes, it is a mix. And actually, on our website we have we do have a program of updating all of our models. The Namoy model was independently peer reviewed most recently, and I can confirm whether those reports are available.
Thank you. And so with the additional economic modelling, which is obviously separate to the hydrological modelling that you'll be undertaking, so you're saying that that will be undertaken internally?
The economic modelling, yes, but we'll probably need to provide rely on some expertise as well. That they'll be interdependent because to do the economic analysis of impact, we'd need to understand what the hydrological modelling said.
So the economic will follow the hydrological?
Yes.
So with the economic modelling, are you expecting it to, in terms of the parameters for that, and I suppose this is the case when you'll be looking at cost-benefit analysis for particular projects, often the benefits seem to get, well, depending on what it's being put forward for, but for example, will you look at things like, positive social, cultural and environmental outcomes arising from the recommendations contained in the report, things like the negative economic impacts of the fish kills? Do you expect it to be comprehensive like that?
Yes. There may be a limit to how much externalities, some externalities can be. I'm not an economist, but from the modelling I've experienced with BCR analysis, there is sometimes a limit to the externalities you can take into account. But yes, you'd be wanting to we would be looking at both the social and economic impacts of any changes, including, as you were mentioning this morning, any compensatory triggers under the Water Management Act that might happen.
So any economic benefits that may be realised or can be predicted to regional communities that greater river connectivity delivers, for example, that will be part of it. And, I think you can see the reason why I'm asking these questions in terms of some of the socioeconomic studies that have been undertaken around, environmental flows, buybacks and everything seems to generally be a little bit one-sided in terms of the economic and social impacts of that, as opposed to the benefits that can also be brought by more water.
Yeah, so the social and environmental benefit needs to be valued as part of the analysis.
That will be?
Yeah.
That has been specifically laid out?
It's part of the approach. It's part of what we would need to do.
Okay. I asked the question earlier about the compliance action. Do you want my next 10 minutes? Is that why you're here? Yeah. About the compliance action in relation to the blueberries in Coffs Harbour. What role exactly does DQ Water play, or Water New South Wales, but DQ Water really, in terms of tackling the agricultural runoff? And I questioned the Minister earlier about the whole catchment management issues, the fact that integrated catchment management has been obviously lacking for quite some time. But you do work together on that with agriculture.
So in terms of actual environmental pollution from runoff, that really is an EPA role, and EPA does the water quality monitoring. But with regard to your question previously about the integrated catchment management framework and your observation about what's lost in New South Wales compared to Victoria now in terms of catchment management.
And also us 12 years ago, or 14 years ago, whatever it was.
So the State Water Strategy released back in 2020 identified this issue, and there are a number of initiatives. One of those was to actually develop a water quality roadmap, which we have published on our website. That roadmap really came up with two key recommendations. One was that we really needed to improve water quality governance, which is where the integrated catchment management framework comes from, and the other was we needed to improve data and reporting. You asked also about are there terms of reference for the integrated catchment management framework. If you go to the water quality roadmap on the website, it sets out 5 steps. The first is a historic desktop kind of review. We've completed that review, and it tells you what you would expect, that there's over like 30 agencies that have a responsibility for water quality outcomes and about 50 pieces of legislation. So very dispersed, not unified. So the framework really needs to address that challenge. By the time we get to step 4, which is the governance framework options and analysis, that's when we would actually start to consult on.
Are there recommendations in all of that? That's very useful. Thank you, Ms. Jones. Are there recommendations, or is anybody kind of say, oh, have a look at what, the thousands of hours of work that were done to bring together catchment management authorities and the catchment action plans and all the agencies and all the stakeholders? Like, that work has been done, and I shudder to think what John Williams and others who were part of that original process thinks now, thinking that it's going to be repeated for another 6 years.
So the work in progress at the moment is to look at other jurisdictions and look at the policy and the regulatory frameworks available in other places. So that will help lead to the options analysis that we will then consult on. So history is not lost to us. We are looking to history as well.
Thank you.
Reminiscing about the old catchment management authority days.
I can't believe I'm saying that.
That's
right.
amazing. They were such good days. Thank you. I've just got one set of questions about, and I think it's for you, Ms. Jones, about dam safety emergency plans. And really, I'm just questioning, does Water New South Wales ever release those plans for the dams that you operate?
So
Mr. George.
Mr.
George,
yes,
perhaps.
Mr. George.
Yes. Do we release those plans ever?
Dam safety emergency plans themselves?
Yeah.
No, not necessarily. So we work obviously closely with combat agencies such as the SES. So there is some information that is publicly available through the SES, such as the inundation maps for dams downstream.
They are.
They can be available, yes,
can be.
through the SES, yes.
Okay, because I'm just curious. So some constituents actually have been trying to access the inundation maps and haven't been able to, or the dam plan has been withheld. And the concerns stated are that, operational, for the reasons that maybe combat agencies and for security reasons.
Correct.
But the inundation plans and maps are generally available, are they?
Yes, you can usually find those on the SES website.
Okay, so at the moment, so if they're not available, would you consider releasing those?
We're happy to take that on advice. I think it depends. Happy to take that on advice.
Because at the moment, Bowral Shire Council is currently considering a residential development, and that would be at risk in a dam emergency. And so there's constituents that are trying really hard to contribute to that process of exhibition, but they can't properly without understanding the downstream impacts in relation to the inundation and the dam that related to the dam plan, the emergency plan.
Yeah, so I'm familiar with the development you're talking about. So in that example, the local government is responsible for producing the inundation maps that relate to development. So when a development like this has come forward, which has just recently, we've provided advice to the council on that development. In that particular instance, we have actually requested or recommended that they develop a flood inundation map for that development, which we would contribute to. So at this point in time, we wouldn't, for instance, be supporting the development in its current form without that flood inundation mapping being done.
And so in relation to the inundation mapping from the Dam Safety Emergency Plan, is that something that you could release to the community so they can have a better understanding, so they can contribute more fulsomely?
think what needs to be appreciated is that they're different things. So the dam safety emergency plans usually refer to catastrophic failure of
I think
infrastructure.
with respect, I do understand that, but I think the community is able to engage at a high level of intelligence and ought to be provided with this kind of material. Would you agree?
That information would be available through the council as the development progresses.
But that's separate to the inundation planning and mapping that you hold under the Dam Safety Emergency Plan.
Yes, and I have confirmed I will take that on advice.
Okay, thank you. Are you aware of the uncontrolled spill at Wingecarribee in 2022?
An uncontrolled spill?
That's, as I understand it, in 2022. And there was no notification to the residents about that as it unfolded. There was a 2022 uncontrolled spill.
I'm not familiar with an uncontrolled spill in 2022 from Wingecarribee. No, it's a gated structure. It would have been a planned or controlled spill, particularly if it was during a
if it was a
rainfall event.
controlled spill then, would residents normally be notified about that? Is that what the dam emergency and safety plan would provide for?
No. So that would have been communicated through the SES as the combat agency if there was a threat to the community or people downstream.
Would it surprise you if members of the community said to you they weren't notified at all about maybe it was a controlled spill? I've been informed it's an uncontrolled spill.
No, it may not necessarily surprise me. I think around New South Wales, the different SES units have different capabilities, and communication varies around the state.
But, so would it concern you if people weren't notified?
It depends on the nature of the spill. I'm not familiar with the particular example that you're referring to.
Would you be able to take on notice and
Absolutely.
find out for us what happened during, apparently it was 2022, that's the detail I have, that I am told that it was an uncontrolled spill and that downstream residents during that were not notified at all.
Sure, I'm happy to take that on notice.
Thank you. As well as the get advice about the release of the inundation, not the ones generated by council, but the ones you hold.
Yes.
Thank you very much.
Thank you. Yeah. Thank you. Ms. Jones, I wanted to go back to, just as we were finishing the previous round of questions, we were talking about McPhillamys. You were saying that they have, as I understand it, applied for a specific purpose access licence. Now, just to be clear, this is because, so DPU Water at the time, in its advice dated the 10th of February 2021, stated that there is insufficient water entitlement available in the Belubula River above Carcoar Dam water source to account for the water take requirements of the project. So it says here that the department states the applicant has acquired 262 unit shares from a total allocation of 264 shares in the Belubula River. Wow, there's only 2 left after they've done that, above Carcoar Dam water source. However, even that amount does not fully account for the project's water take. And the project has a shortfall of around 2,083 megalitres per year. So they've applied for a specific purpose access licence. How are they going to get the extra water?
So the licence was able to be applied for because the previous government made a regulation to allow them to apply. That special purpose access licence is being reviewed by the department at the moment.
The licence is being reviewed? Sorry, just to be clear, they've already applied for it, it's being reviewed, but how are they what are some of the options that they could do? For example, I mean, there's a lot of reasonable amount of water that they've still got to get. A pipeline I've heard a few people talking about, is that right?
I'm not familiar with the pipeline, and I can take on notice your question. The licence is still the application for the licence is still being assessed, so there's not been a decision made.
So when you were saying that just to be clear, the previous government passed a regulation, introduced a regulation, to allow for this particular specific purpose access licence for McPhillamys?
Correct.
And that happens for a number of the different mines, is that right?
I'm not familiar with other mines. I just know that this happened for McPhillamys.
Yeah. When was that?
In April 2022.
And so right now, it's before the department. Is it a public document?
No, I don't believe it is.
So it's a public document. Sorry, it's not a public document, so we don't have any idea. I'm asking you the question here in budget estimates for water budget estimates. We don't have any idea exactly what it is that they're proposing to do to get those additional 2,083 megalitres.
I don't have any detail about that yet, and it's not a public document. It's just been confirmed to me. I'm happy to take a question on notice about it, but yeah.
So can I just check? So sorry, with that, how often does that happen? How long have you been working, Ms. Jones, within the department?
A number of a few years now, but no, that's the only time I've experienced that happening. Yeah.
So in another situation, where, for example, let's take Bowden's lead and silver mine, where they don't have enough water. What do they do if the government doesn't introduce or pass a regulation to enable this specific SPAL? What is it that other mines do? Compared to McPhillamys?
I'm not familiar with Bowden's, but
just as an example,
yeah, it's either purchase water on the market if it's available. Yeah, I'm not across the details.
Sounds like they've got special treatment.
Thank you. Ms. Jones, I just want to finish up on Sid Lambs for a moment. If the projects aren't delivered by that 2026 deadline, what are the consequences of that?
So the consequences are there'll need to be a negotiation with the Commonwealth about funding, because and the consequences would be that that the contribution to the 605 gigalitres may be in at risk.
Yeah, and could that mean potentially that the Commonwealth could buy back the difference between what's been done and that 605 gigalitres?
Well, potentially.
Yeah, okay. And then just in terms of the expert panel report, is that approach just for the Northern Basin communities, or is that intending to be the same approach across other catchments?
So some of the recommendations are about connectivity from the Northern Basin through to the Southern Basin. So it kind of potentially affects both basins.
Okay.
Yeah.
So it just depends on the recommendations.
Yeah.
Okay. I think this one is for you as well, but if it's better directed to someone else, happy for you to advise me. But it's just in relation to the Productivity Commission's review of funding models for local water utilities. And they obviously suggested some fairly major structural reform. I understand that the Minister made some comments at the local government conference about looking at a co-designed model, and consultation expected to begin within the coming months. Is there any update you can provide the committee in relation to that work?
Yes, we're looking at putting out an options paper by the end of the year.
Okay. And is that going to be, will there be a new unit within your department to work on that model, or what will that look like
No,
internally?
it's the existing Metropolitan Utilities unit within the department.
Okay. And so options paper by the end of the year, and then is there any other time frame in terms of development or implementation of a new model? Or
Not at this point, no.
Okay. And is there any additional...
I think the Productivity Commission did make a point about any change would need to have significant engagement of local government, and that would take some time, and the department plans to take that advice.
Okay, and is there any additional funding for that work that you're doing, or is that just being met within your existing budgets?
That piece of work's being done within the department's budget.
Okay, thank you. I have a... Oh, sorry.
The timeless reduction program, however, has been extended to next June, so that is a support program for local water utilities.
Okay, thank you. I think, Ms Pinkstone, these couple will be directed to you, but they're quite high level, so hopefully you can help me. But I just wanted to ask broadly, the government's talked about a $5.1 billion investment in new public housing, and that they're going to prioritise at least half of those homes for victim survivors of family and domestic violence. Do you have any information about how much of that $5.1 billion will be invested in regional areas?
Not at this stage. At the moment, where we have our program 800 odd this year, we're developing out the program for the entire period. That will be reviewed at the end of this year by INSW, and then we'll be able to provide a more detailed breakdown across the years and across the locations.
Okay. Are you being asked by government to consider regional locations as part of that work, though?
Oh, absolutely.
Okay.
Absolutely.
And then in addition, or in a similar vein, I guess the $527.6 million for emergency housing as well, particularly around homelessness support services, and I know some of this has been touched on, but again, is there any breakdown for regional areas, when, where, how, what that will look like?
So what we're doing is that's on top of the existing SHS budget. So we're doing a few things to design how we'll fund that. We've set some money aside to just meet indexation rates. Traditionally, there have been different rates between the Commonwealth and New South Wales. We're setting that at the New South Wales rate. We're looking at the Homelessness Innovation Fund. And we're also looking at the temporary accommodation budget to more clearly align it with the homelessness provision in New South Wales. So our aim through the Homelessness Innovation Fund is to bring forth proposals locally that either address gaps in the service system or can help us move out of hotel and motel accommodation into more supported accommodation options. And that's been designed in consultation with all of the homelessness peaks, and will be open across New South Wales to look at those models. We know there are particular regional areas where there's extra pressures around temporary accommodation, and the Northern Rivers is a really good example of that. So we want to make sure that wherever possible we're looking at those supported models and moving away from motel accommodation. So we will be looking at that across the state and looking at our own data at where those hotspot areas are.
Okay, thank you.
Thank you. Just following on from that, in relation to the data, what are you looking to capture?
In terms of data,
what data can you capture, and what are you looking to capture?
Yeah, so obviously we have data that comes through the specialist homelessness services themselves and who they're seeing and who they're turning away within those services. We also collect data through our temporary accommodation linked to home, so we can see those hotspot areas and the areas where I suppose we're getting the greatest number of requests for assistance. So we overlay both of those. We also look at the census data when that's available. We also look at data that comes from our housing register and where those demand areas are as well. So we look at all of the different data sources, and I suppose for us, we're saying we already know where the turnaway rates are. We already know where we have great demand for temporary accommodation, and so we'll be wanting to make sure that through these procurement processes we're really targeting those need areas.
And where are the current turnaway areas?
Oh look, I mean through SHS services it's everywhere at the moment. I mean the rates are 40% turnaway, so all of our homelessness services, irrespective of client cohort, irrespective of areas, are struggling with the demand.
And do you have a breakdown between metropolitan and regional turnaway rates?
I can certainly take that on notice and get that information for you.
That'd be great. Of that $6.6 billion that's been announced, how much of that is for homelessness?
So it's the 527 on top, yeah.
Yeah. And in that, the Minister indicated this morning that the strategy, the implementation would be drawn out of that 6.6. Does that mean it would be coming out of the 527 million?
At the moment, we have a team that's working on the homelessness strategy within Homes New South Wales, has come over from within the Department of Communities and Justice to work on that strategy for us. And then we'll be looking at the budget as a total for homelessness. That includes our ongoing funding. We've extended our services funding for another 2 years, so there's certainty while we're going through the procurement process. But at the moment, that's being led internally from internal staff resources working on the homelessness strategy.
Just to clarify, there's no line item for the strategy.
I'll take that on notice if there's money to support the sort of modelling work. I'll take that on notice.
And then in relation to the Youth Action Plan, the same thing. Is there any money actually allocated out of that 527 million for implementation of the Youth Action Plan?
We're currently working on that budget allocation. So we've got the money set aside for the HIF. We've got the money set aside to meet the indexation rates. And we're also working with the peaks on how we will break down the money that's existing for particular programs as well. We really wanted to adopt a different approach around how we were working, and that was to say, well, we know that everyone's stretched and at capacity in many of these services, and we want to co-design an approach. We also want to learn from the HIF and see what proposals we get that come forward through that sort of strategy. So I think that while we're leading this process, we've committed that there'd be a homelessness action plan, that would be specifically targeting young people, would be for 2 years so that we can learn and refine our approach as we go. In terms of resourcing, that's being led within Homes New South Wales and the homelessness teams in my area.
And when the strategy is announced at the end of this year, will there be a budget allocated to it?
Well, I suppose the issue that we're looking at is how this money and this funding allocation, that's new money into the system, fits with also the new supply money, because we're looking at new and different models through the new supply, which may also include homelessness responses. So holistically, we need to look at our whole budget and how we are addressing homelessness across the spectrum. So from temporary accommodation through to long-term social housing, the models that we're using there. And we also want the principles of the homelessness strategy to really help us formulate the recontracting approach for SHS services as well when they're due in the next 2 years.
In relation to the Innovation Fund, and I'm mindful the Minister said announcements in the next few weeks, will it allow, and has it been broken down, to be targeted or amount allocated for whether it's Aboriginal controlled organisations, youth, regional areas?
No, we haven't targeted at the moment. We're using this first round to really test some of the ideas. So there'll be a couple of streams within that. One will be about addressing temporary accommodation and moving to more supported crisis models, and the other will be looking at new service innovations and models. And as you've outlined, Aboriginal community controlled models, young people, all of those client cohorts are a priority, and we'll be looking at how the results from that first year and what tweaks we might need to make sure that there's coverage of client cohorts and regions.
And so something like the Together Home program, which runs out next year, or the last tranche, that would be something that would be considered part of the Innovation Fund as opposed to...
Absolutely, rough sleepers and housing first models.
The other is Rent Choice Youth. I'm interested to know how many young people were supported in the last 12 months.
Sure, let me just get that for you. So Rent Choice Youth, 1,021 households.
And do you know how many were Aboriginal?
No, I don't. I can take that on notice and see if we break it down.
And then also by district or region, whichever.
Sure.
And do you have, or do you keep the wait time once an application's been lodged, how long it takes to be responded to or actioned?
I'll take that on notice. I haven't heard of that. We have requirements to review in a certain period of time, but I don't think we keep a record of that.
Was any funding allocated to end street sleeping collaboration in this budget?
No.
Okay. And then my final question is in regards to the Central Youth Agency and whether or not, I suppose, where that's up to and whether or not there's funding been allocated to the rollout of that or how it works.
I wouldn't be able to answer that. That's not in my area of responsibility.
No one can answer from the Central Youth? No?
I think Mr. Tipple's gone.
Yeah, he's gone.
Yeah.
That's all right.
Just when we needed it.
Do you have anything?
Yep. Ms Pinkstone, I'll stick with you for a second. Just with respect to the land audit and the parcels that are transferred across to Homes New South Wales, in identifying a market participant for what may be 50% of those sites, like it is at Kellyville or the like, what's the process that the department's going about in terms of identifying that market participant?
Absolutely. Look, I'll talk about it in theory. In theory, the approach we use. So through the what we're doing at the moment is that we're reviewing all of the sites and the entire program to determine where that would be a project that Homes New South Wales would lead, where it would be a project that a community housing provider would lead with a developer partner. And we're also, I suppose, cognizant of the fact that we have to have funding coming federally, and that's led by community housing providers. So the team are actually modelling out the entire program, and we'll be working through a strategy around why or where Homes New South Wales would lead that, and that can once again go back to the principles of the program. What are we trying to do in terms of unlocking nearby land? Who is the landholder in that area? In some locations it might be a whole of location area and the community housing provider actually manages most of the stock in that area. In some areas it would be us just leading the development. For example, Camden, we will keep that and we will manage that ourselves in Homes New South Wales.
Thank you. And Mr Sharu, I just want to ask you, do you agree with the Minister's assessment that Sydney Water has been a, and I quote, big problem in the delivery of water infrastructure in new housing?
Well, Sydney Water has always been cooperating with all the government agencies on making development happen. I can quote a few numbers. Last year we invested $1.2 billion in growth, which is a significant number. We have processed about 40,000 requests or application or demands from customers and developers. 90% of these requests are actually processed instantly, in the sense that it's an online service, so you get your response straight away. And there's only 1% that has taken about between 4 and 6 weeks in average.
Thank you. And Mr Shrew, when it comes, following the Minister's outline this morning, sort of a change of directions and that she's provided to Sydney Water, what changes have you made internally as a result of the Minister's edicts?
Well, I think that's what I was saying. You know, it's about listening what the government priorities are and making sure that we can support the government in delivering that.
And how has this practically changed in terms of your infrastructure plan and the like, and have you changed your profiling in terms of water delivery?
Well, we have definitely increased the resource and the activity on the development side because there is more development. Therefore, we need to resource the team a bit more than what it was before.
And how's that been applied when it comes to sort of, let's say, infill? So I know in the budget it says that More specifically, Sydney Water is heavily focused on the transport-oriented development program. Have you reprofiled any of your infrastructure spend to those areas rather than necessarily greenfield development?
We have actually added that. So the transport-oriented development, you've got the 8 priority development areas where we can actually provide service without any additional investments. And the additional 31, which is the second stage, where we've got actually very minimal investment or sometimes no investment at all for this new TOTS.
So in terms of that program, how much is Sydney Water investing over the forward estimates to be able to support the new development in those areas?
Look, I'll take the number of notice for the
Indeed. Yep.
infill areas. In total, in the next 10 years, we will be investing something like 17 billion in growth assets.
Yeah. Thank you very much. And with respect to those TOD precincts as well, you mentioned the 31 Tier 2 precincts. Were you asked to consult on the additional 6 that the government outlined when they changed it to 37 precincts?
We have been working closely with planning and other agencies on the TODs, yes.
Thank you very much. Now, if I could ask you as well with respect to specifically that Oxford Gardens development in Ingleburn, why is the approval process for the temporary pumping station taken so long on that project?
Look, I'm probably going to take that on notice, but this development is one of the developments where you've got developers willing to develop a piece of land that is far from the existing infrastructure. So it's always a fine balance between a discussion with the developer and having the developer contributing to the necessary assets rather than having the customers paying for the assets.
Thank you. And in terms of this project, when are you anticipating there being some consent being given to the developers' submitted request for a temporary pumping station at Oxford Gardens?
I will take that on notice, but look, as I said, we're working closely with the developers. We want to make that happen as quickly as possible.
Thank you.
Back to crossbench for 4 minutes.
Yeah, okay. I wanted to go back, Ms Jones, to the questions around the excluded work exemption for mines, and you're aware of what that is again?
I'm not sure what
So excluded work exemption available for mining operations. They capture surface water runoff. That water goes into different dams, essentially is storage. It's not allowed, untreated at least, but not allowed to go back into the water. But it's quite a big form of take, which is the figures that I was reading out to you before. So the question is around, because we are seeing mining expansion, there are expansions of existing coal mines on the books, about 18 or so I understand, plus we know this push around critical minerals, let's say for example in the Central West, Arana region I think it is. What is the department doing? Because the DQ Water has to assess this, but who is looking at the overall supply of water, for example, to the Murray-Darling Basin? These are big areas, these are big volumes of take that I understand are exempt from a water access licence, and it appears to me that they're just assessed in each project singly, and nobody's looking at the whole take. Would that be a fair assumption?
No, so from the water sharing plan's perspective, the take of any licensed holder is taken
this
into account.
This is unlicensed?
Yeah, sorry. I'm not familiar with why that form of take is not, doesn't need to.
Do you think people within your department, within DQ Water, should be perhaps when they're looking at providing advice to planning as to whether to approve these mines, that there are in fact substantial water take issues, including in this excluded work exemption, and possibly there should be some work done to assess the cumulative impact of what's being taken.
So cumulative impact is normally associated with environmental impact. Definitely from a water sharing plan perspective and a water take perspective, any water licence to be taken is absolutely accounted for under the water sharing plan. But the unlicensed form of this take,
because it's rainfall, it's runoff and rainfall that essentially
and reheld on site.
Because yes, they don't need a water access licence. You
Right.
see what I'm saying? Is
Yeah.
that a policy gap there potentially in terms of measuring the amount of water that's taken?
I'm happy to take a questional notice about it. I don't think so, but let's confirm that in writing.
Okay, Ms. Pingstone, can I ask you a question about community housing providers? That's directed to you, I think. Yes. In 30 seconds I have left. What steps is the government taking to improve oversight and accountability of community housing providers? This is after the National Regulatory System for Community Housing has been criticised for its limited enforcement powers, particularly in terms of effective management, maintenance standards and tenants' rights.
So in terms of the community housing sector, Homes New South Wales is responsible for the contract management. So there's two streams, I suppose, in terms of oversight. There is the regulatory scheme, and that looks at the overall operations against the regulatory framework. And then there's a contract management approach, and that contract management approach sits within Homes New South Wales, and that's making sure that all community housing providers are meeting the terms of their contract with us and the lease agreement, and that includes maintenance standards and tenancy management.
4 minutes for the opposition.
Thank you.
Mr. Farlow?
Ms. Pinkstone, just wanting to finish off. In terms of the replacement homes program, or the 2,200 replacement homes, how many of those will be Aboriginal Housing Office homes? Do you have any figures for that?
Let me have a look for you. So the total targets for new supply for the AHO are 543 homes.
Yep. And how many of those are replacement homes, do you know?
I can take that on notice for you.
That'd be great. Thank you very much. And Mr. Shrew, Wallandilly Council advised that Sydney Water previously made an undertaking to deliver capacity this year at the Wilton Growth Area for 4,000 additional dwellings through the upgrade of the Bingara Gorge wastewater treatment plant. When do we now anticipate that capacity there at Bingara will be delivered?
I'll take the exact date on notice, if I may. We're working closely in this area to make sure that development can happen, and this is ongoing.
Okay. So the date will be taken on notice with respect to that? Yep. And when will the Upper Nepean Advanced Water Recycling Centre offer capacity to service Wilton?
So the Upper Nepean Advanced Water Recycling Centre is in the planning phase. Currently, we're talking about a commissioning in 2032.
Okay. And similarly, as you no doubt are aware, wastewater is being trucked out of Wilton by Sydney Water. In May, Wallandilly said that Sydney Water had advised that their capacity there was for 400 additional dwellings. As of today's date, how many more dwellings is Sydney Water able to service at Wilton?
I will need to take that on notice.
Thank you. Also, Wallandilly Council advised that they have approximately 480 development applications on the books for assessment, and the government's 5-year housing target is 5,000 new dwellings in that LGA. A portion of these will be in the Walker Corporation Appin development. What's Sydney Water's role in relation to water and wastewater at Appin?
So we are working closely with Walker Corporations and trying to find a solution that's best for the developers and the community. So it's one of the development that has been brought forward by a very long time. So it's quite a distance from the existing assets. So we're talking with the developers on what's the best way to service the development.
And how will that impact the other water programs you have in the area that are still yet to be rolled out?
Well, that's why we're discussing with the developers.
Okay. Sorry. I think that might be it for you, Mr. Shrew. Oh, actually, sorry. Let's say with the 52 seconds, I might return to Willoughby. In terms of Willoughby, what support and communication has been provided to the affected schools, teachers, students and residents? And is there a plan to involve them in finding a long-term solution to the problem at South Creek in Willoughby?
So there's a lot of engagements ongoing with the community, as we do on all our sites. So if I can come back with a very detailed list of engagement that has been done, but we always engage with our customers and the community on every one of our activity when it impacts the community.
Thank you very much. I think we'll give you a 10-second early. Right?
Very generous. Are there any government questions?
Oh.
No? Okay, great. Well, that concludes today's hearing. Thank you all for being here throughout the day. The Secretariat will be in touch shortly in relation to any questions taken on notice or supplementary questions, but we thank you for your time. Thank you.
Thank you.